சொல்லுங்க. இந்தாங்க. சரி சரி. ஏமாட்டா
I asked her for another table. I asked her for another table. Table. We'll ask Nagarajana or we'll bring that preclinical table. Huh? Preclinical table. Here, they'll take this table and இது அங்க போயிடும் அது இங்க வந்து unnecessary there, but for food and all, no, exam time we need that table. Additionally, we have to bring IQS நிறைய table இருக்கு. I asked one from IQS. துர்கா முன்னாடி 2 table.
Okay. So I think we have more participants who are joining. Hello, Dr. Rajiv.
Yeah, hello. Am I audible?
Yes, sir. Yes, sir.
Yeah. 1 second. Just hold on. So, good morning, everyone.
So first, and I think we have more participants. Do we have more participants, Dr. Sanya? Are they connecting with us? Should we wait for the other participants to join, or shall we give it a start?
No, no, we have some more participants actually. They're asking for the link, so they will join. Just let's wait for like 15 minutes because there are people who are joining.
Okay, no problem. No
Let's
problem.
start. Let's start with the introduction part. And whenever you find that the students are everybody were in, then we can go with PPT presentation.
So we might start at 9:10, like 1 or 2 minutes. We can wait so that
Yes,
we
yes.
can have. Once I'll
Yes.
be having a trial also
Yes.
for the presentation.
Yeah. Okay, sure.
I'm disabled to share the presentation. Yeah.
Gagan, I have made you the host now.
Okay, ma'am. Okay. So I think
So
everybody.
now, okay, so now you are the host, okay? And Nisha ma'am is the co-host. I am not. So whenever you want something to be done by me, just switch on the co-host to me. Okay?
No, I'll do that priorly only because.
हाँ कोई बात नहीं
Everything,
होगा
no?
ठीक है
Okay.
अभी people are joining, okay, so just let's give 5-10 minutes more.
Okay, no problem. We can
No,
start
no,
up
we
after
are.
Yes, sir.
I'm trying to just give the introduction part, which can be like revised again in this 1 hour in the PPT. So
Okay.
we
First, I
have.
Good
think.
morning. Good morning,
Good
Dr.
morning.
Rajiv. What
Good morning, sir.
others are saying, that introduction also should not be missed by the participants.
Exactly.
Sure, sure.
Exactly.
We have only 1 hour of lecture, so that's what.
No,
So,
lecture all is yours. Today's is
sure,
your
sir.
day. Okay.
Yes, sir. We can go ahead, sir.
All the best.
Sure, sir. Thank you, sir.
I hope everybody is there with us and would have loved the yesterday's sessions and the yesterday's event. So, can I have some feedbacks and some responses from the viewers about the yesterday's event? Can I have some feedbacks? Or else everybody is there in a dizzy mode. Okay, so I've got one reply. Thank you so much. Can I have the others also replying back with us? Okay, that's really nice. That's really nice. So I can see that the last day's session has been quite very well enjoyed. So thank you so much, and I hope we'll be continuing with the same spirit for today also. That's really best. At the end, after the event also, discussing about the presentations, and I think everybody did really well, and judging out of them was becoming a quite difficult task. It was quite tacky for us only to judge the best ones because everybody was best in their part. So thank you so much that you have enjoyed every moment of the last day. So I hope with the same spirit we'll be continuing for the today's session also. So we'll wait for the few participants to join. Thank you, Dr. Sara. Yes, this virtual time has become a very tough time for us to connect with other people and connect with you all. But still, these platforms like Zoom, Google Meet, and everything has turned our lives actually, and they have made us, meet each other, that to with faces, and it doesn't give you much, feel of that you are not like into touch with the people. So yes, these virtual platforms has helped us, but still we are actually waiting. We are very much excited that as soon as this pandemic gets over, we'll be continuing with the events, as well as we'll be meeting you all in person also. Exactly. Thank you. So I'll have the trial of the presentation once, so that
Sure.
you can see. You can see the presentation, right?
Yes. It's good morning. Sorry, I have my old PPT. It's fine.
No problem, sir. Actually, you are there with us. We only require all your knowledge and everything. That's quite
Thank you very
valuable, Okay, so yeah, I'll be playing it well.
Yeah,
So,
actually, we'll be missing some unimportant slides when we go to the subject.
okay.
So don't worry. But actually, most of the knowledge that I on trichology, I'll give you in 45 minutes. So
Okay, sir.
I'll be giving you an outline of trichology and how the industry is booming, especially the scald diseases.
Exactly.
So when we go in, we'll get to know.
Do that.
Right? Yeah.
Yes. Dr. Sanya, kindly coordinate with me whenever we have to start. Just give me a call so that I can give the head start.
Gagandeep,
Sure, sure. I think we can start in like next 2 minutes. That's okay.
Gagandeep, we can give 1.5 hours to Dr. Rajiv.
Okay, so we can shift off whole of the schedule. No problem.
Okay. Dr. Venkatesh will reduce his session.
Ma'am, actually, we have already 2 slots set for Dr. Rajiv.
Okay,
So,
okay.
yes, exactly. His demand, he is there in our demand. So we have slotted him for 2 hours consecutively. Like, we are having few participants right now. We'll be having Dr. Rajiv again at I think 12 we have.
Okay.
So I would request every participant that Dr. Rajiv, we are going to have a literally power pack session. So kindly stay tuned and even ask all your co-fellows also to join a bit faster.
Dr. Sanya, shall we start?
Yeah, Dr. Rajiv, you can start.
Okay.
So am I audible and clear?
Yeah, very clear.
Yeah, sure.
So shall I take about a minute? So am I audible?
Yes, go ahead. That's
Okay.
fine.
So since it's the startup with the second day of Dentons 3-in-1 virtual conference, since it's the start of the second day of the Dentrance 3-in-1 virtual conference, so we have on the opening of the event, Dr. Rajiv, who are going to have a power pack session on the topic trichology. So speaking about the speaker, Dr. Rajiv is a BDS from Government Dental College, Hyderabad. He is a PGDDC from SS University, Australia. He is also PDGMT from Greifswald University, Germany. He is also an AAI instructor, Phoenix, USA. He is a renowned consultant, cosmetologist and trichologist and a facial aesthetic. Practicing since 6 years, is an expert and has immense knowledge on cosmatodermat procedures and trichology. He has worked as cosmetology head for many corporate centers which were leading in South India. So I forward the stage towards Dr. Rajiv, and so we can go ahead with the session. And it's a request to every participant to kindly keep your mics muted and can have your videos on. And as well as this session is actually going to be a power pack, so kindly stay tuned with it.
Shall I go ahead?
Yes, sir.
Yeah. Hi, good morning, everyone. So happy to see all the dentists over here. So I was practicing since 6 years. So the career, how I entered into the field is through to trichology. So the first I have done my trichology. So once I have gone into trichology, after seeing my results, people have asked me like, cosmetic processes, then I was into it. So now coming to the trichology, what does trichology actually mean? Like, it's all about studying of hair and scalp diseases. So now coming to the, I just want to turn off my video. So yeah, now I just want to discuss few things about what were involved in the trichology and what are the treatments that we proceed and what are the, how to differentiate the scalp diseases and what are the main patients or clients that approach these trichology or cosmetology centers. So now coming to the first part is what are the main keynotes that you have to I request everyone to take a notes. So I'll be going a little bit fast as we have no time. So whatever I want to say, you can have, but surely at the end of the lecture, you will have a complete idea. So now I'm going like, what are the things that you have to get an idea while you are treating hair. The first thing is you have to have an immense knowledge of hair cycle, how hair reacts. And the second one, Talagen effluvium. So, and the third one, androgenic alopecia. So you have, and the fourth one, alopecia areata. So at this point, these are the main things that you find you find patients in the cosmetology or trichology centers. So the first one is Talagen effluvium. So Talagen effluvium, I'll give a short introduction and then we'll proceed into the slides. So Talagen effluvium is nothing but you find a sudden hair fall within 6 months. You find 70% of the hair loss in 6 months. It might be due to the stress, or it might be due to any strain, or it might be due to the medical conditions, or it might be due to several factors. So severe illness or anything. So in this Talagen effluvium, you find a diffuse hair fall, and you find a hair thinning all over the scalp. So this is Talagen effluvium. So next, coming to the androgenic alopecia. Androgenic alopecia is nothing but it is a kind of autoimmune disease. So where DHT takes a main role in it. So testosterone is the testosterone. We have a hormones which are which functions this prostate glands, seminal vesicles, skin, hair, uh, hair follicles, and many other things, especially related to the yeah, we'll have the video presentation on, but after this introduction. Okay, so most of this androgens like DHT, dihydrotestosterone, and testosterone are androgens, and these are responsible for masculinity, and these are responsible for male sexual hormones, and these are responsible for male body hormones, and these are responsible for hirsutism also. So at this point, what happens exactly in androgenic alopecia is these androgens takes a role. So there is a hormone called dihydrotestosterone, and there is a hormone called testosterone. So if the testosterone hormone level is normal, you don't find any disease or baldness. If the dihydrotestosterone dihydrotestosterone is abnormal, then you find these conditions like androgenic alopecia. So what happens here is a simple concept. So there is enzyme called 5-alpha reductase. Actually, this 5-alpha reductase catalyzes the testosterone, and the testosterone is converted into dihydrotestosterone. So testosterone is in normal amount is good, but excessive conversion of testosterone into dihydrotestosterone results to baldness. A simple concept is this. A simple concept of androgenic alopecia, or getting bald, or getting different classifications, or different kind of baldness. So now actually dihydrotestosterone is a powerful androgen. See, in excess of dihydrotestosterone, there are several functions, but when it comes to hair, it is not the conversion of testosterone into dihydrotestosterone is not good. So get ready with PPT, Dr. Gagandeep. So now the next one is in androgenic alopecia. What you find a classified there is a particular patterns for the hair loss. So you might have noticed your fathers, or you might have noticed your brothers. You find a bald head on the crown region, and you find a bald head on the vertex region. You find a baldness in the temporal regions, and you find hair you find the recession of the hairline. So all this comes under Norwood classification, and all this comes under androgenic alopecia. So now I think you got some idea about telogen efflume. So now we'll differentiate the telogen efflume and differentiate the androgenic alopecia. So how to differentiate it? So if it is in telogen efflume, so you find overall hair fall, but the hairline recedes the same. And when you take the history of the patient, obviously the patient says that doctor, the patient complains that doctor, I have this hair fall since 6 months. So before 6 months, I have a heavy hair. Since 6 months, I was noticing heavy hair fall. So most of these conditions you can find in guys, especially in women who are entering into menopause or who are in pregnancy, and people who get affected with typhoid, who severe salmonella typhi infections, and maybe people who have undergone these chemotherapy sessions, and people who were in so stress. And I find youngsters now, 85% of people who were going to this baldness are going into telogen efflume because of the stress in their own professions. So now coming to the androgenic alopecia. Androgenic alopecia is a slow process. It goes on increasing starting from 23 age, and it goes on increasing to recede the hairline, and it goes in a pattern. So this is how you have to differentiate. Now coming to the alopecia areata. So alopecia areata is nothing but, your own body thinks that the hair is dangerous to you. It means like it is it is related to the immune system. If your immune system is strong, what does it do? It thinks that the hair is an external foreign body. Obviously, when a foreign body comes to approaches the skin, it obviously pushes out. it heals and pushes out. There was a process of healing and everything. But in this case, the hair follicle, the blood, the immune system thinks that the hair is causing some kind of damage to the body, so it pushes away. So most probably the hair is removed in clumps. So you can find some patients with the patches all over, with the bald patches all over the scalp. If it is a single patch, it starts with a single patch which is monofollicular, and it enters into multifollicular. So once it enters into multifollicular, it keeps on proceeding and it affects the entire scalp if not treated. Okay, fine. Now going to the PPT. So I hope you guys are clear with my proceedings till now. So the next slide, Gagandeep, you have to be active now. So why should cosmetologists learn about hair? So go to the next slide. So here, actually, the first thing is, if you don't have an idea of hair, how the hair cycle and what, now I find some institutes, they have this 5 days hands-on course where once they go there, they just show that these are the treatments that you have to do for hair thinning or something. But at the end, if you don't know how the hair cycle, how the hair reacts and how the hair grows and what is the mechanism of hair growth, you're obviously obviously you can't explain much, and you'll be scared of doing the procedures also. And it is like, you're doing like dumb. So you just do a PRP, you get a result. But once you start a PRP, obviously you find you notice some kind of hair fall, which you don't find, if you don't know the reason why the hair fall happens, obviously the patient sits on your head. So, and one more thing, when you enter into this cosmetology field, you have to be thorough with the subject, even though you're a dentist, even though you're a dermatologist, or even though you're anyone. Because patients now are Googling everything. They Google it, they have a complete idea, and if you are not according to them, so they have all the subject, they talk about DHT, they talk about finasteride, they talk about several things. But if you're not able to explain all those things, then your credibility decreases and the patient never get the treatment done. And one patient is equal to 100 patients for me. So when I was into practice, so I literally give result within 1 month. My consultation gives with my consultation, the patient never goes back. So this is the projection that you have to do. See, when you enter into the field, you have to project such that this guy is a dermatologist. So he has an immense knowledge. This is what you have to project. And how does you acquire this? Once you get thorough with the subject. This is why theory is always important. I don't rely much on the cosmetology processes. I rely much on the theory aspects, and I rely much on the medications, because whatever procedures that I do, definitely my pharmacological aspect in dermat or in any of the things give an immense result, give best results to the patient. It enhances this result. And now the human hair is divided into root and shaft. Can you go to the next image? Yeah, the root is embedded below the epidermis, and the shaft is yeah. Hello, am I audible?
Yes, sir. So you mute again.
So now, coming to the, can you, 1 second, I have an issue, sorry. Yeah. So now can you go to the next slide? So my teaching is a little bit different. Kindly, by the end, I'll give you some idea. So now coming to the hair. So you have seen a papilla over here. So you guys can zoom it. So the underlying to the epidermis is root. The above is shaft. So now coming to the root. So we'll discuss about this. So you find follicle here, you find root here, you find oil glands here, you find bulb here, you find papilla here. And one more thing is missing, erectile papillary muscle, which will go into the color image. So now coming to the root, right? it is a part of the hair that lies in the follicle, obviously. So papilla, it is where the new hair develops. So can you just go to the next slide once? Next. Yeah. So now coming to these here. Now you can see dermal papilla over here. You can see the connection of vascularity to the dermal papilla over here, and a hair bulb in the follicle and a hair root in the follicle. So you can find such sebaceous glands attached to that, and you can find, see, whatever I discuss with acne, you have to put this in the mind. So this image is so useful for you guys. So you can find the erector pillae muscle. This you find these goosebumps, right? The goosebumps happen when this erector pillae muscle contracts, and you find the sweat glands and you find the vascularity. So in dermal papillae, you have a dermal papilla over here. So this dermal papillae is connected, is a way, is the nutrition that, so dermal papillae provides nutrition to the scalp. So all the nutrition comes from the dermal papillae, and the follicle is attached to the dermal papillae. So now you have some idea regarding this, right? So now go to the back slide where we are. So I don't want to read all these things. Can you go to the next? Wait. Yeah. So can you go to the middle slide once? Sorry. Yeah. So you can find shaft. Shaft is divided. Shaft has 3 layers, which is medulla, cortex, and medulla, cuticle, and cortex. So now coming to the medulla, now coming to the cuticle. Cuticle is the outermost layer, which gives shiny and glossy appearance. Go to the before slide. Yeah. Now you can see here. So cuticle is a transparent scale-like cells which protects the inner structure of the hair. So it creates shines and smoothness to the smoothness to the cuticle. So now it is an outermost layer, and you have an innermost layer, which is cortex. Cortex has a proteins in it, and cortex gives color to the hair, and 90% of the weight is beared by cortex. So what is the pigment that you have in the hair, which is it is melanin. So whatever color you are observing on the hair is produced in the cortex, and you have an innermost layer, which is medulla. And medulla, you don't it is like, you know, in medulla keratinization of cells happens, and it is not that important, and knowing about this is not important. Only the mechanism that is happening inside the epidermis is important. So next. So coming to the next, yeah, we have already discussed cuticle. Yeah. So now hair growth. Go to the next slide. So you have a vellus hair and you have a terminal hair. Vellus hair you find in the eyebrows and eyelids, and you find a bald people with complete bald patch. You guys will comment, right? Like it is a playground. You find small kind of hair. You find small kind of hair that resembles the eyelids or eyebrows. So those are vellus hair. Actually, terminal hair. What is terminal hair? Terminal hair is nothing but, you know, terminal hair is deeper, and you have an attachment. We are discussing about the dermal papilla, right? So it attaches to the dermal papilla, and this vellus hair, it is very superficial. The depth of vellus hair is at 1 or 2 mm, but the depth of vellus hair would go to up to 4 to 4 mm mostly. So now vellus hair and terminal hair. So in how does this vellus hair appears on the baldness? See, this terminal hair is converted into vellus hair slowly by a process of and this process is called miniaturization. So I was giving an idea. So this terminal hair, when after repeated cycles, and if untreated, it goes from terminal hair to vellus hair. You can find hair thinning, right? If you see a patient, you can find the hair thinning. So this hair thinning is like, you know, this hair thinning is a process of transforming terminal hair into vellus hair on the scalp. So I'll discuss this also in later part. That will be more idea. So you can go to the before slide. So now vellus hair. Vellus hair is a short, fine, unpigmented, downy appearance on parts of the body that normally considered hair, mostly in the forehead and eyelids, bald scalp. So almost never which has a medulla, which helps with the evaporation of perspiration. Women normally retain 55% more vellus hair than men. And terminal hair is a long, coarse, pigmented hair found in the scalp, legs, arms, and body of the both males and females. Yeah. So now coming to the hair growth cycle. Go to the image of hair growth cycle. Not this. So now hair cycle, the next one. Go ahead like this, you can find this image. Yeah. So the hair cycle is divided into anagen phase, catagen phase, telogen phase. Before coming to that theory, let's go into the into what happens with the hair and how it grows. So actually the life cycle of the hair is almost all 7 years. So in that 7 years, suppose if a baby is born, a new hair is erupted. So it stays for almost all 7 years, 5 to 7 years. We have to say that it is 5 to 7 years. So the first phase of the follicle that is coming, it comes from dermal papilla. It comes from the bulb, and this bulb is attached to the dermal papilla. And this, in turn, the dermal papilla gives nutrition to the bulb. So from bulb, the follicle comes out. So once it comes out, if you start from that time, it is the first stage is anagen phase. So in anagen phase, what it stays for almost all 5 years. So once this anagen phase completed, the hair follicles start to shed out. So the shedding process happens in 2 years. It might be happens in 1 month. It might be happens in 6 months. It might be happening in one year or 2 years also. So that is why you say it is 7 years. And this anagen phase, whenever anagen phase is converted, is entering into transition phase. So it tries to get away from the dermal papillae, and it shrinks, and it goes little bit, whenever it goes on shrinking, it is totally disconnecting with dermal papillae. So this is transition phase, and it is almost all the follicle stays there for almost all 1 to 2 weeks. So it was an image, but it stays there for almost all 1 month, and after 1 month it transforms into resting phase. See, anagen phase is growing phase, where the hair follicle grows for almost all 1 to 2.5 centimeters in 1 to 1.25 centimeters per month. The hair growth is 1.25 centimeters. If the hair is growing, it is in anagen phase. If the hair is not growing, it is not in anagen phase. So after the completion of the anagen cycle, anagen phase, it enters into transition phase, where it stays for 1 month. So after completion of this 1 month stage, it enters into telogen phase. This telogen phase is nothing but resting phase. So in this, you find the dermal papilla is completely detached from the follicle. It is completely separated from the follicle, and obviously it takes 2 to 6 months to shed out. So when does it shed out? How does it shed out? So if the patient is in normal condition, obviously once this dermal papilla, you have a bulb and dermal papilla kind of thing, right? So there, once the anagen phase follicle enters into transition phase and get detached into telogen phase, there is a new follicle that is coming out from the dermal papillae, from the bulb. So this new follicle is nothing but again the anagen phase follicle starts in the last image. You can see that. So once it is starting out, it is pushing the follicle out. So it is pushing the follicle out, and the follicle comes out. So this is how the shedding takes place. If it is in healthy person, it takes place in 2 to 4 months. If you start treating it, if you start a procedure like PRP or treatment, any of the treatment part, so like injecting PRP or injecting mesotherapy in this region, obviously the new follicle that is coming out, it comes in a time. So it grows faster, and obviously it pushes the follicle out and it comes out. So this happens with all your hundreds of hair. So this I'm talking about a single hair strand. Imagine how many follicles are shedding out in order to see the visible scalp or baldness. So as it has in multiple phases, this is very important for you to know. This is the main concept that you have to learn, what happens with the hair structure. Okay, so now what happens in this process? So actually, dihydrotestosterone and testosterone and 5-alpha reductase, we have to know about three enzymes. These three things. So what is the enzyme that catalyzes the testosterone into dihydrotestosterone? 5-alpha reductase. So our main motive should be, so what happens if the 5-alpha reductase enzyme is active? Automatically it doesn't allow the hair to grow out. So it completely plays a role in this mechanism and doesn't allow the hair to grow. So in order to regulate this dihydrotestosterone, all the medications and treatments the treatments has to be done. So obviously, if you are inhibiting this 5-alpha reductase enzyme, so if you're inhibiting it, obviously you find a hair growth. So how is it inhibited? Through treatments. What are those treatments? The medical management, and the medical management is nothing but you give medications. We'll go in, and I divide the hair treatment, I divide hair regrowth into three things. The first one is medical management, and I give equal importance and respect to three of them. So the medical management includes medications, and the next one, treatments include PRP, and so it goes on. And the next one is surgical aspect. What are the surgical aspects? Like, hair transplantation. So now going to the before slides. I hope you were clear. I am going a little bit fast, but my intention is to teach you. Now coming to the anagen phase. Anagen phase, yeah. Each strand of the hair on the human body is at its own stage of development. Once the cycle is completed, it restarts and new strand of hair begins to form. The rate of speed of hair growth is about 1.25 centimeters or 0.5 inches per month, or about 15 centimeters or 6 inches per year. The next one. So anagen phase. The anagen phase is known as growth phase. This is a phase where the hair physically grows approximately 1 centimeter per month. It begins in the papilla and can last for 2 to 6 years. So I'll say you remember this word 2 to 6 years. I'll say you in the later thing. The longer the hair stays in the anagen phase, the longer it will grow. So during this phase, the cells in the papilla divide to produce new hair fibers, and the hair buries itself into deeper layers of the skin to nourish the strand. So I said you right, transformation of terminal hair into vellus hair. What happens if the terminal hair is forming? It goes deep into the dermal papilla, it goes inwards to achieve nutrition from the dermal papilla or from the vascularity. When it comes to cycle, from growing from anagen phase to catagen phase and telogen phase, the hair follicle is coming out. So when it is growing in anagen phase, it is going downwards and upwards also. But coming to the catagen phase, it is going up. And telogen phase, no connection. The hair will be shed. If you pluck the hair, so whenever you notice the patients coming to you and saying that, doctor, I find the hair is falling out from the bulb, but actually it is not the bulb. You find a white color substance at the end. So whenever they notice, they find it. So it is nothing but the hair cycle have been completed, and the telogen phase, it is in telogen phase follicle. The next one. You can see the cycle. I think you might have. No, we can go to the other topics because I'm giving some kind of idea. So catagen phase. Catagen phase, also known as transitional phase, allows the follicle to sense, renew itself. During this time, which lasts about 2 weeks, the hair follicle shrinks due to the disintegration, and the papilla detaches and rests. cutting the hair strand off from its nourishing blood supply. Signals sent out by the body determine when the anagen phase ends and when the catagen phase ends. So the next, so I think okay, we can go ahead. The first session of it is not, I have already discussed. Can you just go ahead? Next. Yeah, here we have already seen it, right? So here the erector muscle is involved in goosebumps, and you can see the hair bulb, right? And you can see the hair papilla also, and you can see the dermal papilla, which is nothing but derma papillae, and you find the sebaceous glands. So here the sebaceous glands, this sebaceous glands is responsible for producing serum, where in turn excessive sebum production during the menstruation or in some patients causes acne due to the accumulation of bacteria called acne vulgaris, that we can discuss further. So acne, now telogen effluvium. Telogen effluvium is a form of temporary hair loss that usually happens after stress, a shock or a traumatic event. It usually occurs on the top of the scalp, and telogen effluvium is different from the hair loss disorder called alopecia areata or androgenic alopecia. Next, because hairs that enter into the telogen phase rest in place for 2 to 4 months before falling out, you may notice any hair loss until 2 to 4 months after the event that caused the problem. So telogen effluvium rarely lasts longer than 6 months, although in some cases it lasts longer. So the next, now coming to the telogen effluvium, what happens? You can go with the first slide of telogen effluvium. So what happens with the telogen effluvium? So they can read it, right? So now coming to the telogen effluvium, what happens with the telogen effluvium? See, there is sudden transformation of follicles from anagen phase to catagen phase. Sorry, telogen phase. So there is sudden transformation. Suppose if you find a guy who loves a girl a lot. So once she leaves him, so I was just giving an example to give you a clear-cut idea. So once he leaves him, so he might be addicted to alcohol, he might be addicted to smoking. See, I am not talking about all the men who does it, but I am talking to very, few of the people who does this. So it is almost all, whenever they have this, they don't eat much, so that you don't find much nutrition to the body, and they were in so stress. And obviously, when you take this alcohol, the immune response and the metabolic activities get reduced. So whenever these metabolism from the liver get reduced, so the conversions of vitamins and minerals doesn't happen. So obviously, when you are in so stress, so the metabolisms that are doing in the body thinks that I have to make this man survive. So suppose if 10 mg of biotin every day is required for the hair nutrition, and you have only 15 mg of biotin that is produced from liver. So I'm just giving an assumptions. So this 15 mg of biotin, suppose if the requirement of biotin is 50 mg for the entire body per day, and the production is only 15 mg. So whenever this 15 mg is released, the body thinks that the body thinks that the hair is least priority for them. So I have to survive him. I have to survive my body. So in order that it produces, it distributes all the 15 mg that is produced to different parts of the body except to the hair. So all the nutrition that is produced to the hair goes down. So this is how all the differences happens. So obviously you don't find much production, and whenever you don't have this, whenever your body is not functioning normal, obviously the hormonal changes takes place, and this conversion of dihydrotestosterone to testosterone might happen or may not be happen, but the anagen phase is transformed into catagen phase. Suppose if the anagen phase follicles are suppose the follicle has 2 years of lifetime, so it is in anagen phase, right? Some have in some are in 3 years, some are in 1 year, some are in 2 years, or some are in 5 years. So all these enters, all the 5 years old follicles and 1 year old follicles enters into telogen phase, and there is lot of shedding of hair. So you might notice 70% of the hair fall. So once this hair is once all this hair is shed out, so the patient complains to you coming out that, doctor, I was noticing a bump of hair that is losing out, and I find it in the bath. I find it when I am bathing. When I am bathing, I find hair all over my body. And the next one, whenever I'm sleeping on the bed, when I woke up, I find lot of 100 to 200 follicles that are the 100 to 200 follicles. I notice 100 to 200 hair fall per day, but it is actually not 100 to 200 that he sees on the bed. It is like, it is never ending process. It keeps on. In the morning time, when you bath, the hair he notices the hair, and when he sleeps, he notices the hair. The rest of shedding hair he doesn't notices. That is how within 3 months he goes into depression, like hair thinning. So then he suddenly comes to a clinic stating that since before 3 months or 4 months I am good. After 4 months I have this hair fall and I have this hair thinning. Now what should I do? I am tensed. At this stage, why I was explaining about telogen FUM is, you have to know the medical condition what he is, and you have to ask the history, and according to that, how much result of output you can give to that patient. So if it is freshly gone hair, obviously the follicles are inactive, follicles are active. So what you have to do is the treatment really helps at this stage. And if they prolong for almost all 2 years, the treatment, the prognosis is little bit poor. Whenever the age of the baldness goes on, the prognosis becomes little bit poor. So this is how. So whenever the follicles whenever the bulb or whenever these hormones are active, when you give these medications or when you give these treatments, obviously you find more kind of results. So so this is the concept of telogen FUM. So you have to be cautious whether you are dealing with telogen FUM or androgenic alopecia. Just 1 second, I'll take water. Yeah, next slide. Yeah, hold on. Effects of hair. See, when I say about a cosmetologist or clinical cosmetologist or trichologist, I never deal with hair straightening or something. So I don't advise also. There are some chemicals, we have this this innermost layer, right? In a innermost layer, which is medulla, right? Whenever you have this hydrogen or sulfide or some kind of chemicals, which in turn, if they are applied on the skin, on the scalp, so what happens is it gives a destruction to the hair. See, the texture of the hair will be lost. Even it destructs the outermost layer, which is cuticle. So a weaker hair, and you find a hair fall also. So I never advise anything. But people who have this rough hair or feeling this, I just advise Matrix Biocare, because that I use it. As I use it for a smoother hair, I give it to my patients. But whatever they ask, like, doctor, I want to do this keratin treatment, I want to do this salon treatment, does it help? Then I literally yell at them. I literally say that doesn't help. So there was a lot of bluff that was going in the industry. That is why if one hair client, if you give them result, he'll bring you almost all many clients. Whenever you start your cosmetology career or trichology career, obviously you find the first one entering into your clinic is hair client. And the appreciations that see, I was into this position only because of hair, because of trichology. As I have done trichology, I get very good result. So my people appreciated me. have built me up interest, because I never want to do a clinical cosmetology, but I completely converted into clinical cosmetology. I go to a consultation for 6 to 7 clinics, and I have my own setup also. So now coming to the alopecia. So alopecia is defined as absence or loss of hair. It is a chronic disorder secondary to the disease of either the hair follicle, hair shaft, or the hair or the scalp. Now coming to the alopecia, and now coming to the diabetes. So see, I relate things. So diabetes is an autoimmune disease. Thyroid issues, or hyperthyroid or hypothyroid, is an autoimmune disease. So there are several autoimmune diseases, right? You might have known. So all these several autoimmune diseases can be maintained. They cannot be treated permanently. The same way, alopecia is a kind of autoimmune disease. So where hormonal changes are involved. So the dihydrotestosterone, testosterone, all these things were involved. So when these are involved, you can maintain the hair growth. You can't rectify it. You can't rectify it completely. So you can. So I might have heard some people, some doctors have doing PRP here. So this PRP, when you do it, when you approach this PRP, when you do this PRP, obviously, you know, the hair regrowth takes place, but it is not permanent. It is just a maintenance therapy. So all these cosmeto-dermat procedures are maintained. It is, as they are expensive, they has to be maintained. There is no permanent solution for that. Next. Am I going okay, Dr. Gagandeep?
Yes, sir, that's perfectly fine.
Yeah, I just want to have a little bit. Yeah. So no, I said you right. I have a problem of. So now coming to the pseudo alopecia. How much time is left? How much time you are giving more?
You can
Half
go
an
about. You can go about with it like for 15-20 minutes, and we can continue the same presentation in the next slot also.
So now coming to the pseudo alopecia. Pseudo alopecia is nothing but it is an acute or chronic breakage of hair due to congenital or acquired hair shaft abnormalities secondary to trauma or chemicals. The same thing, one of the doctor have asked a query. So it is characterized clinically by unintended short hair. So here, whenever you use these chemicals or whenever you use these things, so it goes little bit, it affects through the hair shaft. It affects through the hair shaft. It doesn't go that deeper, but mostly people say that, you know, this shampoo, when I was using this shampoo, I have this lot of hair fall, but I never accept that. Next one. So classification of androgenic alopecia. So there are different types of alopecia. So alopecia areata we discussed. So androgenic alopecia we discussed. Differentiation between alopecia areata, talogenepium, and androgenic alopecia is: talogenepium, you have an entire scalp region except the temporal regions, except the, you know, the crown region, the parietal region, the frontal region are involved in talogenepium. So you find a diffuse hair fall. And after that, when it comes to androgenic alopecia, either you find the frontal regions as baldness, or you find a vertex region or nothing but crown region as a defect. And you know, you find a pattern growing from temporal regions to the mid parietal suture. So this is how the hair fall takes place in a pattern. And you find some kind of hair, you know, I have a lecturer, you know, I used to comment. So you find, see, whenever when we start criticizing our staff, like, you know, it is not criticizing, commenting the staff from the childhood. The first thing is, when you have a bald teacher, obviously everyone comments. So you can find some bald teachers with, you know, bald people with frontal area, hair only in the frontal region, or hair only in the side region. So crown is gone and the frontal regions have been receded. And there are several classifications, we'll go into it. So this alopecia areata, we have discussed, right? So the further extension of alopecia areata is totalis. So I have explained about, sorry, we don't have images in this PPT. So we have a multifollicular patches, right? So whenever you have these patches, so these patches are extended, So you have a multifollicular patches. So it starts from unilocular patch to multilocular patches. So unilocular patches have a single patch, and multilocular patches have multiple patches. So all these patches unites and forms into totalis. It is nothing but extension of the patch completely, which leads to totalis. Totalis means you don't even find a single follicle on the hair, on the scalp, on the entire scalp region. So in this region, you have to, okay, fine. Then universalis. So universalis is nothing but you don't even have an eyebrows. You don't even have eyelashes. You don't even have a pubic hair. You don't even have a hair on private parts. You don't even have hair on underarms. You don't even have hair on scalp or any. You don't even find single follicle on the body. So this is universalis. And the same patch, if it is found on beard region, it is alopecia barbae. You find those regions in the mid-mandibular region. So is nothing but posterior to the mental foramen, where you find these patches and patches expanding. So this is alopecia barbae. So we'll discuss in turn about these treatments. So scarring alopecia is nothing but you find what we say, you find a patch where in turn hair can be regrown after treating in alopecia areata. But in scarring alopecia, you find a fibrosis. So fibrosis kind on the sorry, I'm getting calls actually. So you find the fibrosis, which is nothing but a scarry kind of appearance on the skin, on the scalp. It is scarring alopecia. Next. So alopecia areata is an autoimmune condition in which patchy hair loss, it can result in single bald patch or extensive patchy hair loss. Next. Of all the scalp. Next. You can go ahead.
Yeah, we've discussed all this, right?
Yes. Now, androgenic alopecia also, male pattern. See, androgenic alopecia. Sorry, actually, I am getting calls. But the time have started, right? So, fine. It is also known as male pattern baldness and female pattern baldness. It is thinning of hair in an almost transplant state in both men and women. It is hereditary. So it is in a pattern form, right? So in both men and women, it's linked to having an excess male hormones, androgens, which are nothing but testosterone and dihydrotestosterone. So around the hair follicles, which can block the hair. Now, so dihydrotestosterone, what does this dihydrotestosterone does? This dihydrotestosterone, it sticks around to the follicle inside the epidermis, and it minimizes the growth phase. Means it reduces the anagen phase by hello, sorry. Oh, these patients, they call repeatedly when they don't answer. Sorry.
You're actually in demand, no?
Yeah. Actually, what happens here? So there is a process called miniaturization. So in this region, what happens is the conversion of anagen phase follicles into catagen phase follicles takes place too much earlier. Suppose DHT is active. So if you are not treating DHT, what happens here? The hair follicle that is coming out. Whatever hair follicle is growing in the anagen phase, this DHT tries to shrink the follicle and allows that follicle to convert into telogen phase, which is nothing but shedding phase. So obviously the growth phase reduces. So once the growth phase is reduced, the follicle is shed out. There is another follicle that is growing out. So what happens with the another follicle that is coming out? So the whenever these repeated cycles takes place, obviously there is shrinkage in the follicle, and and this terminal hair is whatever terminal hair that is there, it is converted into vellus hair sooner. Okay, this is the process. And this thinning of hair, suppose if you have a hair, you can find like people who have bald head, they have some thinner hair, and if you notice the side hair, those hair are thicker, because the cycle goes normal in that way. So if it is thinner hair, so obviously the thicker hair comes out, right? So the next in the next phase, the anagen phase follicle is trying to get out in a thinner way with a discolored thing. This conversion from anagen phase into telogen phase is nothing but the process of miniaturization. This happens in androgenic alopecia, or happens in telogen phase follicles, which is nothing but the thicker hair, the texture of hair is changed, the color of hair is changed to change it to a light brown color, which means it is into the miniaturization process. So women are more likely to develop androgenic alopecia after menopause when they have fewer female hormones. Most cases of hair loss occur due to androgenic alopecia. The next one. So next. So we don't have time, right? Next. We can go with this. Also term as, yeah. The next. I don't think so. Now, key role of androgens in this pathogenesis of male androgenic alopecia was revealed by the observations of American anatomist James Hilton. He noted that men castrated before puberty did not develop balding unless treated with testosterone. A new number of studies have tried to determine whether balding males have increased circulating androgens, but no differences between patients and controls have been consistently found. Next, go to the next slide. The next, we can go to the, I think you guys have clear. So now, so population density of hair follicles per unit area of scalp does not change with balding. Rather, there is a gradual diminution in size of the follicle that result from transforming of terminal follicles into vellus type of hair follicles. The hair follicles miniaturization leads to finer hair that is often lighter in color. On the balding scalp, transitional indeterminate hair represents the bridging between full-sized and miniaturization terminal stage. Now, this is the last point is about, when you see a bald region, so mostly you find it in the crown region, because if it is in frontal region, you can't differentiate it because you have a bald patch. So when it comes to crown region, you have an adjacent hair, right? You have an adjacent hair thicker, and in the middle few hair are present which are thinner hair. These thinner hair are nothing but the transformed terminal follicles, not into vellus hair, but these are about to transform into vellus hair. That is why the thickness of the hair has been reduced. The next one. I'm going a little bit fast because the main things are ahead. This is a concept, but the main things are ahead. Although smaller follicles tend to cycle more quickly, there is no absolute correlation between hair follicle size and anagen duration. So eyebrows, eyelashes, and nasal follicles are larger, but the hair is relatively short. It is likely that separate factors control the miniaturization and hair cycle changes. The next one. Next. Now, coming to the treatment part. Go to the last slide. Remember this slide? We have to come back. Go to the next slide. Next. Go ahead. No. Come back. You have to go. You have to forward. Go ahead. Yeah. So now, coming to this classification, show the next image. So here, see, in class 1 classification, you have frontal regions receding, sorry, temporal regions receding and frontal hairline receding. When age grows on, the frontal hairline recedes, but this receding mostly doesn't happen in telogen effluvium or androgenic alopecia. The part 2, you can clearly see, like, classification 2, you can clearly see frontal region, frontal baldness. In these two regions, first two regions, classification, hair transplantation is only an option. And if you have a hair thinning, then PRP is an option. PRP and hair transplantation. In 2A, only transplantation, as the hair is thicker behind. Yeah. And classification 3, hair transplantation. If the hair in the vertex region is thin, then if it is near to miniaturization process or it is thin, then PRP and transplantation. 3, vertex 3, hair transplantation and PRP. 3A, mostly PRP and transplantation. 4, transplantation and PRP. 5, transplantation and PRP. 6A, transplantation and PRP. 5A, if you see 5A, most of the patients, you notice, you don't find that thinner hair, but in the advanced stages they come. In the advanced stages, you can do PRP in 5 region, 4 region, 3 region, but not in the temporal regions. When a patient approaches, you have to say him that in temporal regions, whenever you have a bald patch, that cannot be rectified through PRP. But people say that, a PRP can be done, but because they don't know the subject, right? So 6, PRP can be done in that. So in 6 case, what you have to do is, you have to do PRP for 2 sessions, and once you find a result after 2 sessions, then go for transplantation. After transplantation, then go for PRP 4 sessions again, 4 to 6 sessions, and a maintenance therapy of 20 ml PRP for every 3 sessions. Next, I hope you guys got right. Now, see, most of the when you see female hair from the midline, so always female hair fall, female androgenic alopecia starts from the midline and turns into a periphery. It starts from the midline, from the frontal regions, and it diffuses in the region of parietal sutures, and it extends towards the end of parietal regions. Okay, so this is how the hair fall takes place at these regions. Mostly PRP can be done. In females, you get a very good result in PRP. You can find the follicles coming out within 2 to 3 sessions, even in males also. See, when I do a PRP, I promise the patient that I give result within 1 month. My PRP, I have a different technique of PRP where a result can be enhanced within 30 days. So I'm confident such that I advise the patient to have a bond also. The next one. Next, these guys know it, right? Can you go ahead? Can you go ahead? Can you go ahead? No, the image. Back. So now you can zoom that, right? So the vertex pattern starts from type 3 classification. No, typical pattern starts from type 1 classification. So anterior pattern is nothing but is found in class 2 classification, class 3 classification, class 4 classification, and class 5 classification. It is nothing but the movement, the way, the pattern, the way that the way the baldness is approaching. Next. Am I going too fast, doctor? Is it okay? Following? Yeah. Now, so next, this is not that important. Surgical, in surgical, we have 2 techniques, which is FUE and FUT. FUE is you extract the follicles from the donor region, and you place those follicles in the anterior, on the scalp region, on the parietal regions or frontal regions. So the donor area, you have to have. Yeah, hello. I'm getting call. So yes. So the donor area have different. The donor area, you have to have at least 1,000 to 1,500 follicles to extract in order to give a good result. So considerations taking into transplantation, that is a big topic and we can't do it. So the next one. So when it comes to FUT is nothing but you are removing the follicles, you just make an incision, an olive shape of incision, which is so much compressed, which is like almost all you can extract around 4 to 5 mm. So you extract a strip completely and you suture it. That strip, you cut it, you divide the follicles and then place those follicles in the anterior region or the frontal region or the parietal region. Next. So now PRP, go to the last slide. Yeah, coming to the PRP. PRP has been used in the past to prevent infection and speed up the wound healing process by reducing bleeding, swelling after surgery by the plastic, general and orthopedic surgeons. Actually, the indications of PRP are scalp region and acne scars, dental procedures like impactions, any kind of surgeries in cystic lesions, or in any surgeries. When it comes to the PRP for orthopedic surgeons, suppose if you have suppose the oral maxillofacial surgeons does this plating and all, right? So when you have this plating, when you have this separation, the bone separation, right? So fractured bone completely. When you do a plating, when you inject this PRP, if the healing takes place if the normal healing takes place in 20 days, suppose this PRP can if you inject this PRP, obviously the result, you can see the healing within 12 to 15 days. So this is how. So PRP has, what does PRP have? Growth factors. What does these growth factors take? Growth factors have, in turn treat the patient, it heals the body with a different with a mechanism. So where does plastic surgeons do? Plastic surgeons also do it in hair. We can inject PRP in the hair transplantation surgery. In any surgeries, you can use it. So in the orthopedic surgeries, when plating is done, they can use this PRP in musculoskeletal regions, where the synovial fluid is present. So in this way, the next one, PRP can heal the tendons also. Now, medical management. Remember, a lot of people fail to. Okay, can we take this session can we take this in the next session, or is it okay? Shall I continue? It takes 10 to 15 minutes.
Continue, doctor.
Yeah, right. So now medical management. What sort of medical management, and how do you correlate with your medical conditions? Now, when you start with the first thing that you have to have in mind is finasteride. Finasteride is an anti-androgen. Actually, it is an anti-androgen drug. So it binds 5-alpha reductase proteins to block DHT from binding with them. So it stops binding the receptors on hair follicles and keeps away from shrinking. Right. So finasteride is whenever you finasteride is a steroid, so it controls the DHT by inhibiting the 5-alpha reductase enzyme. So finasteride, when most of the patients approach you and say that, doctor, I don't want to use this medication because somebody have said me that if I use hair medications, I get this sexual erectile dysfunction syndrome. So, but actually, coming to the fact, there is no clinically proven evidence that finasteride 1 mg per day gives you an erectile dysfunction syndrome. Basically, when you give finasteride 5 mg continuously for 3 to 4 months, then it might be some patients have noticed this erectile dysfunction syndrome, but we can't we can't justify this statement, because see, when do you get this baldness? Obviously when you are stressed, or you have this hereditary issues, or you have this testosterone, or you have this dihydrotestosterone issues. So when you have these issues, how can you say that fenestride is giving you sexual dysfunction syndrome, erectile dysfunction syndrome? Because it is involved in stress. When you have stress, automatically the metabolisms decrease, the libido decreases, and obviously you don't find that interest towards sexual reasons. There might be a lot of external factors also in order to reduce libido. So whenever you can't expect a 40 years old patient to perform his sexual life very actively. There might be several reasons. There might be stress related to business or anything which might be causing him to reduce his libido. So this should not be taken into consideration, and this kind of justification you have to advise this patient. I before only said you that the patients are very, like, you know, they come with the Google knowledge, but when you come with them, when you start defending that, so when you start defending that with God, sorry. So now fenestride 1 mg is advised, but in my case, when I do PRP or when I do this treatment part, I don't advise the patient. I don't advise the patient to fenestride, because see, you can't hurt the patient. See, I always try to have this fenestride at the end of the treatment part. So, and I'll give the least importance, because I have to check whether my PRP treatment is working or not. So when it comes to hair part, I see the things in the holistic view. Sorry, when you go with this holistic view, you have to check. I have noticed 85% of the people, 85% of the patients who approaches me for this baldness have this issues with vitamin D. No one relates with this. So you have to be, the first thing coming to the treatment part, whether you want to be unique, you want to be unique trichologist, or you want to be with the flow. When you are unique trichologist, you have to be knowing in and out of everything. When you are a normal, I have seen a lot of normal dentists who are working under me. They would just work for the salary, and I always motivate them to go to the higher level, but they don't want to. So whenever I advise them also, they go to different, they train under some seniors or someone, and come and say that they have this immense knowledge. But when you try to say them, I try to say them, but they defend me and say that even I get result. Man, if you get result, why do the center appoints me as a head? Obviously you're not finding result, right? So this kind of attitude I find most of the dentists, because because most of them doesn't want to read it. They know that after seeing the procedure, they want to perform it. It is not about that. When you perform it good. See, I find, like, you know, when I was in practice, I am from government dental college, I'm good at dentistry also. I find a lot of patients who were practicing dental aspects, they don't know how to do extraction also, and they ultimately ruin the patient, and they don't bother whether they have. I find it in my juniors, well, not in my juniors, like, you know, in some of the unit clinics, they, even though the LA is not sufficient, they try to convince the patient that the LA is, like, you know, the LA is working. But what are the things that you are observing? What are the things that you are noticing? It is always, it doesn't work in this way in the cosmetology or trichology, because patients come from above middle class. You have to be in particular about everything when you treat. In particular, in general medicine also, you have to have a clear-cut idea, because they get you reports, they'll show you. And at this point, when you talk in medical terminology, then the patient gets some confidence and gets treated from you. There are a lot of cosmetology centers, right? And I advise multivitamin tablet, and with the biotin composition, and L-arginine and L-cysteine. These are amino acids, and a composition of minerals, and a compositions of omega-3 fatty acids. So all these are multivitamins that I advise. I'll advise Folihair or HH Omega or Hair Plus tablets. And apart from this, I advise vitamin E also, which nourishes the skin. And apart from this, I have to correlate whether the patient is anemic, whether the patient have dandruff, whether the patient is have this seborrheic dermatitis, or whether the patient is undergoing through antidepressant medication, or whether the patient whether the patient have these thyroid issues. So, or whether the patient have this smoking issues or alcohol intake. So whenever I have all these issues, I can deal it with a holistic view. So whenever he is anemic, I advise ferrous sulfate. Whenever the patient has a PCOD, I'll refer them to the gynec. So PCOD is nothing but a lot of female clients notice this hair fall when they have this polycystic ovarian disease. So now the trending diseases that were in the market are, the first one is androgenic alopecia or telogen effluvium. The second one, this comes to male, and when it comes to the female, PCOD, polycystic ovarian disease. 85% of women, 85% of girls aging from 15 years or 16 years are suffering from this PCODs. Right. So all these are the factors that regulate the hair growth of the patient. The next one is treatment part. You have a treatment. The first one comes is microneedling. We have a derma roller. So derma roller is nothing but you have a 540 needles a roller where you have to roll on the skin. Whenever you find some penetration, it is nothing but you are giving a small prick on the scalp in order to induce the bleeding. So whenever you induce the bleeding, obviously some kind of material that you want to incorporate on it is entered into the dermis layer. So this is the motive behind with polypeptide chains, polypeptide bonds, which leads to hair growth. And along with that polypeptide bonds, you can have a biotin composition, you can have a minerals, you'll have this amino acids, you'll have antioxidants also. So if that is filled in a vial, like vials comes like an injections, right? Then whatever vial you are using on the microneedling. So once you do this microneedling, and then you just massage these liquid on the, you take 1 ml or 1.5 ml and you put drop by drop on the scalp and you just massage it. And once you massage it, then it comes as once you massage it, the entire process is called mesotherapy. So I rely completely on the foreign products when I do this mesotherapy. I do combine treatments with like mesotherapy and PRP. So the next comes the for me, microneedling you can find result in for 10 to 15%, and mesotherapy you can find if you use a good product you can find result for almost all 20 to 30%. And when it comes to PRP, when PRP you can find result from 40 to 60%. So what is PRP? The blood is taken, a 10 ml of blood is taken, and it is centrifuged and it is separated from the platelets are extracted, and whatever extracted platelets you take into insulin syringe and you inject on the scalp, especially in the hair thinning. So you find a result within 2 to 3 sessions if you do it correctly. If you don't find result in 2 to 3 sessions, then you are not the procedure that you are following is not correct. I literally challenge the patient that I can give a result within 1 month. There are people who travel to Bangalore from almost all 800 to 1000 kilometers also. Only see this, I'm saying just to encourage you guys. It is not, I never want to share my potentiality. See, obviously by this time you might have known what subject I have. So whenever you have a hair client, whenever you deal with result, when you are dealing with this result, obviously the patient have gone to different centers. They are not convinced. Then you are unique to that. So try to give some confidence to the patient. When you charge 6,000 from the patient for a PRP, I charge 8,000 for the PRP. When you charge 6,000 for a single session, try to give result. Be in consumer aspects also. Whenever you try it, try to make it a blast. So this is all about PRP. So when you extract this PRP, you have to inject on the scalp region. So this PRP you get 40 to 60% result. This PRP can be used in acne scars also, which is nothing but vampire facial. So after that you have a low level laser therapy, and whatever some technicians say that some technicians who are aesthetic dealing with aesthetic dealers, they say that, you know, take this iGrow helmet, you grow hair. But it depends on the space of the laser light that is incorporated into that laser light. So low level laser therapy is nothing but you have a laser beam that is coming onto the skin, and in turn it stimulates the follicles. And in turn it produces the hair back. So I do a combined kind of treatments with the medications and with this thing. And one more thing I forgot to say, a medication is vasodilator minoxidil. Minoxidil is a solution where it is applied on the skin. This minoxidil, it has a composition. The composition that is available in the market is 2%, 5%, and 10%. 2% is used in female. Never initially start with the 5%. If you have a patient, if you have a severe pattern baldness in male client, in female client, you have to go from 2% to 5%. And if the same proceeds into that, right, in the male, the same. Initially, you go with 5%, then go with 10%. And this minoxidil is a vasodilator. It helps it widens and loosens the blood vessels. So bleeding can be easily passed through the follicle, and the hair growth takes place. And this vasodilator is used initially. The minoxidil is used in US as a drug for hypertension. So whenever there is a survey, like, you know, whenever people were using this drug, so even the older age patients have noticed this hair growth. This is how this is now. It came in a liquid form, which is used for hair. So this minoxidil dosage is one morning 1 ml and evening 1 ml. They have to apply it on the scalp, and you notice the result. If you are not giving not treating them with PRP or anything, you find a result with within 5 to 6 months, and the patient has to use it in 5 to 6 months. So, and then the next one. So apart from that, whatever female medication. So now finasteride is advised in male patient, and when it comes to female medication during androgenic alopecia, so you have to advise spironolactones. So female cycle is different and male cycle is different. That's what. Next, FUT, FUE. So it is all done. So now coming to the, I hope I was done with that. Now coming to the medication with androgenic alopecia, alopecia areata. So what you have to do? So alopecia areata, when you have this alopecia areata is nothing but, what you have to do is, you have to create, see what should be done, as it is an autoimmune disease, right? What happens with autoimmune disease? Sorry, I just want a little bit break. So now I have already explained you what happens with alopecia areata, right? Here you have to trick the skin. You have to trick such that you have to induce an inflammatory process over the skin. It is nothing but a tincture or DPCP or anthralin can be applied on the scalp. When it is applied on the scalp, suppose it is applied on the scalp, it irritates the skin. Whatever you have to apply it on the scalp, and you have to remain for half an hour in order to produce some kind of irritation in the skin. Whenever it is irritated, the mast cells or some cells, the immune cells comes out, and it tries to heal it out. So whenever you are irritating, you are creating some kind of disturbance on the skin, and you are creating some kind of inflammation and swelling over the scalp. So whenever this happened, new follicle comes out. This is actually this is the motive behind that. So what are the things that that were used in this things. So in alopecia areata, most of
So we are not able to hear you.
yeah, is it audible?
Yes, sir.
Is it audible? Is it audible?
Yes, sir.
Yeah, actually, alopecia areata is an autoimmune disease. Your body immune system mistakenly attacks these health cells, and attacks these healthy cells, and attacks your hair follicles, and as a result, clumps of hair is fallen out, and you find genetics play an important role, and the medication here you have to use is clobesterol propionate can be used, and anthralin can be used, DPCP can be used, and PRP can be used, and what else can be used? Steroidal therapy. So here the main treatment part is intralesional injections on the scalp. So nothing but steroidal injections. So you have to you have to take this Canacort or dexamethasone can be used, but prednisolone can also be given. Oral prednisolone can also be given, which in turn can give a result. But you have to avoid steroidal therapy, because if you start steroidal therapy at the starting, that will be a last treatment. So there is no treatment for this androgenic alopecia. So that is how. And there are some serums also which can be used for androgenic alopecia. So that is how. Anything else? I think I'm done. So anything you want to ask, Gagandeep? Sir,
Yes, sir.
anything you want to ask? Anything? I hope, how was my lecture? I think I have
I
covered most
feel
of the
it
topic.
was actually stunning, and every point you have cleared. I mean, you have discussed all the basics, you have discussed everything. I mean, everything is quite crystal clear, and actually your way of presentation was really amazing, because you have made us glued to you. That was actually
Fine.
very amazing, sir.
See, now actually I just want to give few things to my fellow dentists. Actually, when I started working as a head, when you say you're a BDS, right? Your talent will not be appreciated by your colleagues. I just give you a single point. Even now, I feel that I don't know anything. So this is what every person should have. If you find a result, if you find result with some doctor, try to talk to him, ask him, be enthusiastic. It is not like you're earning 6,000 or 5,000, and ultimately if you say that, anyhow everybody took BPC to become a doctor, right? To become a MBBS. At least this is an opportunity where try to behave like an MBBS guy or MD, or by giving some kind of some kind of good result, because industry doesn't have good doctors where they don't have a result. So when you give a result, the patient appreciates you like anything. So work for identity. It is not like going into the crowd like every dentist do. So even though I came into this, I really have passionate towards dentistry, but I literally don't believe in dentists. That is the main problem. See, I try to explain things, but they don't want to change their attitude. They don't want to listen either. That is how. So mostly in skin also, they gave me very less time, but hopefully I started within 1 hour 10 minutes of lecture. With 1 hour 15 minutes of lecture, I have cleared everything. So the moment I have taught you is to give you an outline of everything. So learn from the basics, download standard cosmeto-dermatological textbooks, and whatever procedures you do, you mean it. Okay. All right. Anything else you want to ask Dr. Gagandeep?
Yes, sir. Since a lot of regards are being given to you for the lecture, because that was really a heart-throbbing lecture for sure. And with this, with this, we are having few questions to be asked for.
Yeah,
So,
sure.
shall we move on to the questionnaire?
Sure.
So the first question is from Dr. Namita.
Yeah.
Can you explain the effect of hair straightening, and does hair
Yeah,
spa and other parlor
I
treatment
already
work?
discussed. Ignore. Why do you are worried? See here. See, you're a doctor, man. You're a clinical cosmetology. So why do you care about this hair straightening or these things? These are external therapies, and you don't care. If you care, this kind of really, it's. Don't mind me saying this. It's really shit for me. So when you concentrate on these kind of things, obviously patient doesn't give you a value. So don't
Right.
degrade your value. So always try to be in a clinical aspects. Even if and one more thing I just want to convey you, and there is some other problem called dandruff and seborrheic dermatitis. So dandruff, yeah, hair straightening causes hair loss because you are applying heat. They apply some chemicals on your scalp. This is what I explained in that, Dr. Namita. And sorry if I hurt you, it is not about that. So now, how to treat dandruff? So when you say that you are a cosmetologist and you don't clear these issues in your family, that really gives you a bad. So KZ lotion, you can advise KZ lotion. KZ lotion is nothing but ketoconazole 2%. What is dandruff? It is a fungal infection. What you have to advise the fungal infection? You should not use Head and Shoulders. Yeah, you have to go with antifungal drugs. See, and what happens here? The fungus is on the skin. You have to clear the skin. If you are clearing the skin, in order to clear the skin, you have to apply the antifungal creams. Antifungal creams should be in the lotion form. So actually, KZ is a lotion, but it is a shampoo actually. So whatever medical terminologies, medical things that are released, they should not released like a beauty products. They have to released in a lotion form where it is dermatologically accepted. So KZ is ketoconazole 2%. Along with ketoconazole 2%, you can use ZPTO solution also. Combination of ZPTO. And along with that, zinc panthenate can also be used. So these are the three drugs you have to correlate when you are using this, when you are going with this anti-dandruff treatment. And the next level of treatment, and this dandruff proceeds further, and it goes into a stage called where you find a flaky substance coming out. So initially, while you are treating dandruff, you have to scrape the whole scalp and then apply this. So when you are scraping it, obviously you are removing the fungus out, and you are removing the dead fungus flakes out. So you have a scalp. So where you can apply the scalp, where you can apply the scalp, where you can apply this where we can apply this solution or lotion on the scalp and wait for 5 to 10 minutes. So obviously, if you wait for 5 to 10 minutes, these reacts with the fungus, right? It treats the fungus. So then you find less dandruff that is noticed, and this vitamin T tablets help also. And after that, seborrheic dermatitis is a way it is where a flaky kind of large patchy scales that are coming out. In that also, you can advise this ketoconazole 2% with salicylic acid. Salicylic acid is a beta hydroxy acid. It is used in chemical peeling also. It is used in acne treatment also. It is used in face washes for skin whitening and acne thing. The main thing is it creates dryness. So now most of the trichology part is done. Next question. You have to be active, Gagandeep.
So actually, a lot of people are asking about the courses to be done and the universities which are available for
So
those.
this is not ethical. I should not say in this institute.
Okay. And also, Dr. Rabia is asking about, does hair coloring causes
See, one thing. See, no institute teaches you. It is not like, I have done a trichology thing. First, I mastered for 2 years. and then I entered into clinical cosmetology. It is a slow process learning. When I meet some youngsters who have practicing since 1 month or 2 months old, 3 months, 6 months, I say, no, I am a cosmetologist, but I don't want. But I don't want to. No, it doesn't. It doesn't give you premature graying. It doesn't. It doesn't. Namita, right? Or Shivali, or someone is asking. Next.
Does
Dr.
treatment-
Rajiv and Dr.
Yeah.
Gagandeep, can I come in?
Yes, sir. Yes, sir.
See, Dr. Rajiv will be our one of the mentors, and Dentrance Careers will be conducting the programs, and he will be hand-holding you guys and teaching you. What else you want?
Exactly. If there is no university or college, Dr. Rajiv is there with us for teaching all of us.
No. Universities will come to Dentrance. We will sign MOU. We will award up to PhD. Don't worry. Those things you leave it to us. Council of Cosmetology and Aesthetic Science is the council which will take care of the Indian cosmetology. So we are approved by Government of India. So when other councils are not doing, we are going to do it. We are already having fellowship programs. And next we have to start. In fact, I was about to discuss with you. We have to file application with UGC for the course of Bachelor of Cosmetology and Hair Science, BCHS. And we will have MSc in cosmetology already with us, and few universities are tying up with us. And we are going to global. See, your MDS or our MDS is not valid in Pakistan or Bangladesh also. So we have to go with MSc format that is globally renowned. And if at all, if any legalities are coming in between, we will frame it out. So be with Dentrance Careers. That doesn't mean I am not saying go to other institute, but I have to say don't go because legally they are complicating the issue. They don't have the council. We have the council. How we have the first mover advantage. So I take this opportunity to the award committee to award Dr. Rajiv with outstanding mentorship award of this period, because he is not only coming to us just like that. He had come out from, he is a real Corona warrior. He had come out of the Corona ward directly to our lecture. Okay. So definitely we have to honor him, and this is the great privilege to our team in the Teachers' Day to honor a good teacher, and he will be with us. We don't care how many institutes he is connected to, but as long as he is with us teaching our students, and Dentrance Careers going to utilize him.
I just want to convey one thing. Do you think the knowledge that I acquired is through institutes? How many dermatologists teach you really? If a dermatologist, if you guys are becoming my competition, then I teach. See, of course I teach. I never care because I have my ability and I have my credibility. If you have that see, here I find a lot of dentists also complaining like, so there is not a lot of competition, there is a lot of competition. Why don't you guys practice in town region? Never degrade dentistry. It is like, we have, see, I noticed, see, I was into psychology also. See, I noticed the problem with the dentist, the problem with the MDS people or the problem with the BDS people is, the first thing is they, from the starting of the course, the MDS people who were lecturers, they try to suppress us. They don't give a value in the institute. They throw the caste in the first year. They throw the caste like this. They'll be so abusive. This kind of nature humiliates us. Actually, I want to say you one thing. Dentistry is an art and science. If you have science, so every dentist is unique according to their art and according to their science. So respect your profession. Don't come out and say that we don't get even 15,000 or 10,000. It is ultimately ruining the dentistry. When you come out, say that be proud that you are a dentist. Because I have been to 3 countries. I know what universities, how they go, and what is the value, or what is the demand. Even I earn a very good income in dentistry also. So when you come out, you say, have some medical knowledge, have some emergency medications in your clinic. If you have that medical knowledge, see how I build up now I can sit in a debate with a dermatologist also. How you have to project is, come to the emergency medicine, learn the emergency medicine, go to a doctor who helps you out, learning some medications in general. Why is azithromycin used? Why is cefixime used? What is taxane injection that we have? What are the secondary infections? What are the gastroenteric infections that you have? What are the medications that you have to give for weakness or anything? What are the emergency drugs? What are the next motive that you have to you have to do if any when you are confident in this, definitely you can approach directly to a doctors, to a general doctors, and project yourself with a badge that I'm a dentist. So when you have this confidence, try to build up this confidence from your heart, and then you will project, you will definitely work effectively in the market. If you don't have that kind of confidence, you will definitely can't achieve anything. Dear dentist, really, this is how. And no institute teaches you anything. You have to learn yourself. I have given you a basic. If I want to take a lecture for 10 hours, I can't take it, right? But you have 1500 pages of textbook have been dealt in 1 hour. Is it justiciable thing? I don't think it is justiciable thing. So you have to go in and out. You have to see videos. Now it is, at that time we don't have videos also. And that time in 2014 mid, it is the PRP and everything is new. So, you have to project your career. You have to see things in a different perspective rather than working like a sheep. That is how. So, and people who were MDS here, I do request everyone to respect your fellow dentists. See, BDS, if you are a maxillofacial surgeon, if you are an endodontist, if you go to Australia or anyone, you say that you are called as an endodontist. And the dentist who is practicing general dentistry is called as a general dentist. So it doesn't mean a general dentist is not lesser than an endodontist. So it is like, whenever you have these issues with the BDS or MDS, I don't prefer anything. Like, it's better form a team. We lack unity. When you project outside, if there are around 10,000 cosmetologists in India, if you guys are united really, we can't make the government to move. We can make the government to move, because it is all about 10,000 lives. I have a legal knowledge also. So so that is why I always try to teach, because you should not have any complication. When you have a complication, then you have to be where you have to start and where you have to end, and where it has to be transferred to a dermatologist, or where you have to. So when you are projecting as a cosmetic dermatologist, you should not say like, I can treat the dermat procedures also. It really pings the dermatologist. How you guys behave with the quacks, the same thing they behave with us. But some kind of institutes are getting legal entity, and at least you have that doctoral degree where some assistants are doing it. And even in derma clinics, a lot of people are associated with the salons. So there the assistants does these procedures. In my clinic, when I don't find a time, I'll just correlate and I'll just ask my assistant to apply it, only applying it. Then after that, I'll come out, and immediately after the second minute, I'll come out. So loading of injections and everything will be done by assistant. That is how. So I never allow the assistant to do it also. That is another aspect. So anything you want to ask, any inquiries or anything from anything, Dr. Gagandeep?
Yes, sir. One more question I have, that usually we use, like females basically use bleach. So bleach acts on which part of the hair, and why the process is reversible in this case?
Why is bleach applied on the scalp? I don't think bleach
Not
is applied
scalp
on the
exactly, not scalp exactly. I'm talking
bleach
about
is applied on the face. Whenever you have a bleach on the face, what does the bleach does? It hurts the skin. It is creating an artificial injury to the skin. So the pores are opened. You find immediately, why do you find some kind of, a glow or some kind of facial swelling, when you have a facial, when you have a scrub. So when you have a scrub, you are hurting the skin. What happens with the skin? If you are hurting the skin, obviously the next minute is to heal that, thinking that the body, it is you are mimicking an injury. You are not creating an actual injury. You are creating an injury such that the healing has to be taken place, and all the dried skin have been vanished, and the new skin has to be formed. This is a process of inflammation and coming out, right? So in this aspect, when you apply a bleach, or when you apply any chemical peeling, or when you apply anything on the face, you are creating an artificial injury. You are creating some kind of exfoliation, and some particles in the bleach or some material, the indications of the chemical peel gets incorporated into the skin. So when they get incorporated into the skin, obviously you find some kind of glow on the skin, because after 2 days the healing takes place, 1 or 2 days the healing takes place, and the outermost layer is gone. So definitely you find a result. That's what.
And basically they leads to color, the discoloration of the dark hair.
So one
And
thing, the next win, if that bleach is applied for longer time, sorry, that bleach is applied and exfoliation have to taken place, and after that immediately you have gone to sun. So the skin is new skin. The sun impact is there. You didn't apply sunscreen, so obviously you have a pigmentation kind of thing, right? So as the as the skin is more sensitive, as the newer skin is more sensitive, if you hurt the skin, right? If there is an impact on the skin, if there is an impact on the, if there is an sun impact or a UV rays impact on the skin, obviously the skin fades, right? So that is what. So these are the basic concepts. See, these are the basic concepts. When, see, you are learning from the 50 to 100. You are not learning from 1 to 50. If you learn from 1 to 9, the 100, if you learn 1 to 9 from the in the childhood, then you can easily learn 100. If you don't even know that 9 and you start from 11, is it okay? Do you know what happens really? This is the thing that is happening with the dentist, where they go for 5 days hands-on course, or they go for 5 days hands-on course, and they come out and say that I am a cosmetologist and trichologist. You know, after mastering for 6 years, I was this. Yeah, I work with Anus in South India. I worked with Colors in South India. Now I am presently working in Signora, Bangalore. So now there are a lot of people who want to collaborate with me, you know, who want to make as a consultant. And whenever I go as a consultant, it is not like they interview me, I interview them, because I know in and out of all the procedures, and I ask whether all these equipment are there. If I don't have an equipment, I know how to deal it. If I have an equipment, I can generate the revenue. So I know how to generate the revenue in the sales part. And after this, I know how to operate that machinery in different ways. So obviously, it is like, you know, when I have this stuff where they don't at least listen to these before, when I go, and even though they already have their board of doctors, and if I go and approach, I can do all these procedures in this way. It is like, you know, I am interviewing them. So then I'll start bargaining my price, like, you know, whatever the rental procedures or whatever procedures that you do, I don't care, but I need 40% of the entire income. This kind of confidence, if you have, enter into the market. It is not like, you know, working for 25,000 or 20. Arey yaar, dentist so you have crossed the dentistry, you are coming into the next field. So in this also, you want to earn that same 25 or 30,000. Become a consultant, approach salons, work hard for 1 to 2 years, then crack the world. This is what. Any question? No.
No, sir. Actually, we are very, very much thank you for such an inspirational lecture, sir. I hope everybody present here will be quite enlightened with all your words and the hard work you have done. And actually, you have achieved a lot. And a big round of applause is always there for you, for your lecture and everything. And thank you, sir. Thank you for being a great mentor for us. Thank you.
When is my next lecture? I need a break. Actually, I was with this COVID, right? I can't talk even this long time. I have some kind of breathlessness. So
I think one doctor is having one question, Dr.
Yeah.
Neeraj.
Yes.
Can I have the team to mute them?
Why?
Dr. Neeraj is having a question.
Yeah. Go ahead fast.
Yeah, hello, doctor. Hi, good morning.
Hi, doctor. How are you? How are you,
Fine,
Dr.
fine.
Neeraj Gupta?
Fine, very fine. Doctor, I need to ask one thing. Is it beneficial to have a consultant over our hospital, or is it better than to enter into the field myself? Because if entering into the field, as you said, we are already in the private practice. So it would take around 4 to 5 years to get into the mastery of the subject or into the thing.
Doctor, trust me. See. There is nothing more than what I have thought. So when you go according to me, within see, the lecture I have done, when you do a treatment person, mostly for hands-on, if you have hands-on, I'll be available. So
Hmm.
trust me, once if you go from, if I am a mentor, if you go from the institute, 95% of the assurance I can give you that you will be confident after going the clinic within 1 year. Because this is what I'm respecting every dentist, even though I know this much. I suppose if I know 100 points, so I'm teaching that 100 points to you. So my life is like, now I can upgrade myself, but I can't open my textbook and go in and out of everything. But if I find some simple thing also, I can find it. That is another issue. So now you are there, right, Neeraj? Dr. Neeraj,
Yeah.
right?
Yeah, yeah, I'm
Now
here.
now I am teaching you. Now I am teaching you all the knowledge that I have, and the knowledge that you acquire self. So you will be 130. Like, at least
Hmm.
that knowledge that you acquire, you
Yeah,
get around 50 points. So
that
it
always
is
adds
almost,
on.
yeah, it is almost all that you have 150 points, and you will be more experienced than me, because my brain thinks in other way, and your brain thinks in other way.
No, I
So
was
this is
just
how
keen
respect
about
everyone.
I was just keen about one thing, because your 5 to 10 years of experience I cannot
No,
gain
bro,
within
no,
6 months
bro, no,
even.
bro, no, bro. See, when that is what, after third month, I got result from the clients. They keep on asking me about cosmetology. Then
Yeah,
I have done
cosmetology
cosmetology.
procedure is
So
is
no,
very
no,
much
doctor,
dicey.
please,
You cannot
no,
get
no,
the
1 second.
result within a.
I'll give you all the information if you just remain little bit silent, because it's not like, uh, I forget things. That is what my issue. So see,
No problem,
he,
no problem.
see, within 1 to 2 years, I have mastered in trichology. 1 year, within 1 year. So which made me, after repeated clients inquiries, then that made me to enter into cosmetology. So am I not mastered in 1 year? So why to take 4 years of time? So that is what, have a good mentor. So you can crack the world. That is not an issue. Only thing is how much experience you are getting, how much experienced in you are in doing chemical peels, especially. Remaining on all, it is not that issue. So you have to see, you have to check. You take 6 months for you to know what is going on with the head, what is going on with the scalp, how the hair is reacting. So after 6 months, within 6 months, you have an idea. So that 6 months you do a number of patients, obviously you get this result. No need to worry. First, remove that fear factor. First, remove that fear factor. And one thing, after going to see, unless and until you don't go to a consultation, how do you enhance your practice? How do you enhance your talent? How do you enhance your experience? So you have to go to consultation. So you have to reach. I was head of the institution where I used to treat 180 clients. Out of 180, mostly 10 will be negative because of my attitude. But if they ask me about Google reviews or anything, Google knowledge, I literally show them the hell. I'll be very arrogant. So I see, as I am confident, I am arrogant. If I'm not confident, I'll not be arrogant, because, man, how do you justify it? Do you see, some people come and say that finasteride is this and that. I said, do you have a clinical evidence? Can you show me a clinical evidence? Can you show me a clinical PDF format where libido is being decreased? In that, he'll shut the mouth. So this is what it is, not about their treatment plan. It is all about, if you want a result, approach me. If you want a result, I'll give you a result. If you don't want a result,
Actually,
I'll say according to you. Yeah, that's what. Yes,
ac-
Amy, doctor.
actually, doctor, I just want to confirm one thing from a good
Yeah,
practitioner. That's
yeah,
you are a good example of a practitioner, and you are into the institutions also. I just
yeah.
wanted, because we are in the private practice, and I was just thinking, if I go with the cosmetic procedure, normal minor cosmetic procedure, we are already getting through. I got a cosmetic from the NYU also, and
Hmm.
we are practicing for more than 10 years right now. We have the hospital with us, and we have a team with 4 to 5 doctors also. One is
Yeah.
orthodontist and
Okay, okay,
microendo.
okay. Yeah, okay.
Yeah, so everything is there. But I just wanted to confirm that, is it okay from the day we have started the hospital? Earlier we had a clinic, now we have a hospital. We were
Hmm.
thinking to broaden our aspect by
Hmm.
incorporating the cosmetic procedure and the ENT also with the hospital.
Okay,
So
okay.
that's what I was thinking, that I should go into the cosmetology thing myself, or we should give a consultant for this
No,
thing.
no.
Because
Yeah. See.
if I
Yeah,
would
got you,
be
got you,
just
got you,
just
got you.
just a minute, but if I would be entering into the cosmetic procedure, na, in the hospital setup, there are many procedures which are needed to be guided and which are needed to be supervised by the senior dentist, because I'm the owner and I'm the most senior doctor at my hospital. So I need to see the things also, and most of the time patient opt for seeing me only. So if I would be going into the specialization, I from my experience, what I have seen from the last 10 years, that the day when we had started from with the endomotor, the manual RCTs I had given up. I had given up to my juniors, and I don't see the manual
Doctor,
RCTs. I
sorry to
just
interrupt you. Doctor, sorry to interrupt you. Actually, see, when I work for any of the organization, I see the time actually. So it has been 2 hours. If time prolongs like this, you find, so only this day is available for me to teach you. Right. So whenever if the time, if we keep on lagging these time, we get very less time to discuss on the subject. So that is why I was interrupting. I got your point. Now I'll say you, listen, if you don't really get that, trust me,
Mhm.
because all these queries I have been, hearing since years. Right. So now, actually, when it comes to clinical practice, when you have a dental practice, or never say that Dr. Rajiv's Dental and Skin Clinic. Man, you are not dealing with the skin. And if you are that, how you are not a dermatologist. And obviously the OP comes and the OP goes, that you yourself are making the people to confuse. So always try to have a cosmetology center and establish in a corporate sector. Establish in a corporate way. You should have a manager. You should not speak directly. And when you, as you said, Dr. Neeraj, whether you have a 5 floors hospital or 10 floors hospital, or every consultant is approaching, there is no issues in that. Only thing is, you start, if you want to start one floor with start 1000 square feet or 1500 square feet with a hair transplantation center and a cosmetology center. Now if you say that it is a cosmetology center, see, it is a trick actually that I have. So when someone asks me, like, a cosmetologist, how are you doing these procedures, I said I am just a cosmetologist. When you go abroad, cosmetology deals with uh, skin and cosmetodermat procedures. I say that I was doing only to the machinery part. I can defend myself. When I'm doing it in terms of the machinery part, even when I am giving ad or anything, I project in that way. So whenever I'm doing this machinery part, then if somebody has sued me according to this machinery part, then he's not a dermatologist and he is doing a laser session. Then I said, is there any regulation by the government that the laser has to be supplied only to a dermatologist or a DL number? And the second one, because when you buy a drugs, right, so you have to produce the DL number. If that is not produced, who is taking care? And there is no one to ask. Right, I have done a procedure, I have done these things from a dermatologist, so he have given me a certification, so obviously I have to do it. So if you want to sue me, sue my boss. So whatever they have, I'm doing it. Whatever they have taught and whatever certification have, what are the limitations have, that I do. But I was never greedy. I was never greedy for the money into the service till now. So till now, I don't practice hair transplantation. If I have a patient, I'll just organize in some other clinics. I don't want to take the risk, because I'll go into that clinic, I'll grab half of the amount from them. So I'll teach, I know in and out of the procedure. I'll stay with the patient. So that I'm safe, right? Half of the amount is got, half of the amount I got. So here it states that I'm not greedy. I'm not greedy about money. I don't see, even if it is an 80,000 surgery, let him take 40,000. I don't care. So 40,000 is enough fun. Let him take 60,000. I don't care. If he is a plastic surgeon, let him take 60,000. Give me 20,000. That is fine, because I can earn my money. I know how to earn money more than that. Transplantation procedures. So I don't want to take risk. It is all about where you have to end your thing and where you have to start. I hope you got an answer, isn't it? Anything else, Neeraj, Dr. Neeraj?
I think he can get it connected with you in person also and personally. And
Yeah.
I think
No,
you can have a
don't
long
see.
word about this.
Yeah, it is like, don't see. I have to see. I have to give some knowledge. The lecture that, even though I am recently came from the hospital, the moment I accepted is I want to teach. So I want to teach. So if I lag my time, so obviously I can't have much time, right? Hello.
Yes, sir.
So that is why I have to see for the time sense also. Yeah. Anything else? Anything else? It's not audible.
Hello.
Yeah, sir.
Okay, thank you, doctor.
Yeah. Thank you.
Actually, most of the query is gone, and I'll later on contact you personally. Then we'll have
Yeah.
a word.
Actually, when I have a topic, I say in and out of everything, doctor. So
Mhm.
mostly, if you want any guidance to how to set up, how to go with the corporate sector, corporate setup, we have a consultants, and I am a training consultant for them. So how to train the staff,
Okay.
how to how to what is the patient ideology, what does the manager speak, what is the amount, what is the price range, what is the least price range we can quote, what is the highest price range you quote, what are the basic
Yeah.
ethics that they have to follow. Yeah, that is what.
Yeah.
So all these,
These things I'll discuss
yeah,
it later on with you
yeah,
personally.
sure, yeah,
Okay. Thank you very much, doctor.
Thank you.
yeah. Thank
Thank
you.
you, Dr. Neeraj also and Dr.
When
Rajiv
is
for
our when is our when is our next lecture? See,
within after
I'm a kind
2 hours.
of friendly doctor. You can ask anything. Okay. You can ask anything and maintain time. My lecture, I just start exactly in the morning. If it is time, I just wait for 2 to 3 minutes. I don't want to waste the time. It has been the first time I was here. I have been waiting for 15 minutes. They are giving wonderful opportunity to wait for you. And next time, whenever you have a lecture, make sure that Dr. Gagandeep, and I don't want any, see, I said you right. I don't want anything. See, the work ultimately, whenever even I deal with the patient or even I deal with the institute, I see for the result. The end product is how I am teaching, what I am conveying. So when you have a lecture with me, make sure that people are attending. You also maintain the time that by 5 o'clock the mic should by from the first minute also onwards, we'll have this kind of discussion. Okay. See, it is an opportunity for the people who were on time. See, if you are not respecting them, it is not ethical. So respect the people who approach it first. So they are so enthusiastic. So it is like, let them learn much. So that is how. When you keep on going on with the lectures, so I have spoken in these 5 minutes, then they get to know next time they'll maintain the time, irrespective of they're working or not. If you want the subject, they have to come on time. I don't want to waste my 15 minutes of lecture either. All right.
Thank
So
you, sir. Thank you
make
so
sure that
much.
you're all right. Yeah.
Thank you.
Thank you. Shall I leave? Oh, when is my next lecture?
Dr. Rajiv, we are having your session after 2 hours again.
We'll have it in the afternoon, maybe.
Yes, sir. Afternoon.
Yeah. Yeah.
Thank you, sir. Thank you.
All right. Take care. Bye bye.
Thank you, sir. So after
Yeah.
this Power Pack session, we are having one of our pioneer mentors, Dr. Venkatesh, sir, for this session. And I welcome you, sir.
Thank you, Dr. Gagandeep, for welcoming me. I am already inside the room, but I want to ask from the audience, how many of you willing to have 5 minutes break? Break needed means put B in the chat box or put C to continue. Somebody putting A, that means going out. Absent.
Okay.
B
People
is
require break.
overcoming. Have a chai, cup of chai. Yes,
Not break.
please.
Nice.
This is how we have to encourage the audience. They need brainstorming. After this lecture, they have to come back actually. And store all your files before deleting. Dr. Rajiv stored you in your brain. So break continues now.
Okay, so we'll be coming back after 5 minutes and we'll be rejoining. Thank you. I think everybody has taken their tea very well, and sufficient coffee and everything they are having with them. So can we have everyone back again for the sessions?
Thank you. Welcome back. Remaining will be coming back, or they are already with us. So cover to pahunch hi jayega. So I want to start with one thing. Yesterday we had crossed the participants more than 130 at one point of time. Yesterday was the free session, and today it's the paid session. So you make this see the difference. There is no much difference. We are also touching 100 today. So somebody told during the session that in the pandemic period, we are facing hardships. We could not make the meetings. But I am telling you, Dentrance careers growing in the pandemic period, and we are the one getting more participants virtually because everybody having their own schedule. For example, person like Dr. Rajiv, if we have him on board, this is the only way helpful to us in pandemic situation. He is connecting back to us, and he also respects very much the time. So such person, we cannot ask him to call to our offline hotel meeting and all. So it is very much beneficial, and we are growing as an organization. More and more people are attracted towards this new emerging disciplines. And today I am going to represent my discipline, that is forensic odontology. Without that field, nobody knows about me in the country. So today I am going to share very much complicated slides. See my slides. How much time I took to make that slide, you just see me. See, this is my slide. We are going to learn how, what, why, then when. So if you know about all these things, if your mindset clears all these queries, definitely you will be in the right place. I am guiding you properly. Don't worry about that. So this is what my slides will be. Today I am going to share. First of all, I want to ask you one thing. How many of you thinking British came to India to rule us first in the order? I am telling you, British came, Dutch came, Portuguese came, French came. You know the first letters. I am telling you again, British, French, Dutch, Portuguese. So who came first to India to rule? We Indians. Definitely, they may be coming for exploiting, but who came first? P means Portuguese, E means English, D means Dutch, F means French. Who came first? Dr. Nikita says French. I suppose she is not from Pondicherry. Okay. Portuguese. Okay, thank you. Portuguese. See, this is the difference between our student. Dutch, who is Dutch? Okay, Portuguese. So everybody knows British did not come first to India, isn't it? So tell to the outsiders, my lecture is not boring. I am not touching subject, but I will definitely get into in the subject. Now it is going to fire now. See, Portuguese. Everybody right. See, I will tell you, even though Portuguese first came to India, then came Dutch, then came English, then lastly came French. This Goa, Pondicherry, Karaikal, Mahi, and all these French came. But you take it from me, even though English came third in the order as an outsider to exploit us or rule us or gain us or help us, I am telling you, British is the one who were dominating us, and they made all the system. If you think about these things, like Indian Penal Code, IPC, Indian Evidence Act. If you talk about Criminal Procedure Code, if you talk about Civil Procedure Code, so all these codes, British is the one who gave to us. So definitely we have to have that mindset. I am telling you why I am saying all these things. Recently I have read in the newspaper, North Korea, everything British made, and we are following the strategy genetically. In our every cell, we follow that. For example, if even our Dr. Rajiv took the lecture, we were carrying which university is offering. So this university system of offering education and the government getting into the system of everywhere, these are all coming from the British attitude. So after Corona, you take it from me, after Corona, the formal system of education will go. After the Corona, post-Corona period, the knowledge, as he rightly told, the knowledge you are going to get, the knowledge you are holding, and how you are having certifications. It's not about the system, but the claim authority you are having, plus knowledge will rule you. You have to follow that. So recently I have read in the newspaper, North Korea. How many of you knowing North Korea and South Korea? You know, the country which often makes the rumor for itself that its prime minister or premier or president died. They used to release the rumor and again they will come back and again they will release the rumor just to create the integration, national integration. It is North Korea. If you go to North Korea, all the foreigners, tourists, they will be accompanied by fake citizens. That means they will come to you, they will meet you, they will say good about their country, but actually they are all hired people. So country by country, the mentality differs. So think about you and me suddenly landing up to North Korea. What we will think? Definitely it will be different thing. You cannot go to the shop, purchase the thing like in India, like in UK. So when you go to London, UK, you will feel you are in India only because they have given all the ground level dealings. Your brain thinks as a British because they dominated each and everything. So how many of you knowing the difference between Constitution of India and all the rules, regulations you are following, like this Indian Penal Code, CRPC, Civil Procedure Code, all this stuff? Let me ask you one thing. What is the difference between society, trust, association, council, company? See the difference. For example, you are a dentist, you are being governed by dental council. Dental council is not a company, it is not a society, it is not a trust, it is not an association. And the thing called, for example, take the example of Dental Council of India and IDA. Many people not knowing the difference between IDA and DCA. Many people not knowing. IDA is an association. Dental Council of India is a council. And society, trust, anybody can make it. Company, we have again, company means we have again see, according to the Company Act 2013, the new nomenclature are there. In the company, there is a private limited, there is public limited, and there is OPC, one person company. How many of you dentists not knowing this OPC? I want to start my poll. How many of you knowing? How many of you knowing OPC, one person company? Type yes in the chat box. Why? If you are knowing, I am going to transform you today. This second. Nobody knows. Nobody knows. I know. Because I myself know after perusing so many documents. One person company. How many know? Nobody knows. All you guys come back to me. Don't go and again पैसा ऐसा जमा नहीं करना auditor को. Again, in the pandemic period, come back to us. We will open only, we will take only government charges. We will take, everybody should open 1% company for you. This solves all the problem. Just now what Dr. Rajiv told, have a corporate system. कल आपको certificate हो गया, CCAS gave the certificate fellowship in cosmetology. Tomorrow, 1% company need not be having the setup. You are an individual, apply and get the company done. 1% company. 1% company is the legal entity. If anybody willing to sue, you can counter sue, and there is a lot of rules and regulation favoring you. Why you being a dentist going and stacking up in the problems? Tomorrow you are going to practice your cosmetology. Open a company, make a branding. You can do advertising. As a dentist, you cannot do advertise. DCA will come into picture. DCA will say you have to put this board, this size, this letter, this terminology. When you have the 1% company, you are covered by the Company Act. So that is why we were years together watching the scenario. That's why we don't follow this mode. I used to say to my students, they know that is a repetition for us. What is this called? PPP, Public-Private Partnership. This is the mode which came into picture after 1990 when we opened our economy, because private players are coming into picture. Everybody knows. I will ask one interesting question. Just type in the chat box the year in which you come to know about ATMs. Just type in the chat box. The year, mention the year. 19, see all born 1990 afterwards, or maybe I am 80 born. So type in the chat box, which year do you think ATM machines come to India? Just type me the 2004 saying, Dr. Joy saying 2004. 2002 told by Dr. Vignesh Sharma. I think it is before that. Yes, somebody, she is nearing. Dr. Neeraj, right, like Dr. Sangeeta, 1990, I doubt. 1990, I doubt. After 1990 only we started all this process. For example, ICICI Bank, HDFC Bank, they came to India after what time? After 1991 may be possible. See, I am telling you, I am not testing your MCQ, this thing. Dr. Gagandeep, are you saying from your own or Googled? Side by side. Yes. Good. See.
That's my birth year actually.
Okay. That's fantastic. So you claimed to be younger most in the session, in a way. Yes, thank you. So my question is, I am coming back to my subject. I think people joined.
Most of them have joined.
I need 10 to 15 people who are really into the system. That is enough, because I want to transform people. I don't need crowd, basically. That's why I gave the break, so that important people are holding their seats just like for attendance purpose. See, certificate आएगा जाएगा. So attendance तो certificate के लिए तो वो important नहीं है. Those who are all willing to listen, we will take care of them. See, when British came to India, they made all the systems. So the system says certain things. For example, we consider everything on government. For example, in India, we have Dental Council of India. In USA, there is no Dental Council of America. There is no DCA. In Britain, I don't think any council system is prevailing. And we are coming back. We are removing the council system now. We are going to commission, dental commission or medical commission. We are going to commission system. But you take it from me. In India, what we follow is British system, because there are three portions you have to take care. One is Parliament, is the supreme law-making organization. The other one is your missionary, that is executive department. You have to take care of all these law and order, IAS, IPS officers through this political system getting controlled. And the other one is judiciary. So these are all the major system. You type in the chat box, in India, which one is really powerful? Parliament, executive or judiciary? Which one is really powerful in India? Just PEJ. Type PEJ. Sandeep saying parliament. Nikita saying executory. Abhilasha saying parliament. In India, these are the three counterparts. Then fourth one, if you want to add, means kuch bhi media bolo, press. There are some prefix nowadays. This is the fourth pillar. So it is news to you. So P means parliament only. For press, you can type PR, means press. So I will come to know. Yes, Dr. Shivanshi says judiciary. Interesting. Sangeeta says judiciary. Judiciary. Mamta says judiciary. Being a forensic scientist, she loves to be reporting to the judiciary. That's why. Okay, okay. So let me tell you. Lopamutra says judiciary. Okay. You are saying judiciary powerful. Okay, okay. Yeah, it is recently also they have fined 1 rupee for conduct of the court charge. I am seeing the powers, judiciary. Don't take it otherwise contempt will be coming on me. See, in India, parliament. Dr. Silpa says parliament. Yes. So if you ask this question, if you want to test anybody's legal knowledge, you ask this question. Even I want to talk about how to make you high profile dentist. See, in the country, I become high profile dentist, certain rules and regulations I followed. For example, certain high profile dentists don't involve in some matters. That is also do's and don'ts. I will tell you, don't worry, if time permits. So I am talking about the question, judiciary, parliament, executory and press. In that, nobody told about one important thing. In India, parliament is not supreme, judiciary is not supreme, press is not supreme, and executory is not supreme. Then which is supreme? Which is supreme? Now I am asking the question, which is supreme? Anybody having idea? You can type. I rejected all the queries. No, I rejected. Nothing is supreme. Nothing is supreme in India. Democracy is just in paper. You can define democracy in some other way. There are democracy also. I will talk about democracy later. Media, constitution. Who is that? Dr. Akash Tandon. You should be our very keen observer of our lectures. See, in India, we follow this strategy. You take it from me. You don't forget in your lifetime. In India, we are following constitutional supremacy. In India, we follow constitutional supremacy. By virtue of implementing the constitution, parliament and the judiciary coming into the picture. There is a tug of war between parliament and the judiciary. Who is the custodian of this constitution? So the fight is for the constitution, not for themselves. All the organs of the country, they are fighting for who is safeguarding the constitution. Either executive or Dr. Silpa, I support you, industrialist you are saying, but industrialist cannot change the constitution. Industrialist cannot change the constitution. If he is able to change the constitution, Vijay Mallya will be come back to India. He will change the constitution. He could not, that's why he is outside. Many industrialists I can name you. They are all not in India because they could not change the constitution. And we have to work under constitution. So you tell me, is Dental Council of India bigger than the constitution? Now you tell me. Indian Dental Association bigger than the whatever they have given. So we have our three councils, Council of Cosmetology and Aesthetic Science, Oral Maxillofacial Implantology Council of India, we have CAFO, Council of Forensic Odontology India, all these powers given by constitution. Cheer up. Nobody can supreme to these councils. We are having that councils. We are closely associating with the councils. I congratulate today all the 30 members, council members who are all part of this council. They are the most powerful in the country. If you are in India, you have to understand nobody can change the constitution. And what is constitution now? What is constitution? That is the question. Constitution means what? That is the basic law, fundamental law. Any country is having basic fundamental law that is called constitution. In India, we have our own constitution. That is the most lengthiest form of constitution. It is having around 400 articles. If you go back, tell me one thing, one interesting question. Which country is having smaller constitution? Very small. ऐसा बस पकड़ लिया एयरपोर्ट से घर जाने तक खत्म हो जाएगा कॉन्स्टिट्यूशन. डॉक्टर शिल्पा सेज चाइना. चाइना का कॉन्स्टिट्यूशन कैसे रीड करेंगे मुझे समझ नहीं आ रहा, उनका लेटर से समझ नहीं आता. ओके, उनका कॉन्स्टिट्यूशन चाइना में क्या है? लिसन टू मी, दैट्स इट. इट्स द शॉर्टेस्ट कॉन्स्टिट्यूशन. लिसन टू मी, लिसन टू द गवर्नमेंट. मोनाको में भी गूगल नॉलेज नहीं है हमारे पास अभी. आई हैव टू अपडेट, मे बी और मे नॉट बी, आई डोंट नो. So Indian constitution is the lengthiest constitution because, okay, in US, which is supreme? Now I am expanding the question. I am expanding your knowledge. In US, judiciary, executive, then parliament, which is supreme in USA? Just put the type letters. It is very important. You are talking about Trump and other US election is coming. Vatican is in Rome. They cannot rule over. They can, religious point of view, they can dominate. They cannot rule. Right now, our Trump also faced this very strong measures in their constitution. That is called impeachment. Okay, see, this is very 1 hour lecture. I love to take the whole day, but the problem is others cannot allow me. Shilpa says executive in US. No. Okay, let me come to the picture. I will clear. Just listen to me 1 minute. I will clear and I will go to next topic. In India, constitutional supremacy, and it is being right. Dr. Shivanshi, judiciary is supreme in US. They can remove the president. They can reseat the president. They can revoke the resolution of the parliament. Yes. In UK, parliament is supreme. In UK, parliament is supreme. They can change male into female, female into female if the parliament resolution says like that. In India, we follow the midway constitution, and constitution should be safeguarded by judiciary, and judiciary should be following the rules made by the parliament. So it is interconnected. Ultimately, constitutional supremacy. And in USA, it is called judicial review. Judiciary is supreme in India, in USA. And so why I am saying all these things? We have in India, we have certain system wherein everything is not covered by every system. For example, how many of you thinking dentist means dealing with oral cavity only? How many of you thinking? Type yes in the chat box. Dentist means oral cavity only. Type H in the chat box. Type yes means dentist is dealing only oral cavity. Dr. Ambreen says no. Then what dentist dealing? Write in the chat box. Dentist, as per DCA Act 1948, you cannot outside the oral cavity. Head and neck, then it should not be BDS. There should be some other Bachelor of Head and Neck Surgery and Medicine. It should be. Whatever I am saying, I should not misguide you people. Tomorrow you will go and behave like that. Dentists are going to dermatology, hair transplant. They are going, but legally what? What is the legality? That matters. Being a forensic odontologist and dental legal expert, I have to guide you perfectly. You cannot exceed oral cavity. You take it for sure. So everybody went wrong here. You cannot exceed oral cavity, but dentists are, listen to me carefully, dentists are not treating the teeth, but they are treating the human being having teeth. How many of you agreeing? Dentists are treating the human beings holistically who have teeth and also who don't have teeth also. Dentists are treating human beings, not teeth, because teeth is not coming by courier service to you. It is carried by human being. And those who argue for the thing, you should not come outside the oral cavity. That means if the dentist dealing a extraction, if the patient met with a syncope, is collapsing in the chair, you have to get out of the scene. You have to get out of the scene if patient collapse. If somebody saying you are not treating human beings but only teeth. So all these things will come to your knowledge only if you are a forensic odontologist. And you tell me, if you are a lawyer, you will be having your client. If you are a beautician, you will be having your client. If you are a dentist, you will be having your patient. If you are a industrialist, you will have your consumer. But as a forensic odontologist, I have double, buy one get one offer. How? I have dead body in front of me. I have a dead body in front of me, and I have one more person, third person who killed the person. So automatically I am getting buy one get one. So your horizon is becoming more. And not only that, I am having the post-mortem report and also anti-mortem report. I have to confirm the report, and my report will go to Supreme Court. So in India, forensic science is not yet coming under any council. Forensic science is not yet coming to any council. I am taking to the crux of the matter now. When we divided MBBS, carved out dentistry, we have taken holistically all the dental related stuff, all the head and neck related basic clinical works. But we left one subject. Type me in the chat box which subject we left from MBBS and come back. Which subject in MBBS, general medicine and general surgery, we left and come back. Forensic is the only subject, forensic medicine is the only subject we left from MBBS people, and we come back. Foolishly, we come back. Because in MBBS second year, they read forensic medicine. That book, if you read, you are already becoming a forensic odontologist. Because being a dentist, if you have forensic knowledge, you become a forensic odontologist. SPM, we taken care by community dentistry. SPM is already taken care. See, gynecology is, we are not carving out because that is not our discipline, first of all. Secondly, ENT, Opthal, we left because that is not our field. That is already given to some other specialization. But forensic odontology is our subject, but we did not come back. We did not carve out so far. And it is the gross injustice till date going on. So only to revoke that, we cannot go on to claim. For example, property is divided in your parental house. You left something. After 2-3 generations, will you go on to claim your parental property, your grandfather, grandmother's property? You cannot claim with the currently the owners. So like that, so what we have to do, we have to go with the laws of the land. For that, you have to know the legal things. Without knowing the legality, you cannot claim back. So forensic odontology is the only subject which takes care of not only the subject, that is the corpus delicti, the body in question, that also covers your third person, unknown person. He may be the perpetrator, he may be the offender, he may be the accused, he may be the convicted, but you don't know. But you have the other invisible person that is also coming in your picture. And being a forensic odontologist, you are more than a forensic medicine expert. How many of you are agreeing that? After MBBS, people are studying, after MBBS, people are studying MD, forensic medicine. That is not attractive. As far as clinicals is concerned, forensic medicine is not attractive. And so forensic odontologists are superior 3 times more than that of forensic medicine expert. Why I am saying, I will explain you. In forensics, when the crime is happening, for example, somebody committed suicide. Somebody committed allegedly suicide. Nobody knows. Nowadays, police itself announcing it's a suicide. And the police itself talking to the press nowadays is going on. Why they are doing? Because you people are not having the field in your hand. If you go anywhere, if you talk about orthodontist, prosthodontist, periodontist, everybody will treat like you are dealing some teeth and specialization. That's it. When you are going to the police department or judiciary, anywhere, if you are calling yourself forensic odontologist, they will listen to you. How to make your profiling? How will you make your eye profile? Only this field only. I have seen the many fields, many people, and I will come to you next how the specialization is defined legally. And now my query to you is, why forensic odontology should be read by a dentist? Because there is no other field which arises, in which the horizons are getting more. And one more interesting thing I will come back to you. At least after death, you are getting the whole body, because the bite mark can be anywhere in the body. How many of you agreeing? Bite mark can be in the thigh, bite mark can be in the ankle, bite mark can be in the shoulder, bite mark can be in the breast, bite mark can be in the chest, bite mark can in the stomach. Anybody can say, don't see there? Anybody can, any dermatologist will come and say, don't see there? Any cardiologist will come and see, don't see the chest. It is my area. When you are searching for bite mark analysis, anybody can sue you. So this is the only field, at least after death, you claim the whole body. How many of you happy now? Type H. No, you should not agree. You should be happy. You should support your dental fraternity, which is taking care of whole body. Wonderful, wonderful. Be happy. See, for becoming a forensic odontologist, what is the procedure? Now I am asking you, what is the procedure? Type C in the college. You have to go to college. Type C in the college. You have to study some formal education in the forensic odontology, or just like Dr. Rajiv told, you learn the books and you claim. What is that? Let me to the point. Dr. Namita says, come to Dentrance. It's a very, very shortcut. I think you are following some very good protocol. Should have proper diploma course. Again, I already told you, just to go back to the system. In India, British we are following. Even though we are ruled by British, so we are following that stereotype mentality. MSc Forensic Science is somebody saying MSc Forensic Science to become forensic scientist. MSc Forensic Scientist cannot claim forensic odontologist. Take it from me. Legally correct. See, legal only goes in the country. Should have proper degree. Yes, that I will break it. Sanavas, Amsa, please listen to me. Next words, I will break that myth. Who is a forensic odontologist? Apply your mind. Just have a cup of water and just be brisk. Apply your mind. I am not wasting my time like talking about USA, UK, parliament system, everything. I am preparing your mind to think in a right direction. Now you are journeying with me. Now you are going to journey with me with utmost maturity. Somebody thinking I am taking some psychological control. No, nothing like that. See, I am telling you. Just right now in front of me, you type this act, section 45, Indian Evidence Act. Just Google it and read. I am giving you 1 minute time. Section 45, Indian Evidence Act, you just type and read. Google it and come back. What is section 45, Indian Evidence Act? That is the only law taking care of forensic odontologists in the country. There is no mentioning you have to have university degree. There is no mentioning. Anybody can claim having dentistry studied and having forensic knowledge. Some certification required. I will tell you why. Some certification required. I will tell you why. Section 45 Indian Evidence Act. And one of you should volunteer me to read that act actually. Indian Evidence Act section 45. I think Dr. Gagandeep, just Google it and read it for me. Section 45 Indian Evidence Act. This only act also, if you know today in the conference, it is more than enough. You can come back to me. I am here for lifetime free teaching, coaching, mentoring, everything. Dr. Mamta, you are right. You are a forensic scientist and you are going to be convocated tomorrow becoming a forensic odontologist. Advanced congratulations. Because we are working with CAFO, Council of Accredited Forensic Odontology. We are having that. So that's why I am putting this question. So Dr. Gagandeep, can you read it out for me? What is section 45?
Section 45 Indian Evidence Act was given in 1872 and it's an opinion of experts. When the court has to form an opinion upon a point of foreign law or of science or art or as to identify of handwriting or finger impressions, the opinions upon that point of persons specially skilled in such foreign law, science or art or in questions to identify handwriting or fingerprints are relevant facts. Such persons are called experts. So they are into this.
This is very good. See, they are talking about fingerprint and what they are talking about?
Handwritings.
Handwriting. Any other expert? They are talking. Any other word is there?
Finger impressions, handwritings.
That's it. See, this is how we are standing. The Information Technology Act, we have to incorporate in that. And whatever DNA Samples DNA Evidence Act, we have to incorporate in that. Whatever stem cell reproduction, we have to incorporate in that. So our Indian judiciary is flexible. It's keep on adding, but the basic value remains the same. That is called basic structure of the Constitution. It was already established in the Supreme Court of India. You cannot change the basic structure of the Constitution. So basic structure of the Constitution regarding the Indian Evidence Act, Section 45 is the supremacy. We are going to follow, because don't follow the Parliament, don't follow the executive, don't follow the judiciary at the cost of Constitution. So Constitution means any written law which is basically binding on you, and any law which is coming under the control of the basic fundamental principle of the law, it is called the rule of law speaks. So in Section 45 Indian Evidence Act, you go with your certification. I have studied in CAFO. I was certified in CAFO as a fellow. I was certified fellow in the CAFO. I want to involve myself in this suicide case. I want to involve in this murder case. Being a forensic expert, can anybody say go out? Any judge will say go out? Any police person will say go out? Yes or no? If you are going with the CAFO certificate, I am a certified fellow, I am having this opinion with me, I want to give opinion in Section 45 Indian Evidence Act. Any court will say go out?
No.
If they say go out, it will be in press. Any judge saying, अरे ये हमको एविडेंस नहीं चाहिए, चुपचाप चले जाना, बोलेगा कोई? आप कैसे लेके जाएंगे अपना एविडेंस को? अंडर सेक्शन 45 इंडियन एविडेंस एक्ट, I want to give the testimony. I want to talk about this case. Anybody having the certificate can go or not? Yes or no? Type in the chat box. Yes or no? वो जज पूछेगा आपसे, DCI प्रेसिडेंट से लेटर लेके आओ, DCI कमेटी से लेटर लेके आओ बोलेगा, UGC प्रेसिडेंट से लेटर लेके आके बोलेगा, IPS ऑफिसर विल से सेक्शन 45 के अंदर आप नहीं आएंगे बोलेंगे. So any dentist can go to the court, but problem मैं बताता हूँ. I will tell you the problem. If you go without proper knowledge, judge may send you to the jail for tampering the evidence, concocting the evidence, fraud, 420, सब केस आपका ऊपर आ जाएगा. अगर नॉलेज के बिना कोर्ट में जाके फंस जाएंगे तो सारा इल्जाम आपको ऊपर आ जाएगा. So you have to have the knowledge with proper forum. So Council of Accredited Forensic Odontologists is the forum which we have created by the finest brains in the country. And I myself claim first official forensic odontologist in the country. Why? Because I had my master's degree. When I was doing my master's degree, nobody were in the market having master's degree. There were only diplomas. Somebody went to some foreign country, attended some seminars, come back to India and claiming. I was very much astonished to see various dentists are claiming forensic odontologists. Nowadays, oral pathologists, oral medicine, they are saying forensic odontology coming under us. Is it not a joke? A oral pathologist claiming forensic odontology is coming under me. Is it not a joke? Forensic medicine people saying without reading IPC, without reading CRPC, without reading Constitution of India, without reading the law, oral medicine people are claiming we are forensic odontology, and DCI is saying forensic odontology is attached with some other discipline of dentistry. Who is original forensic odontologist? Type in the chat box. Who is original? When you go to the court, judge should acknowledge you. Then only you will listen to the evidence you are going to give. So, let us break the ice. First of all, you are coming out of BDS. You completed your BDS. What I am saying, you read some legal books. You collect some high profile cases. Just go back to indiaqanun.com. There you see the high profile case, their judgments. You read it. Then you ask questions. Try to search all these questions. Dr. Akash Tandon, can you unmute? He is raising hand. Dr. Akash Tandon, he may be having some emergency query, or it is just like that. Dr. Akash Tandon, you are having any query? You are raising your hands. Otherwise, hands down can be applied. Okay. So after BDS, you come back to us. We are going to train you. We will have weekly webinars. We will have exercises. And yesterday also a lot of presentations I was seeing. They have all their case sheets, they have their research, they have their papers, posters. So like that, you have to develop the knowledge. End of the year, end of the 1 year, you will get CAFO certified fellowship, and that is more than enough to go to the court and give your evidence. And I will differentiate now. What is the difference between forensic medicine expert, those who have done MD forensic medicine, and those who have studied MSc forensic science, and those who are all claiming as forensic odontologists? I will tell you the difference. Forensic medicine people, normally in India, they go to the crime scene very rarely because they sit at the hospital. So the police will bring the mortuary, mark the dead body. So they have to examine it. They have to take the viscera, take the important evidences, whatever the observation they are making, they have to make the report. Remaining, they have to send to the lab. In the lab, you are all sitting. In India, it is very pathetic to know somebody finished their BCom, MCom also, some position in the laboratory. That is no other way, because we are dearth of specialists. So the laboratory report, we have to wait. The laboratory report will come to the doctor who is handling the dead body. So both the reports will be given to the court through a expert. Again, the forensic scientist under this section 45 only, he will go to the court and give the report, and the judge will see the reports, and he has to write the judgment. And the judgment also, we have a lot of complicated approaches, like you cannot intrude the person and get the details. For example, narco analysis, brain mapping, all this stuff, you have to get permission, because we have our article, fundamental principles, article 2021. We cannot exceed the individual rights. In India, individual rights and common collective rights of the state, both are going parallelly. You cannot sacrifice individual right at the cost of public rights, or you cannot do vice versa. So in the court of law, when you go, there are many parts involved. One person going to the crime scene, like nowadays, police may be the first person, and who are all those persons involving in the crime scene? There is a team of experts. There a dentist may or may not be there. According to the awareness we are creating, we will be there in the panel. And again, you will come send the dead body to the hospital. In the hospital, there will be a forensic team, forensic medicine experts. They have to declare the person dead. There will be a team of doctors. We have to follow the protocol. Again, the evidence can be waited till the time the lab give the reports. Again, you are collecting the evidence, giving back to the judiciary portion. Somebody should go to the court and give the evidence. Then the judge will apply his mind. Again, you can call for adverse lawyers, adverse experts, like you can also appear in that area also. So this complication, being a forensic odontologist, you can involve all these things. This is news to you. You can go to crime scene, you can involve in postmortem, antemortem, postmortem, because you have to search the bite mark, you have to take the DNA evidence. You cannot be said, you go out. Anybody saying, when you are involving in postmortem, autopsy, will that general medicine person say, go out, doctor, you are taking care of teeth? If he is saying, what will you do? You have every right to examine the bite mark anywhere in the body. You will be there. Again, in the crime scene, if you are made out, then you go to press, the fourth pillar. That is also a controlling nowadays. Go to the press, you release the evidence, conduct a YouTube channel, give your views about every high profile cases. So this is how you want to keep yourself in forensic odontology subject. So before going for the opinion poll, I don't want to bore you further. So Dr. Gagandeep, so what is the next lecture?
By Dr. Sangeeta. We are having the next lecture by Dr. Sangeeta.
Check her if she is available. You give me some 2-3 minutes, I can wind up. You can check if you are ready. So I need some questions. You can unmute and you can ask me the questions, because I cannot put all the subject matter here. So in the slides and all, it's already afternoon. Put some questions. Shoot the questions. So my prescription for the dentist is, okay, let us start my opinion poll. If you are not coming, I will put the question. So out of the specialties, prosto, perio, endo, ortho, and what not, we have all the specialists. Which specialists are dealing more of forensic odontology? Just type the first letter of the specialty, or 2-3 letters as per your wish. Oral surgery is there, endo is there, prosto is there, pedo is there, perio is there. Which specialty do you think it is coming, dealing more of forensic odontology? Dr. Shivanshi, if you have forensic odontology, come to us company. We are having job opening. Dr. Sanova Samsa, oral pathology. I just started my lecture. Oral pathology is not the. Okay. You tell. I don't want to interrupt. Which specialty is having more of contribution to the subject called forensic odontology? OMR saying, Dr. Gagandeep. I started the lecture like that only. In oral medicine, Dr. Gagandeep, you are reading Indian Penal Code. If you go to court, judge will ask you first to go and read and then come back. What will you do?
I'll go back and I'll read.
And he will order the police to take you custody till the time you are reading. For concocting the evidence, I will put sections to save the victim. PSM, what is that, Dr. Namita? PSM means what? See, I will tell you.
SPM.
No, in dental disciplines, I am asking. In dental disciplines, which discipline is coming closer or dealing more of forensic odontology? In PhD, you are dealing only one topic. For example, you can deal with partial hanging. Okay, can one person hang himself? Type yes or no in the chat box. One sub question. Can a person hang himself? Kill himself? Projected to be somebody killed him? He can. An intelligent person can make the society in a puzzle. Okay, Dr. Namita saying maxillofacial is closely associated with forensic odontology. Let us see. Nobody saying pedo, nobody saying endo, nobody saying ortho, prosto. Okay, let me ask you one simple question. Which discipline is coming in the bite mark registration? Which discipline in dentistry coming in bite mark registration? Prosto. How will you make prosto out without bite mark registration? How will you handle prosthodontics? Yes. And where you are going to read, okay, pedo, prosto, both. Now you are opening. See, now I will connect every discipline to forensic odontology. I am a forensic odontologist. I will connect every discipline. If I am connected to one single discipline, I am a fool. I will tell you. Pedo, child abuse, bite marks, good. Prosto should be separate. See, there is no specialty I am saying. You are a dentist. Every specialty is contributing to forensic odontology. Bite mark analysis, all are connected. Now come to the point. All are connected. So is it right that for oral pathology is claiming? See, I am not against claiming by anyone. Everybody should claim. Everybody should claim. But they should have proper knowledge. Without reading the legalities, without having the mentors, you cannot directly enter into the court because it is very risky job. Going to the court and giving evidence is a risky job. Tomorrow the evidence may be going opposite. You may be charged. How is perio connected? Very good question. I will explain. See, forensic odontology is having two counterparts. One is dealing with the legalities, legal fraternity, teaching them dental. This is one aspect. The other aspect is teaching the legal things to the dental fraternity. So both are there in forensic odontology. So forensic odontology is not separate discipline. It is a combined discipline, just connecting, giving dental knowledge to the legal people and giving legal knowledge to the dental people. Both are connected in forensic odontology. It's in this way only it is differing from forensic medicine. You are superior than forensic medicine. Why? Because dental-legal is the discipline CAFO introduced to India. Dental-legal. In India we introduced. सच में हमने इंट्रोड्यूस किया था डेंटो लीगल. उसका पहले वो टर्मिनोलॉजी नहीं था इंडिया में. So dental-legal means we are dealing with dentists as clients. मैं एक forensic odontologist हूँ, dental-legal expert हूँ. I have my clinic, I have my consultancy chamber. There dentists will come with the notices. Some patients send to the notice. Some patients blackmailing the dentist sending the notice. And when you take the notice to lawyer तो बोलेगा आप तो गया, आप तो काम से निकल गया, आपने ये कर दिया वो कर दिया करके डरा देगा. Then he will make his own cases out of it. But when you have this dental legal knowledge, you can sit in your chamber and call all the dentists who are having trouble. You give the consultation and you can appear in the court. How many of you thinking being a dentist, you can support a dentist in the court? Type yes if you know that before. I am a dentist. I can support the other dentist in the consumer forum. Being a dentist, you can go because consumer forum notice also comes. You come to the court, you come to the forum, or you send your representative. So the representative may be legally sound. Otherwise, without proper legal knowledge, you cannot go inside the court. So, by virtue of having forensic odontology, so perio is connected. Why? Because any perio issues may be going to the court, and the particular patient may come to the court serving the notice to the periodontologist. So periodontologist will come to you to save his skin. So in that way, periodontology is connected with forensic odontology because you only can go and represent himself in the court. You have to read all the procedures. See, forensic odontology should read all the cosmetic procedures. Otherwise, how can he support you? If I am not listening to the cosmetology lecture, I don't know about chemical peeling, how the reaction will be happening. How can I defend the particular person in question in the court of law? So I have to know about each and every treatment procedures. I have to know what is implant. I have to know what is immediate implant. I have to know what is custom-based implant. I have to know what is conventional implant. What are all the biocompatibility issues? What are all the other issues, clinical issues? What are all the monetary issues? What are all the legal issues? Everything I have to mug up. Then only I will go and represent the court. So being a forensic odontologist, you are the captain of the ship for the field. Tell me any field which is representing in the court. Any field representing their own people in the court, you are the official representative. Have the forensic odontology knowledge. Be the topmost influential person inside the dentistry, outside the dentistry, legality, political, executory, judiciary, everywhere. So forensic odontology should be supported. By virtue of supporting forensic odontology, you are supporting all the disciplines equally. I am not biased. I am not biased. I have to support oral pathologist. I have to support oral medicine expert. I have to ask, okay, ये बच्चा आया था, आपने देखा था, आपने ये bite mark को register किया था, आपने police को inform किया था. I will be questioning you for oral medicine. How come oral medicine person will go to court? He cannot represent both the cases. So that's what I am saying. It is a separate discipline wherein all the dental fraternity should support. Then only I will be properly represented in the court. Very good, Dr. Kirti. You are to the point. And I am going to give you the definition, very short definition for forensic odontology. How many of you willing to take it from me? Yes or no? I am going to give you a different definition today. I am going to give you definition, very simple definition for forensic odontology. If you listen that definition, you will be saying, okay, I am joining this course. Please tell me, I am telling you, 500 people should be given free fellowships this conference itself for forensic odontology. पहले तैयार तो हो जाए, कितना लोग तैयार है? Chat box में लिखिए, I need forensic odontology subject. I need to join as a fellow free of cost. Registration charge तो देना पड़ेगा, बाद में ये मत बोलो, सर्टिफिकेट खर्चा भी हमारा ऊपर आ जाएंगे. Registration charge होगा, membership charge होगा, कोर्स फ्री है. ये अभी 3 दिन के लिए हम ऑफर दे रहे हैं. Type in the chat box. I need forensic odontology fellowship. Next year मिल जाएगा आप लोग को. हमको 1 year का nurturing जरूरी है. After the certification also, we will nurture you. We have our webinar club. We have our journal club. We have our scholarship club. फोरेंसिक ओडोंटोलॉजी फेलोशिप डॉक्टर शिवानी सिंह ज्वाइन कर लिया, एप्लीकेशन दे देना उनको। डॉक्टर आतिरा सुरेश भी ज्वाइन कर लिया, संदीप, विघ्नेश शर्मा, all these fellows won't pay any tuition fee, they will pay only registration fee and take them. This is on record because we need to support our dental community. कल commissioner of police आप लोगों को बुलाना पड़ेगा. My aim, listen to me carefully, my aim is every postmortem report should be signed by a dentist. Make a big round of applause for that. Dentist should sign every postmortem report. Without that, no court will admit it is a suicide or murder. Every dentist, any dentist, we will give the knowledge, don't worry. Any dentist, without the dentist signature, no postmortem report is concluded. हमने देख लिया बहुत forensic medicine वाला क्या क्या कर रहा है, कुछ केस नहीं हो पाता, पैकिंग एंड कुरियर सर्विस कर रहा है, बस लैब को भेज दिया, फिर रिपोर्ट इनकंक्लूसिव आ रहा है, लैब वाला को फोन करके बता दिया रिपोर्ट मत दो, उधर बी काम एम काम करके लैब में बैठा हुआ लोग। वी आर डीलिंग, हिडन एक हमारा रीजन है, उसी में आइडेंटिटी होता है। सो फोरेंसिक फील्ड हमारा forefathers ने, our forefathers left the field with the medical people and come back and we are fighting it. And India का अंदर who is taking care of forensic odontology in India? इंडिया के अंदर कोई बॉडी है हमारा अलावा, कैफो का अलावा, काउंसिल ऑफ एक्रेडिटेड फोरेंसिक ओडोंटोलॉजी के अलावा कोई बॉडी है क्या? एसोसिएशन आप भी बना सकती हो, मैं और गगनदीप और तीसरा कोई बंदा बल्कि भी एसोसिएशन बना सकता है। वो कोर्ट में नहीं चलेगा, कोर्ट में चलेगा कॉन्स्टिट्यूशन। कॉन्स्टिट्यूशन ऑफ इंडिया विल स्पीक इन द कोर्ट। कॉन्स्टिट्यूशन ऑफ इंडिया गवर्नमेंट को पावर दिया, गवर्नमेंट ने हमको काउंसिल का पावर दिया। वी आर हैविंग द पीपल नाउ। आई नीड 500 पीपल नाउ टुडे इन इंडिया। एवरी स्टेट हम अपना ऑफिस खोल देंगे, एवरी स्टेट में फोरेंसिक ओडोंटोलॉजी हेल्पलाइन होगा, एवरी पुलिस स्टेशन को कनेक्ट करेंगे, एवरी केस को मॉनिटर करेंगे, एवरी केस को कोर्ट में जाएंगे, हमारा बंदा जाएगा, रिप्रेजेंट करेगा। हाउ मेनी ऑफ यू सपोर्टिंग मी? So see how many forensic odontologists we created. I am giving my definition now. What is forensic odontology? Listen to me. I am going to give you the definition. Nowhere, no textbook says that definition. Dr. Swati, don't worry. I am talking hours of lectures. My lectures are already recorded in the fellowship program. You join the fellowship, you will get it. I am taking hours of lectures like this. Definitely you will be educated. Don't worry. You can educated more than that of lawyer. Dr. Gagandeep, add in our forensic odontology club, Dr. Rajiv also. He is talking good legal stuffs. Let him represent his cosmetology field in our forensics.
Definitely.
See, we are whether other dentists are there or not, cosmetology people को होना चाहिए, oral implantology लोग को होना चाहिए। बहुत सारा कोर्ट केस आ रहा है, चेन्नई में एक डेंटिस्ट बहुत मिलियंस कमा लिया, अभी बंद करके अंडरग्राउंड में है, केसेस इतना बढ़ चुका है, इमीडिएट बहुत हो गया उनका, इमीडिएट करके इमीडिएटली सर्विस हो गया नोटिस। तो ये लोग को हम कंसल्टेंसी करेंगे। You take it from me, dental consultancy, dental legal consultancy is going to be peak. Do you know what is the charge of dental legal consultancy? Think about an MLA, MP, minister involving in child abuse case and you are going to the court and you have to represent, and what is your charge? 50 लाख को कम तो नहीं लेने वाला है consultation के लिए। Think about, you are the high profile dentist already. अगर कोई किसी का नहीं सुनता है, डॉक्टर नीरज गुप्ता, तो कितना जीरो डाला में देखना पड़ेगा, डॉलर है वो रुपये वो भी देखना पड़ेगा। Forensic odontology practice anywhere in the country, anywhere in the world. Forensic odontologist can practice anywhere in the world because no court in the world will say you get out. No court in the world will say if you are an expert, you have the knowledge, they have to receive your evidence. Otherwise, जज के ऊपर केस लग जाएगा, evidence को tamper नहीं कर सकता है। So I think somebody not fluent in Hindi, so sorry for that, because Hindi is very dominating language. Maybe Hindi इधर आके सीखा था, मैं तो हिंदी आता भी नहीं था, but I have to go with the flow. What can I do? Okay, now I am giving my definition. What is forensic odontology? I am giving my definition. It is very simple. Shall I? You already told me you want to receive the definition. The definition is this. The definition is this. Dentistry for justice. This is my definition for forensic odontology. Dentistry for justice. हर जस्टिस डिलीवरी होने के पहले डेंटिस्ट को ओपिनियन पूछना पड़ेगा, डेंटल इन्वॉल्वमेंट का रोल क्या है। The judge should consult the dental surgeon dentally before delivering any justice that dental considerations happened. ऐसा एक केस है, एक बंदा insurance, one person to claim the insurance, he burnt his own car and proved he died in the car. So later it is proved the dental filling in the car, that person is different from that person who is claiming the insurance. Finally, they got that particular person is alive, but he made this for his own play. So endodontist also can take the role. Orthodontist can take the role. Pedodontist can take the role. Orthodontist का कैसे role ले सकता है? Age estimation, sex determination, domestic violence, child abuse, rape, all these cases. Ladies को बहुत opening है forensic odontology में. आपको कोई salary के लिए बुला रहा है नहीं बुला रहा है, least worry about it. Start your own consultancy. You will get lot of cases. कोर्ट में जाके अपना विजिटिंग कार्ड दे के आना. डिस्ट्रिक्ट कोर्ट में, आपका स्टेट कोर्ट में, सुप्रीम कोर्ट में आपका विजिटिंग कार्ड बनाना फोरेंसिक ओडोंटोलॉजी. आप शाम तक कितना फोन कॉल्स आते हैं देख लेना लॉयर्स का. मैं टाइम पास करने के लिए कोर्ट पे जाता हूँ. कोर्ट में जाके मेरा विजिटिंग कार्ड कहीं छोड़ के आता हूँ. शाम तक कितना कॉल्स आता है. हर बंदा केस केस केस. उसमें कोई भी उसमें रीजन है, कोई भी रीजन है. आपको ओपिनियन चाहिए, एज एस्टिमेशन चाहिए, डोमेस्टिक वायलेंस का केस चाहिए, रेप केस चाहिए, यही तो कोर्ट में चलता है. ऑल द पुअर्स डाउन ट्रॉडन ओनली गोज टू द कोर्ट. पैसा वाला पीपल है वो कोर्ट में जाता नहीं है, हियरिंग लेता है. तो पुअर लोग ऊपर इंजाम आता है. सो नॉट ओनली डेंटिस्ट्री इन जस्टिस, द डेफिनेशन सेज if your dental knowledge is helpful to deliver the justice, you are a forensic odontologist. If your justice delivery system is definitely helping the poor through your dental knowledge, then you are a forensic odontologist already. So that is why I told dentistry for justice. Now, many thinking forensic odontologist job is to catch the criminals, nab the criminals, to put anybody in the behind the bars. But think in this way, an innocent is framed in a case. An innocent normal person framed in a case. So in that case, only forensic odontologist can save them. No court will save, no lawyer will save, no judge can save, no dentist will save. Dentist का खुद का बचाना. Sorry to use Hindi. Some people are really opposing using Hindi. So I appreciate them. Even that regionalistic approach is very much needed. Nowadays, I support the movement for in the courts, local language should be spoken. Because officially in India, in the courts, only Hindi and English are there. But the courts should agree all the national languages and all the official national languages in the country, which is our national language of our India. What are the cons of FO, if any? I'm not getting. Can you give the mic to her? Somebody asked just now the question.
What are the basically the disadvantages or the negative points of forensic odontology?
Give the mic to her. No, I'm not getting. Just unmute her. Shoot me the question so that it may be helpful to others.
Dr. Swati.
Dr.
Yes,
Swati.
introduce
Good afternoon,
yourself,
sir.
doctor. Put me the question.
Good afternoon, sir. If you can hear me.
Just a minute. Just a minute. I will have some issues. Just a minute. Just give me half a minute. Yes, please go ahead with the question.
Good afternoon, sir. This is Dr.
Good afternoon.
Swati here.
Dr. Swati, yeah, please.
Yes, sir. So according to my question, I just want to know if there are any disadvantages or any cons, like for forensic odontology. And in case of when female dentists work for forensic odontology, are there any challenges which they face? This is my question.
Very good question. See, it is always when you have the challenges, you have the advantage also. Being a woman, this is the only field I recommend now. Not due to COVID.
Okay.
I am not shrinking myself, because
Okay.
who will represent the downtrodden women or violence in the workplace, sexual abuse from the workplace? Only women can support them, and they will tell you the truth. You know, in Delhi gang rape case, that a
Yes.
particular girl, everybody knows her name. That particular girl
Yes.
was taken into consideration her dying declaration. Okay, dying declaration is the declaration in India we are taking before dying. The person won't lie. That is the logic. Okay, in
Yes.
USA we take dying deposition. That means it is less valid. But in Indian court we are following British system and Indian tradition. Dying person won't say lie. When a person before dying, he will not say lie. So that case, Delhi gang rape case, there were 3 persons, magistrates recording the dying declaration, which supposed to be illegal, or up to the court it is to decide. I am not putting my personal comment, but why 3 people come? You know, first came the last person was all the 3 becoming the gender issues were there. I don't want to expose certain inner things, because being a lady only you can understand the other ladies' issues. They will be opening up in Indian tradition. So being a
True,
lady,
sir.
being a girl, you are having the plus point.
True, sir.
And don't think you will be posted in postmortem and all. That is up to you. You can watch the video of postmortem also. You need not
Okay.
present there, because you are even forensic medicine experts not sitting at mortuary. Do you think I am sitting at mortuary? No, I am an expert. Experts should see the things and give the opinion. Yes, please.
Okay. Okay, sir. Thank you.
So you are welcome. Join the fellowship. It is free. Only this during this conference. I will send you the application. I will give you the URL also. Just a minute. Everybody
Sure,
can watch the URL. You are noticing my screen?
Yes.
Screen is visible. Just a minute. https://www.dentrance.live. See, I am sharing on URL.
Okay, sir.
So go to this URL and fill up the form for free fellowship. I am telling you, registration fee will be there. Okay. So
Okay,
you go
sir.
to this. You go to this site, specially created for this. We have this our live conference, awards, convocation, 4, 5, 6. After that, this will be removed. Okay. You type free access. Okay.
Okay,
When
sir.
you type free access, you will get your free ticket. There you see the form, name, your primary email, which is your option, demand of fellowship. You type forensic odontology here. Okay. Then go there.
Sir.
Which Dentrance 3-in-1 virtual summit do you book? Then you type first one. Then you go back. Which one following benefits you like in this thing? You type which one you want. Then you go further. As part of corporate social responsibility, Dentrance sponsors 500 dentists per year. Free fellowships. Do you want to apply? Type yes. Which fellowship do you want to apply? Forensic odontology. You type. Again you go.
Okay.
Again you write. Like 5 people you should get reference. They should talk good about, because the fellowship, free fellowship go to the right person. ऐसा नहीं है कोई criminal case करके आ गया, हमारा degree भी ले लिया, फिर हमको उल्टा कर दिया. So you give the references of 5 people. Then you check here. I know my course fee is 100% sponsored by Dentrance. I know nominal application fee. ये सब read करके.
Okay.
Then you submit the form. Okay. You are done.
Okay, sir. Okay, sir.
So see, I give instant solutions. When you give instant solutions, your clients are happy. So that is possible only consultation. Forensic odontology has only consultation. And again, you are going and saving them in the court. There is no surgery, there is no such thing. So wonderful field for the newcomers. And if you want to put your TRP up, you want to be in public eye or not want to be, both can apply. For example, I don't want to be in the public eye. because I don't want to create enemies before the field is getting established. So that is why, think about, if in my YouTube channel, if I talk about this Mumbai murder versus suicide going on in Mumbai case, that famous actor case, if I talk anything, it will become news. So CBI may call me to come and cooperate with the team, but I don't want. So that is our opinion. Our opinion, how you are projecting yourself. Definitely you will lead a life of satisfaction in this field. Because I know many people are taking my consultation. I am also learning day by day what are all the procedures in the clinical dentistry. And in clinical dentistry, how the dentists are being exploited. 2 lakh dentists now becoming jobless. So how they are going to feed their family. So better you become a forensic odontologist and go to the court, multiple earnings. You can go only take lectures in the conferences, earn money. Yeah, Dr. Sangeeta, you can take your own time. I am leaving the screen from this minute. Dr. Gagandeep, are you there?
Yes, sir.
So I think the next speaker is ready. She needs some 10 minutes more, I think. You can allot her so that I am here, nowhere going. Anybody putting my question, you know, I am connected to everyone. I love connecting people so we can solve the issues. So with this note, I am finishing this session of why to become a forensic odontologist. Thank you. Thank you for all. Thank you for your patience.
Thank you. Thank you so much, sir, for your inspiring lecture, actually. And as we all know that, yes, you keep all the audience stick to you always. And so that's why, and a lot of regards also. Thank you so much, sir. So with this, we'll move on to the next speaker. We are having the next speaker, Dr. Sangeeta, and she'll be talking about age estimation with us. So do we have Dr. Sangeeta? Yes, ma'am. I welcome you first on our platform. Ma'am, you can unmute.
Oh, thank you so much.
Yes, ma'am.
Please allow me to screen share, no?
Yes, ma'am. I'll do that. Ma'am, please try now.
Is it visible?
Ma'am, not yet.
Okay. Now?
Yes, ma'am, it's coming. It's coming. Yeah, it's here. First of all, very congratulations and as well as happy Teachers Day to all the teachers around here. First of all, to Dr. Venkatesh sir and Dr. Rajiv for having the lecture. Now, Dr. Sangeeta, I would really wish a big happy Teachers Day to you for guiding us and inspiring us always. Thank you.
Thank you.
Yes, ma'am, I forward the stage towards you.
Okay. Very good afternoon, all of you. This is Dr. Sangeeta, and I am an associate professor in the Department of Oral Pathology from Danan Sagar College of Dental Science, Bangalore. I'm so excited to be here with all of you. I never expected that using technology in lockdown can help me to reach so many delegates of 3-in-1 dental conference and make friends. So I'm grateful that all of you are here, and thanks to Dentist 3-in-1 Virtual International Dental Conference and my host institution, Dayanand Sagar College of Dental Science, for helping me to connect with all of you. A special thanks to Dr. Venkatesh Kuppuswamy sir for inviting me as a keynote speaker in this conference. So, and for everyone, happy Teachers Day. So my topic was like it's a dental age estimation. Okay, sir told me to take this topic. Okay, and he has a lot of expectation from my side. Okay, if you have any doubts, even sir is there sir is also still there in the Zoom. Okay, if I couldn't able to solve your issues, sir is always there to support you guys. What I am going to teach you from my experience in dental age estimation. Okay. Coming to the introduction, a physiological growth of an individual, a skeleton. If you have any doubt, you can just send me in the chat box, okay? So that if not in between the session, I'll just definitely solve your issues by the end of the sessions, okay? So physiological growth of an individual's skeleton and dentition undergoes many changes till it attains a maturity. Okay, we all know all these things, and most of you are BDS students and many of you are doctorates. Okay, age estimation is very important and essential in human identification. So now the doubt comes, why dental age estimation? Yes, why it is required only dental age? I am taking a part of the forensic odontology here, so which is really matter for each and every person who is going to get a fellowship or who wants to gain more knowledge in a dental age estimation. So it can be an educational purpose, okay, governmental purpose, a job purpose, or a medical purpose, a crime investigation, in the court of law, dental-legal issues, and I'm also going to discuss about the medico-legal issues which is concerned with the forensic odontology later on. And also in the clinical practice, or the moment a patient comes to you, what you are asked, what is your age? Okay, that's because sex we could able to make out. Okay, and even the research nowadays, it is a present trend now, research-based studies which is going on, and even during the COVID, most of us are doing the research and reconstructive identification purpose in case of dead individuals. Okay, what are the other things? Okay, why we have taken dental age estimation? So we do have the chronological age. Yes, we know that the chronological age is an ideal one for the age estimation, but why we have taken that? And we have the bone age, a mental age, and the skeletal age. So all these things comes under different category, but we are considering the dental age estimation to be important procedure, has two development shows less inconsistency than other developmental features, okay, or in relation to chronological. Why tooth? Why tooth? Okay, because it is unique to a individual, as you go with the fingerprints, okay, and it is strong, hard, and resilient, and survive in case of postmortem destructions. Okay, we all know that chemicals, putrefactions, and fire explosions. Okay, and also individual from the cradle to grave undergoes regressive changes. We know that there are so many regressive alteration, and those who have studied in third year, we also teach you people what are the regressive alteration of the teeth along with the dental procedure. It is nothing but a age changes. Even in the first year dental anatomy, we also teach you guys what are the regressive alteration, how we relate what basic knowledge we have gained in our basic science into the forensic odontology. So we all know age changes of enamel, age changes of dentin. See, whatever the knowledge we have gained, so it is not going to be useless. Okay, so you should build a strong foundation, then only it is possible for you people to reach to the different branches of the dentistry. And I am just relating the knowledge what you have already gained to the forensic dentistry. Okay, coming to the age estimation, so we know that what forensic odontologists we do with unknown deceased and living individuals in case of accidents, crime, disasters, and also now because of the global increase in the migration, age estimation plays a major role to ascribe a genuine age for those living individuals devoid of valid identification document. They should have the valid identification documents. The Court of Criminal, Civil, Asylum, and Old Age Pension Protection, for everything you require age. Okay, for everything. If it goes to the court of law, they will come to the forensic odontology, not to the any branch of the dentistry. That's what sir was trying to tell, that it is not the oral pathology, oral medicine. Yes, you should have the basic knowledge of the dentistry to gain all these things, because it comes to the forensic odontology. If you have the knowledge of forensic odontology, yes, if you, in every college, according to the DCI, if you know the rules, so each and every college should have one forensic odontology department, and they have to recruit a person who is having knowledge in the forensic odontology. Okay, so if for that you should gain the basic knowledge, and you should know how to apply all the knowledge what you have gained in the forensic odontology. Okay, so coming to the history, it is the Edwin Saunders in the year of 1837 was presented the first scientific study by examining 1049 children's teeth and height, and proved teeth were the more reliable of age estimation to use in jurisprudence. Okay, in the Berlin in the year 2000, The international and the interdisciplinary study group on forensic age diagnostic was constituted. The main aim among the scientists was the most appropriate, which is the most appropriate to be specific for the specific situation, and the recommendation of age estimation and institutionalization. Please keep these 3 points are very important. Quality control in the area. Okay, and also told you that after the introduction slide, so there are medico-legal issues. Okay, we all know that, but we don't know how to apply this dental age estimation relation with the medico-legal importance. So in case of criminal responsibility, an act which is done in a child under an age of 7 years is not an offense. These are the basic knowledge you have to gain, which is very much required for you people to face in the court of law. A child under the age of 12 years can't give a valid consent to suffer any harm which may occur from an act done in faith and for its benefit. In case of judicial punishment, yes, we know that a juvenile is a person, a boy with below 16 years and a girl below 18 years. No delinquent juvenile shall be sentenced to death or imprisonment. These are the basic things each and every person has to know. And the rape, sexual intercourse by a juvenile is an offense. We have also mentioned that section 375 IPC and all these things, it's very difficult for us to remember, but what sir has told that we have to remember few which is really important as a mantra, so that it will be helpful for us, because that makes us to distinguish between forensic odontologist as well as a normal dentist. Okay, so even in case of kidnapping, yes, kidnapping a juvenile is an offense. Okay, again the section 361 IPC. And employment, a child, we all know the Child Labor Act, a child below, and we all have watched the movie also, like, you know, so he is not mature, he is a juvenile, so you should not employ. Okay, this is the basic knowledge they are spreading. Okay, but still if they keep, how to identify? So we can identify one method is the dental age estimation. Attainment of maturity, a person attains majority on the completion of 18 years, and if or she is under the guardianship of the court of wards, he attains a majority on completion of 21 years. Okay, please keep all these things. Okay, these are the basic things which we have to know, and also if you have all these points in your fingertips, so it will be easy for you people to, you know, face any interview once you finish the course, once you finish the fellowships. Okay, so it will be easy for you people to show that yes, that makes it should make a distinct between a normal dentist as well as a forensic odontologist. Okay, coming to the marriage, a girl under 18 years and a boy under 21 years can't contract a marriage. Okay, so this is against Child Marriage Restraint Act. Because of these medico-legal importance of the age, an individual may be referred to forensic odontologist to estimate age of an individual. Okay, so when all these cases comes, yes, they'll come to us. Okay, they'll come to us because why dental age? Yes, forensic odontology. We do have the forensic science, we do have forensic medicine, but why forensic odontology? Because that is very important. We have to know being a forensic odontologist. Okay, coming to the classification. Coming to the methods, okay, they have classified into 2 types according to the state of development of the dentition. Methods applied during the formation of the dentition. See, go with the basic knowledge of DADH. Okay, DADH is a basic knowledge, formation of dentition, introduction class of first year. Okay, methods for the adult fully formed teeth. Okay, so I'll tell you how the normal thing correlate with the forensic odontology and how when the abnormalities happens, the pathology happens, how we get confused in identifying the teeth. Okay, so those are the basic knowledge you should have when you get a challenging case. Okay, according to the technique of investigation, yes, we know that clinical, yes, visually, whatever we see. Okay, radiographic, okay, and histological method. Histological method means you have seen the ground section and we have seen the H&E strain sections tooth. Okay, and also physical and the chemical analysis method. So this is how we can view the teeth. It can be seen in even alive as well as a dead person. Okay, living as a dead person. Okay, stage of eruption. What are the stage of eruption? Okay, that can come under the children's, and also regressive changes, very old age. Okay, that's why you have to know. Okay, children's, middle age and very old age, what are the changes happens. Okay, even in the radiograph, same OPG, even IOPA, lateral cephalograph, there's so many radiographs we can take, and here also we can see the stage of eruption as well as the regressive changes, and also any pathology related to the bone lesions. Okay, so very important. Okay, you should have the knowledge and you should know how to distinguish between a normal pathology as well as its relationship with the forensic odontology. Coming to the histological method, I hope most of you have done the ground section in first year. Okay, if you ask me, for my students, I always teach them the ground section in the first year. Okay, you need a preparation of the teeth. Yes, this is also one of the methods which we use for the forensic odontology. Determine more accurately the stage of development of the dentition. How I am going to explain in my future slides. The technique is more appropriate for post-mortem situation. Yes, very important. See, look here, this is very important. Okay, the first two also is very important because there you can see both living and the dead, and living and the dead in the radiograph also. But here it is only for the post-mortem, because if you ask a live person to extract the teeth, yes, nobody will. But again, there is a clause. Okay, you have to ask. We can't just go and ask. We can't just extract the tooth, or we can't remove the tooth. We have to ask the permission from the medical officer. Otherwise, we cannot take the tooth from the dead body. Okay, please keep this in mind. And the physical and chemical analysis helps in estimation of age in dental hard tissue by determining the alteration in the ion level with age. Okay, these are the 4 methods. Okay, so what are the classification? Yes, phases, 3 phases. You have to remember 3 phases a person is undergoing in case of dental tooth eruption. Okay, first is the age of prenatal, neonatal, before the birth, at the time of birth, and early postnatal. Okay, so this age, how exactly? So this is one of the ideal period and most accurately we can able to measure. So the catch comes in the age estimation in children's and the adolescents till 12 years of the age. Okay, so and age estimation in the most difficult because all the teeth are erupted and we couldn't able to make out, and there are certain methods they have given, but none of them have been proved 100% which is an accurate method. You can do a research in future and you can also make a, correct method so that we can go with the accurate age estimation in case of adults. So coming to the age estimation in prenatal, neonatal, and the early postnatal. Okay, I hope you all have seen this neonatal line. Okay, in the microscope. Okay, so this is a neonatal line. You can see the deposition of the enamel in just a second. I'll just go with the laser pointer. Okay, deposition of the enamel before eruption and after the eruption. Okay, so this makes a demarcation between the deposition of the enamel. So before that, you have to know that primary tooth germ begins at 7th week of intrauterine life, and the enamel at the chronology of the tooth. The chronology of the tooth. Okay, first evidence of calcification, enamel completion, eruption, as well as the root completion. Okay, those are the basic mantras you have to learn. Okay, you have to keep in mind. Enamel formation of all the deciduous teeth completes by 1 year. Permanent teeth, first molar initiation 3 to 4 months. Only three I'm just concentrating now. Age estimation in this group is very, very accurate because it is going with the chronology. So here what they are telling, it's a neonatal line which gives a birth indicator. If this neonatal line is absent, the child is stillborn. Legal implication in this age group are in case of feticide and the infanticide. Okay, so these are very, very important. You have to know that, so nowadays, maybe I don't know in here in Bangalore, it is not common, maybe in village areas, most of the north areas. Okay, so there now most commonly the female child, so the chances of killing the female child before the birth is most common. So in that case, if somebody has to put a case, yes, so in which stage it has happened. So these are the things, legal issues which most commonly comes in the court of law. So you being in future forensic odontologist, you have to have this knowledge of age estimation, and you can diagnose the case, or you can just estimate the age estimation for those cases. Okay, coming to the microscopic examination. Okay, so why this is very important? It gives an accuracy. Any method, if we use, if it gives a accurate method, so there is nothing like 100% accurately. You can just tell that, okay, there is a 2 years old kid, he is a 3 years old. There is no accurate method. Okay, it will be plus or minus few days. Okay, but that is also okay because we are going to reach the accurate method. Okay, coming to the histological method can assess, okay, stage of tooth development during the pre-mineralization period, early detection of mineralization before the radiographs. We know that initial stage, there is no calcification takes place. Okay, so we have to know the differentiation between pre-mineralization and the post-mineralization. So once the mineralization starts, radiograph method is the best method. Before calcification before the mineralization, we can't use radiograph. Radiograph cannot detect anything. So that time you require an histological method. Okay. Coming to the radiographs, though it is a non-invasive method, so it can be used when the tooth is calcified. So there is one more method which we can use for the prenatal is a dry weight of a mineralized tooth. People have standardized 6 months of intrauterine, it is 60 milligrams, newborn 0.5 grams, postnatal 6 months, okay, it is 1.8 grams. These are the things which should be there in your mind and the fingertips, so that, so if anything which comes, you know, in between range, you can go, okay, this is a 6 months, okay, this is a newborn baby, okay, this is a postnatal 6 months, okay. So like that we have to, there are certain ages we can standardize also, even we can only detect, and we can keep that standardized chart in our institution. So Crouse and the Jordan in the year 1965 studied tooth development in 95 fetuses, okay? So provided data showing various stage of premineralization and the early mineralization of various deciduous teeth and first permanent molar during intrauterine life. So why he has taken the deciduous teeth and the first one? Only in the fetus you get the first evidence of calcification. So you should know the chronology of the teeth. First evidence of calcification of individual teeth, yes, you have to buy it. First evidence of calcification of the first permanent molar, it acts in the intrauterine 3 to 4 months of IU intrauterine life. Okay, so that's why they have taken this study. So the other methods, as I've told you, neonatal line which indicates the birthmark. So the enamel which is formed before the birth and after the birth, which we can able to detect, and also incremental line you can able to see here. These are the alternative bands. Okay, even in the dentine also you can see in incremental line is seen in enamel is called as stray of Retzius, which is present in the dentine is called as Owen, and the Von Ebner line here, whatever you are seeing is the incremental line of Owen, and the whatever the small lines imbrigation which you are going to see, those are the incremental lines of Von Ebner. They shows the daily rhythmic deposition of the organic matrix and the mineralization. That's why it shows a line in the form of line. And in the enamel you could able to appreciate these are the lines. Okay, they are called as stray of Retzius. Even in the cementum you can able to see an incremental line. The incremental line present in the cementum is called as a salter. Okay. And there is one more method, thickness of enamel and dentine from the neonatal line. Okay, if I said this is the neonatal line, okay, what is the thickness from here to the outer surface of the enamel? That measurement you should know, so you have to measure. So nowadays it has become very easy because we have advanced computer, morphometry, we can we can just take the photomicrography from the microscope, we can just place it into the and we have the digital microscope which is really advanced, so that we can just directly from the microscope we can connect to the computer, and using the morphometry software we can count the thickness, okay, and weight of the developing tooth. I told that the measurement which I have in case of 6 months and at birth as well as postnatal. Coming to the method of age estimation in children's, you have to remember 3 things. First, neonatal, natal, and the postnatal. The second one will be the children's and the adolescents. Okay, so this is one of the chart which I have taken from the all journals. Okay, okay, legal procedure such as child labor. Yes, this is the age. Okay, people who are poor enough, 12 years. Okay, they send their kids for work. Okay, for their livelihood. Employment, yes, sometimes they may lie that I am 18 years, so I need a job. So that time also, okay, even they may reduce the number of age for you know, to continue their job. Okay, and the status of majority, rape cases, adoption, eligibility for marriage. Yes, people nowadays also few areas where their child labor, child marriage is happening. So those time the forensic odontology can play a major role in identifying the age of an individual. And when the birth certificate is not available, few people don't have a birth certificate, maybe their parents may be uneducated, so but they do require a birth certificate for any employment or anything, if they have to job, for the education, everything. That time we can identify and even see, look here, the forensic odontologists play a role in giving accurate or not an accurate, I can tell that, you know, in a few years, okay, either it can go there, okay, but still we can go and give an accurate age of a particular individual. Okay, it is not only the dead, even the people who are living also can come under, can this age estimation helps them also to know their age. Okay, coming to the children's, okay, has have to do birth to puberty. Either it can be a living or deceased. Yes, it is not forensic odontology. The terminology comes here as dead individual. Okay, so even in dental age estimation, we have to deal with the living individuals. I told what are the cases where we have to identify the dental age. So 3 methods I told you: visual method, eruption sequence. Yes, I told you chronology of the tooth and the eruption sequence 6, 1, 2, 3, 4, 5, 6, 7, 8. If you remember that, okay, it will be very easy for you people. Never ever forget your basic knowledge. The basic knowledge is a foundation for you guys. Okay, if you forget the basic knowledge, you can't build any of the building. Okay, keep in mind the basic knowledge is a must to build any building. Okay, so keep that in mind. Presence or absence of the mamelons. Okay, and the radiographic method, Atlas style. Okay, it is a Skor and the Massler method, Ubelacker method, Albrecht method. Okay, I'm not talking everything. Okay, I'll be dealing about only 2 methods. Okay, there are so many studies people have done, you know, there is no accurate measurement. So I'll tell you why I have taken only the few things, because whatever the time constraint given, what you can do best in my last slide. Okay, incremental staging method. Okay, these are the Nollo method and Demerjian method, Anderson method. I'm only talking about the Demerjian method, and the biochemical method, carbon 14 aspartic acid racemization method. Okay, in the age estimation of the children and adolescents, as I've told you, 2 things you can see. Okay, so if a person is 2.5 years, okay, or maybe 6 months of a baby, okay, you must have seen that. Okay, my sister, my niece, he said that, oh, my daughter, she has a teething habit. Okay, she chews something. Okay, I told her, just look into her mouth. Okay, the tooth will be little erupting. Okay, means that around 6 months of the age. Okay, so that shows that emergence. So these are the basic knowledge which we can see visually. Okay, if she just show her teeth, yes, it is erupting. Well, how old she is? It is almost 6, like 5.5 to 6 months. Okay, we can't give, as I told you, that you have to give the range of an age, but not accurately. Okay, and the tooth calcification, yes, tooth calcification can be measured only by the radiographic method. Visual method is not possible. Okay, tooth emergence and the eruption, a convenient clinical method. Yes, we can look into the case and we can just tell that, okay, so and so age of patient. Okay, and limited to the deciduous teeth. Yes, it is limited to the deciduous teeth. Even emergence is under the genetic control, and 6 months to 2.5 years. It is not only it is limited, but extremely it is limited to the deciduous teeth. Even the first permanent molar or the deciduous teeth which is falling, and then the permanent molar which is erupting, yes, that case also we can do. Okay, so tooth calcification, radiographic method, 2.5 to 6 years and more than 12 years. It is not altered by local factors such as lack of space, over retention of the primary teeth. Yes, this is a clean, lateral cephalograms which is showing that the eruption of permanent teeth. Here you can able to see the permanent tooth bud, and these are the primary teeth which is already erupted. Okay, what are the methods? Okay, Skor and the Massler method, Demirjian method, a third molar in age estimation. So please don't confuse, so many things are there. Okay, so don't take everything into the mind and then you start identifying, yes, it is not possible. We have to go with few standard methods which published articles, and we have to make our own method to that particular region or the location. Skor and the Massler method, okay, in the year 1941, first attempt at scientific dental age estimation. It is a first attempt, that's why I have shown this. Okay, illustrate 20 chronological stages of the dental development spanning the period of 5 months intrauterine life to 21 years of the age. Okay, this is very, very important. The chart is based on the histological session which permit direct comparison with a radiograph. Yes, as I told you, there are so many methods are there, but if we could able to see both histological, radiographical, even the bio, yes, that gives us a more accurate method of dental age estimation. Okay, what it does not differentiate about male and whether the teeth is a male or female. Okay, so this is a chart they have given for the deciduous teeth. Okay, you must have seen mixed dentition as well as a permanent dentition. So the 5 months of the intrauterine life, the tooth bud formation, all those things have been shown. And always remember that you have to compare with the standard chart and the radiograph what you receive from the patient. Okay, Demirjian method in the year 1973 assess. Okay, see, just remember, you have to be very concentrated on the studies which a particular authors have done, because they are assessing only mandibular left third molar. There are so many questions, and why mandibular left? Why not right mandibular? Yes, if not right, we can do it. Okay, so they have not done the study, we can do it, and we can tell that, okay, these are the things, observation method, which we come across when we are doing the research study. On radiograph, development of the mandibular teeth was divided into 10 stages and numbered 0 to 9. Okay, stage 1 is a tooth calcification yet to begin. Okay, in this stage I told that histological method is the best method, and the crown completion, yes, and the completion of the tooth calcification and the root apex formation. Okay, so these are the stages I'll show you. So look into this is a stage 1. Okay, for individual teeth, incisors, canines, molars. Okay, and the last stage where the development of the tooth is present, even the root apexes, everything is basics. You should know how to correlate with the dental age estimation in the forensic odontology. You should have the basic knowledge and then correlate with that. Okay, it's a very easy method. Okay, Demirjian and colleagues provided a different maturity score for each tooth development stages, and also for the male and the female sex. The first method, Scholz and Massler, I told that they cannot differentiate between the male and the female sex, but here he has given separate chart so that we can able to distinguish between the male and the female. Okay, these are the formulas, standard formulas you have to use, and again you need a computer, you need a software, you need a micro Excel. Okay, so only thing, you have to calculate the value and you have to enter it, then you get the approximate, whatever the approximate ages. Okay, here again he has given the standard chart, okay, for the score. Okay, you can compare this with the chart. What is the disadvantage? Okay, this method, they developed on children of European population. Okay, so when I was just go through the literature research, okay, so once it comes as a European, what about the Indian population? What about, I'll concentrate on the Bangalore, people who are staying in their different location, you have to concentrate. Yes, it is not possible. Other population result in overestimation. Yes, you should have this knowledge. Okay, whenever this is called as critical analysis of an journal. If we know the critical analysis of a journal, what is the advantages of this journal, what is the disadvantage of this journal? Again, one more thing I would like to tell, that if you are really good at your academics and if you are really good at your research, yes, you can give a standard age estimation procedure. Okay, only thing, you have to show your interest. Yes, if you get recruited in any of the hospitals, colleges like this, okay, just because you have done you finished your forensic odontology, yes, there is a job vacancy is there, because they want a forensic odontologist only because the department and the DCA has given. So for that, once you come here, what you are going to do? Okay, you get a court of law. What exactly in an academics you can do? You can do the research. Okay, so here this is one of the option for you people. Okay, Tendon tested Demirjian's method of age estimation in South Indian population. Okay, this is an article, okay, found an overestimation of 3.4 to 2.8 years in males and females respectively, and concluded that it is not applicable. So there is one more study which is done by Acharya. Okay, he has given a particular formula for the and a modification for the Demirjian's method. Why they are developing all these types of different studies? Because the one standard method which they have used, it is showing either overestimation or the underestimation of the age. So how many years? Yes, that also we have to keep in mind. Okay, is it specific to the particular location? Yes, we have to remember that also. Okay, and what are the other methods which has been done to our Indian population? Okay, which population it has been done? Okay, if it is in European population, does it fit to our population? No, if it doesn't fit to our population, how we can do, what we can do? Yes, we have to do our research here. So that question has arisen in me. So we have to do research, we have to develop one standard method for the Indian population. A third molar in age estimation. 3 methods I told you guys. This is the last method for the age group between a children and the adolescent. A third molar, we all know that is the last molar which erupts, okay, 16 to 23 years of age. If you ask me, my maxillary third molar has not still erupted. A valuable indicator of age. Why it is a questionable accuracy? When it comes to accurate, yes, I can tell that, okay, what is the age? My third molar is not erupted. What is my age? Am I still 23 years? No. Great variation in the genesis. Okay, this is what happens in case of third molar. And the position, yes, so most of us will get extracted with the third molar because either it is a bulk buccally erupted or mesioangular or the distroangular. Okay, it can cause ulcer. And the morphology of the third molar, yes, nobody knows the morphology because each and every tooth has a different morphology. And the time of formation, as I've told you, Now still my third molar is not erupted, but I am not still 23 years. Okay, just keep all these things you have to know. So when you have to use an age estimation method using a third molar. Based on the caller and the co-workers, okay, so they have an individual with 18 years, okay, 18 years means why it is very important, age of maturity. So it is the age of majority in many jurisdictions around the world. Yes, he is a major, okay, all 4 third molar have completely calcified. Okay, he has found that in age 18 years, and the chances of 96.3 and 95.1 for the males and individual. So people who don't have third molar, all 4 third molar, as I've told you, my first third molar is not yet erupted. If they don't have the third molar, lower third molar are the best predictors of whether the individual is 18 years or old. Okay, let me ask you guys, okay, how many of you are having third molars with you guys now at present? How many of you are having third molars? Okay, how many of you got it extracted? Okay, how many of you have got it extracted, or impacted tooth, or how many of you got it removed, the impacted tooth? Okay, 2 you have, okay. So how many of you got it removed? You are impacted. How many of you are having impacted tooth? If you have 2 teeth means, so other 2 teeth are impacted. Okay, so many of us have not able to make out in this third. Practically, if you ask me, okay, this is a theory part, yes, impacted, yes. So at this age, what we can do? So those are the biggest question marks. Okay, this is food for thought. I am giving you a chance. Okay, what to do there? You have to do a research work, okay, in these cases, because these standard people are telling, okay, these are the years, if tooth is not present, yes. So I am asking, if it is impacted, what we can do it? Yes, go with the methods, use your own methods, go with the OPG methods. So what are the identification? Use your knowledge, think out of the box, don't think narrowly. Yes, that person has given the same thing in the book, what I can do. Yes, you can do many things. Okay, so think out of the box, do your own research, give the standard procedure and publish it in your journal so that it will be helpful for you guys. And you can standardize in your own institution, and you can use that method. Once you standardize, people will start following you, people. Okay, they'll come and ask you which method you have used. Okay, this is a method you have used. Okay, how much accuracy rate? Yes, so and so. Oh, very good. Can I apply it in my institution? Yes, you can do it. Okay, that gives a raise in the standard of forensic odontologist. Okay, there is one more studies by Camerier. He used a third molar maturity index. Okay, so here I completely closed apical root. Okay, so if you have impacted tooth, those who have answered to me or those who are shy enough to answer openly, okay, just go with your OPG and look into your OPG. This is a Camerian method. If your apical root of the third molar is covered, left third molar is covered, so then your Camerian third molar maturity index is 0. Okay, so we know that it is 0. Okay, according to the study done. If it is partially closed, okay, what you have to do? You have to take the inner distance between the 2 apical end divided by the tooth length. So what is the accurate measure? Again, this is a study. Yes. So is it differ from one region with the other? What third molar happening with? Is it different? We can differentiate between a male and a female, or even the region from Bangalore, from outside the Bangalore or outside the country. Is there any difference? Yes. These are the things you have to think out of the box. Results and conclusion. The sensitivity of the test is 0.08 value was 74.7. Okay, 66. Okay, specificity 83. Okay, the probability that Indian individual with an Camerian third molar index is more than 0.08 in 18 years and older is 78%. For all these things are not giving any 100% accuracy in the age estimation. So this is efficacious to determine age in Indian population. Just go through this method, go through this article. So try out in your own institution and try out in your own research study. And I'm telling you guys, the same result may not come for you people. Whatever the results comes for, yes, that is also correct. That is also correct. You can do your own research and you can come up with the results. Okay. Alfantini method, it is one of the most recent widely accepted atlases of dental development and alveolar bone eruption of age estimation in the children and adolescents. Chart does not differentiate between sexes. Okay, this is again, it is not going to differentiate between. The chart consisting of 31 diagrams. Look into the diagram. You have to read. from depicting the median dental development observed starting with 30 weeks of uterine and ending with 23.5 years of age. Alquentin chart defines it as an emergence through the alveolar bone. So there I told it is the eruption, oh, here it is through the alveolar bone. The method concluded that tooth formation is the least variable in childhood and most variable after the age of 16 years for the development of third molar. Okay, so the variability in the tooth formation is less in case of childhood, but after the 16 you can able to see most of the variables in because of the development of the third molar. So one of the best method is the technique is available online in numerous languages. Okay, so there is no language problem. Okay, you can use in any language. Okay, so third part. Okay, two things we have finished. The final part. Okay, the method of age estimation in adults. Okay, adults means 20 to 23 years. More than that, okay, completion of the growth. Okay, we'll call it at once is growth spurt is completed, tooth development of the tooth is completed. Okay, and as I've told you in the beginning, it is a less accurate method and a limited techniques. Okay, why it is limited techniques? Because of the changes in the dentition are influenced by, one is the age of the patient. Regressive alteration, as I've told you, regressive alteration are nothing but attrition, abrasion, erosions of both hard and soft tissues, and endogenous and exogenous factors like diseases, physical strain, and the nutritional problem. Okay, so coming to the methods, morphohistological, radiological, and the biochemical method. Okay, so most important, which I always teach for my UGs in third year, is the Gustafson method. So how to remember this? ASP CRT, it is a standard method, but so there is certain disadvantage of Gustafson method. Okay, it is used for age estimation of the adult using regressive alteration. If you know regressive alteration in general pathology or in oral pathology, yes. If you know the normal anatomy, yes. If you know the normal anatomy, measurement, dental anatomy thoroughly, basic knowledge, chronology, eruption, everything, yes, you can go with, you can play this like in your fingertips. Okay, then you'll come to know that what are the pathologies. Okay, it is attrition. A stands for attrition. ASP CRT, it's very easy to remember. Secondary dentin deposition, loss of periodontal ligament attachment, cementum apposition at the root apex, root resorption, and root dentin translucency. Okay, ASP CRT, you know the normal anatomy, you know the regressive alteration which is happening. So if you know this two things, so it's very easy for you people to do the age estimation in forensic odontology. For each of these regressive changes or the variables, different scores you can give. Okay, he has given Gustafson 0 to 3 were assigned. Okay, the attrition depending on the amount of attrition, A0, A1, A2, and A3, and similarly one of the 4 score can be given for loss of periodontal ligament attachment, cementum apposition, root resorption, T1, T2, R0. Okay, like that. And again he came up with a formula. Okay, A3 plus S4, and he calculated, he counted all the things, he added up and got the X value. The maximum score of one tooth is 18. Okay, these are the basic knowledge you have to keep. The more severe the age, the higher will be the score. It was found that increase in the total score corresponds to increase in age. Okay, so more the attrition, the more age. Okay, more the secondary deposition, yes, older the age. Periodontal, more loss of periodontal, but where is the catch comes here? So are they aware of the diseases happening? Okay, what are the diseases? Food habits of the patient, okay, so or the dead or living individual, and you know, even in the root resorption, any pathology happening, developmental disturbances, big question mark. See, there is a lot of things we have to go with in order to mention the age estimation. These are the things we can just tell ideal tooth. Do we have ideal tooth? What dentition have? Do you have the same thing? Maybe in my age, if I go with 10 female, do they have the same amount of teeth what I'm having? No. So please keep in so you have to update your knowledge in the pathology so that you can relate with the forensic odontology, so that you can become a best forensic odontologist. Okay, age estimation, he has given this formula 11.43 plus 4.56. So I told you how to measure X, ASP CRT, add everything. Okay, and then get the X, add here, go with the age estimation. So here, if you see, this is the normal tooth, okay, where the attrition has happened. Look into the amount of attrition in the 35 years, less attrition. So he has given attrition 1. So more the attrition 2, a secondary dentin deposition. Here you have the secondary dentin deposition. So more secondary dentin deposition. So the scoring will be more. The recession of the gingiva, which I couldn't able to follow. See, this is the gingiva which is present. If it reside, okay, if the root of the tooth is visible, so depending on the visibility of the root, so we can tell that the recession of the grade, the recession of the gingiva, and we have the periodontal probe also, so that we can measure accurately. And again, everything is important. Sir has told that, you know, perio is important. See, you should have the basic knowledge of the dentistry so that you can relate the basic knowledge with the forensic, okay? And the cementum buildup, okay? We know that, and the root resorption, okay? Limitations, variables cannot be used alone. Yeah, you can't just use attrition alone, you can't just use resorption alone, okay? You have to combine everything so that you can get the X, okay, X score, okay, except dentin translucency, okay? So once he has told the dentin translucency, yes, people started doing the study in dentin translucency, giving an acceptable age estimation when used alone. Training of histological techniques is necessary. You should have a basic knowledge, okay? Equipment such as stereo microscope was required. Yes, to measure S, it is required for us to know about the structure of the enamel, dentin, cementum, okay? If one tooth is used, the age range increase significantly. So we cannot use one tooth, so that you have to use on the multiple tooth, okay? Gustafson method is a significant contribution to the forensic dentistry, but Newmany and associates, due to the inaccuracy in his calculation, it has been discredited. Okay, there are many studies have been discredited, but of the 6 criteria used by Gustafson, the assessment of the area of the root translucency has proved a single reliable age change. So who has come now? Johansson came in the year 1971. Examining the method concludes that 95% confidence limit is approximately plus or minus 14 years. Okay, age estimation from the adult tooth is more accurate with modified Gustafson method when multiple factors are used. Okay, you can't just use this, you have to use multiple factors. Okay, he gave the modified version using the same 6 teeth. In this method, a relative reliability of each age changes as the age marker is taken into control. Instead of 0 to 3 count, he gave multiple grades: 0, 0.5, 1, 1.5, 2, 2.5, and the 3. You can use your own method also. Again, I'm telling you guys, if you have a basic knowledge of ground section, if you know how to use stereo microscope, if you know how to use digital microscope, you can do anything. You can play with this, okay? But only thing, you have to standardize the method. You have to standardize the method, or you can go with the one standard method. How you are going to distinguish, how your study is going to distinguish with the standardized method. What new inputs you want to give in your age estimation? Yes, you have to keep that in mind. So again, he gave a formula like this. Yes, again, attrition, secondary dentin deposition, periodontal loss, cementum opposition, root resorption, and all these things. A computer based, you should have a basic knowledge of computer knowledge. Okay, multiple regressive technique is calculated for the age estimation. This has resulted in improvement with 95% confidence, and the plus or minus 14 years or minus 10.3 years. The improvement made by Johansson is widely accepted. And when I was talking about Gustafson method, I told that dentin translucency is used as a single most, we can use it. Okay, that was the thing. So you use it. You take few 50 teeth or 100 teeth and you start using the dentin translucency. Why we can make, whether it gives an accurate result or not. Yes, you can do that. Okay, undergoing translucency during the 3rd decade of life, have this basic knowledge. Begins at the apex, advancing coronally. Yes, see, this is a translucency which you can able to see. It begins with the apex and advancing occlusally. Okay, and diameter of the dentinal tubules decreases due to increase in the intratubular calcification. So again, I told you people, if you are confused with the things, go to the DADH Orban's book, read the age changes. You have recent Orbans have a age changes of dentine, and you will come to know everything. Okay, refractive index. The differences in the refractive indices between the intratubular organic and the extratubular inorganic are equalized. Why it becomes translucent? Okay, because of the intratubular organic and the inorganic become equalized, resulting in increased translucency of the affected dentine. Okay, so because of this, so we can able to find out the translucency. Depending on the measurement, we can able to find out the age of a patient. Ban and Ram measured the length of the translucency of individuals of different ages and reported predictable increase in root translucency as age advances. As age advances, there is an increase in root translucency. Now you know what is a root translucency, where exactly, why the root translucency happens. So when you look into the 10 cases or 20 cases, yes, how much, if it is an increase in the root translucency, you can go with the, you can just directly correlate with the age advances. Okay. Advantages: intact teeth or ground section teeth, convenient approach for post-mortem estimation. As I've told you, nobody will allow us to extract a live tooth. Okay, a person who is alive, so he won't allow you people to extract and to find out the age estimation. So we can do a post-mortem age estimation, and you have to take permission from the medical officer. Again and again, I'm telling you guys. Inexperienced examiner also can measure. So I'll tell you that, okay, root translucency is nothing but it's a translucent area which is present from the apex of the tooth to the coronally. So I'll tell, okay, this you have to measure. If it is more, what is the experience you require? Okay, so you should have the knowledge. A forensic odontologist have the knowledge and the measurement knowledge, how exactly you can relate, okay, how to make it more accurate. Okay, what is the disadvantage? Irregular junction between the translucent and the non-translucent region. So here, see, there is why this irregular junction. Which translucent area you want to take? Here you want to take from here to here or from here to here. This is the disadvantage of the study. Okay, so you should make some standardized method, and you can do your own study, and you can give that, okay, from here to here, where which is the most accurate and which gives the most accurate age estimation. Age estimation from the incremental lines of cementum. Okay, so these are, again, I told you that this is called as incremental line of Salter, which we could able to see in acellular cementum, and its accuracy is 2 to 3 years. Okay, this is what a study says. Almost hypomineralized bands can also be seen. Okay, in case of pregnancy, skeletal trauma, and the renal disorders. Okay, what is the disadvantage? Again, all histological method disadvantages: tooth extraction. You need a technician for doing the sectioning. Okay, and the destruction we are doing. Okay, possible in only dead individuals. Living individuals, we cannot do the age estimation. And in case of pathologic state, yes, we can't expect regular incremental lines. Okay, the next method which you can use, the radiographic method. So non-destructive method. Yes, we can use both for living and the dead individuals. Yes, you can take the OPG, and if you have the cases of patients which comes to a department in the oral medicine, you can take OPG X-rays, and you can also estimate the age for a study purpose. Okay, but in case of when you have to really examine in a clinical practice, yes, you have to take the OPG or the lateral cephalochrome or the periapical radiographs. Archaeological studies, judicial setup which prohibit tissue collection. Yes, as I've told you, we have to take the permission to extract the tooth, where if they don't allow us, but still we have to identify the age. Which method you are going to use at that time? You have to use a radiological method. Wall et al. Proposed a method and estimation using the secondary dentine deposition by measuring the pulp radiolucency on periapical radiograph. Okay, he has used 6 teeth. Okay, and he measured the tooth root length. Okay, from the tooth to root length. Okay, from the pulp to root length, and he also used root to pulp length. Okay, root length. Okay, so and also he has used longitudinally as well as a cross sectionally. Okay, he has from the midline and from the coronal region and from the apical region. They come with a formula like this. Okay, you have to put from the width to length and come with a age estimation. There are so many radiographical methods. Okay, Van Hyderen developed 5-stage system, developing mandibular in the mesial root of the mandibular third. He has done this study. He used panoramic radiograph. No significant difference between the male and the female. Okay, he come into the conclusion that there is no difference between the, And Yang et al, he used cone beam computed tomography. Again, you have to think about expensive feasibility of the study which you are using, the feasibility also, which is really important, whether the facility is available in your institution or not, how to get that, whether funds are coming, whether whoever wants to get to know their age estimation, are they paying us? Okay, all those factors which make us to identify, and they have told that pulp tooth area ratio could be calculated with promising result using 3D images. And recently an automated software for dental age estimation was developed, which comprises the most accurate and referable morphologic and the radiographic technique. This software gives quite results, automatic selection of the borders of the pulp and the tooth, less subjective area, less error. As I've told you, a software, if you just take the photograph and if you place it, okay, so it gives a less subjective. Any study, keep in mind that if it is objectively analyzed, okay, so we can just tell that, okay, this is the method which I am using. No, what are the criteria which you are using? You have to objectively analyze, and the more reliable results will you get. So the third and the final most method in case of identification is the racemization of amino acids occur in rapid rate in metabolically stable proteins such as enamel, dentin, and cementum. Have this knowledge. We are going with a dental age estimation. So it is the L-aspartic acid which is present, which undergoes racemization and converts into D-aspartic acid. So the amount of D-aspartic acid is increased, means there is an increase in age advances. Okay, so Helfman and the Bada proposed that the ratio between the D-aspartic acid and L-aspartic acid enantiomers in aspartic acid from the enamel or coronal dentin can be used as the age estimation. So Ritz also gave that, and he has used the different method by using dental biopsy specimen obtained from the molar of a living individual. If the tooth is caries or if they have removed the tooth for any other reason, okay, so that tooth he used and he made a study close relationship between the extent of the aspartic acid racemization in dentinal biopsy specimen and the age. So the second method is the radioactive carbon which is present. Okay, Splangit et al. Amount of radiocarbon present in the tooth enamel is remarkably accurate predictor of age, and it gives, but it is very sensitive, restrained access to the instruments, and you need an expertise. So if we have the facility, yes, we can go with a more advanced procedure again. So we should think about the feasibility. The challenges, what are the challenges we have to face? Okay, the lack of uniformity of the methods. I only told you that there are so many studies have been done. We have to standardize, and it differs from one region to the other, male and the female. Okay, so many things. Okay, because these methods are population specific. Keep this in mind always. These methods are population specific, difficult in keeping record. Okay, so national database is required. So we all can contribute, all the forensic odontologists in our region, if we do this study and we can contribute to the, we can make a standard data record we can keep, otherwise it is not possible. Literatures can be misleading because of the different factors, such as studies done in single case study. Okay, few people just for the sake of doing, they do the study. Okay, they don't give the proper results. Okay, they want just publication. So if you do the study like this, it is not possible. Application of different statistical methods. Yes, one statistical methods, other, yes, again it gives a difference. Same sample, small sample size. Yes, as I've told you that the sample size varies from one region with the other region. And if you take only, if I take only group of population who is present in our college, yes, what about the group of population who is present in North Indian colleges? Okay, if they take only small group of error is present. Intra and inter-observer variability. If we don't go with objective method, okay, if you just give, I give it to sir. Okay, sir will tell, okay, this is this measure. Sir, sir, this is. So if just give to all the forensic odontologists, if they make them observe, individual observer will give different measurement. So this is called as intra and the inter observer variability, different populations of the study. Okay, so as I've told you, it is population specific. The keys to optimal dental age estimation by Williams and Associates, the investigator should be sufficiently experienced. Yes, you should have the knowledge. Don't get the forensic odontology degree certificate, and if you want to keep quiet, you will get a job. No, again, I'm telling you. You guys, you should have a knowledge. Multiple investigators or a second opinion is very, very important. If I get a doubt, there is nothing wrong in asking the other person. That's why sir is making a group of people. He wants to build more people so that we can support each other. Use of multiple age estimation methods. One method is not sufficient. So because as I've told you, there is so many variabilities are happening. That's why we have to use multiple methods. Careful adherence of supportive protocols, including the use of specific equipment, proper storage of two specimens is very, very important. Use of multiple teeth. As I've told you, few people have used only the molar teeth, few people have used canine teeth. So, you know, only left side of the teeth. So accuracy of the age estimation is not possible. To conclude my presentation, numerous methods and the studies have different applications, accuracy and the reliability. Age estimation based on the dental findings will be representation of most likely age as compared to the actual chronological age. Interdisciplinary approach. Yes, you have to approach forensic medicine, forensic odontologist. Even if you want an OPG, you have to go with the oral medicine person. If you want any histopathology sectioning, you have to be with the oral pathology people. Okay, so all you have, that's interdisciplinary. So it is not one person. You have to have the knowledge of different approaches, and you have to take the support from everyone. In case of questionable identity, if you are not able to identify, interdisciplinary approach is the best method, which enhances the contribution of forensic medicine and the medicine and the dentistry in case of legal jurisdiction. So with my best of knowledge, I would like to tell you guys, with this, will you able to identify the age estimation? No, it is not possible with my just one talk. You have to sit and do. Let me tell you the overall gist of my age estimation, how you can go about in your studies, or if you have to do anything, okay, once you have established your own forensic odontology department, or if you got joined to your college and age estimation, if you are doing any research study. So you have to remember age estimation, living and dead, okay? So in that prenatal, natal, early natal, children's and the adolescents and the adults, you have three, okay? In that you have three methods under each: morphohistologic, radiographic and the biochemical method. Use one or combination of standard methods, okay? So one or combination of the, as I've told you, it shows variation in the age estimation. So you should have that basic knowledge. Go through the region specific research studies. Okay, so I am in Bangalore, I go with a Bangalore based. I'm in India, I go with them. If you are in Gurgaon, you go with that region specific, because that there is a variation in the age estimation. Standardize your next. If you want to become a proficient forensic odontologist, you have to standardize your own method in your institution and to the specific region. So wherever you are located, you have to standardize, and that study, if that research will get published, and if it is accurately, if you are able to get the age, yes, people will start following your own age estimation studies. These are my references, and thank you for your patience listening. I would like to thank all the participants, sir, as well as the Dentris members, whoever is working offline and the online. Thank you so much.
Thank you so much, ma'am. Thank you so much. It was such an exemplified lecture, and like for the first time I've seen someone teaching age estimation, that too in very, very much depth. Even we have been reading age estimation in oral pathology since our third year and final year BDS. But you know, even our books also, the textbooks also doesn't give the information in that to depth and that to clarity. Even I would like on my personal note, I would say that Schaeffer's also don't give the information that to with very clarity. I would definitely say that.
Thank you so much.
Like now you have cleared everything, putting up everything into classification. That would really easy to like understand also and grab for longer. So that was really exemplified actually.
Thank you so much.
Thank you, ma'am.
So
Thank you so
if
much.
anybody is having any doubts, they can just clarify. They can mail it to me, or like, you know, so anything if they require, they can ask me.
Thank you, Dr. Sangeeta.
Thank
She
you,
is
sir.
a very, very good academician. I met her in Bangalore conference, and she is our part of our fellowship program, and we are very proud and honored to award you the fellowship in this convocation, and so that we will get your services and research abilities and your guidance to the students And
Oh, yes.
oral pathology is my favorite subject. If you take my mark sheet of UG,
Okay.
so I was proud to be saying this platform. I scored first class. You know, those
Okay.
days the marks getting means studying means that book, pink color book, or we call it Shapers,
Okay,
is
sir.
wonderful. So we used to. I think as Dr. Gagandeep told, textbooks won't talk about research stuff. That is a
Yes.
practical ongoing process. So that is why those books are not presenting. Secondly, we have to update urbans and wheelers through our practical knowledge. I
Yes,
think
sir.
your institution and college is proud to have you kind of research
Thank you so
ability.
much.
So that more and more publications, and on behalf of Dentrans and CAFO, the council, what we are planning, we have to act now, because like ICMR for medical field, let us exist with various organizations, but as a council, we have to start our research program. People like you start, even government fundings possible, because
Okay.
we are going to submit the requirements. So the government also can fund the research activity, and we can create employment also, like research
Yeah.
scholar, JR-ship, SR-ship, we can create out of that funding. So definitely I will be in touch, and you are already part of our panel.
Yes,
And
sir.
our research wing, there should be more PhDs coming.
Okay.
All departments of MDS should come to PhD for forensic odontology. That is my dream. And fortunately, I am with the UGC, you are with the DCI. So both will connect together to give this opportunity to the dental community. And more importantly, there should be some chapters added in the forensic odontology in general dentistry at UG level regarding this all criminal procedures, IPC, CRPC, CPC and all. So that when the judges asking, for example, nowadays the problem is primary evidences not available, because the criminals are getting stronger and brainy. So they mitigate the evidences. So we have to go with the secondary evidences. No criminal will read Gustavus method, isn't it? So we have to put forth all these things to the judges, so that judges will go with the methods. Like they will ask which method you are following, this method. Okay, what is that previous judgments? This is it. Then that is done. Even your secondary evidence or corroboratory evidence will stand as a primary evidence. And in the courts, we are seeing sometimes DNA also not acceptable, but these age estimation methods they are accepting because it is available in the textbook. You have to quote it and get the judgments done. So your service, being a oral pathologist, definitely very much needed to the forensic community. Not only in forensic odontology, general forensic community also will be running after you, because you have the methods, you have the mathematical figures that this method is tested, this is proved, this is available in the textbook, and we have to definitely put supplement topics to urbans and wheelers according to Indian standards. Because in Indian pattern, eruption pattern, I don't think we have to follow the British pattern or the other foreigners pattern. According to our climate, and for example, many textbooks says socio-economic status directly proportional to the economic means oral hygiene. But in India, it is inverse. I don't have any study. So the study should be motivated. So people like
So
you
we
should
have to develop some standardized procedures, sir, so that it will be helpful for everyone. Like,
yes, for
so,
that
like,
only I am claiming every dentist should combine together. It should not be
Yes, sir.
compartmentalizing and showing here also showing people are no, it is not your field. What are you doing in this field? So we have to combine together. People like you should definitely motivate us. Thank you,
so much.
wonderful lecture.
Thanks a lot, sir. Thanks a lot. Thanks for giving me this opportunity. Thank you so much.
Definitely, I am seeking for the future that we'll be having some chapters written by Dr. Sangeeta in our Schaefer's books. Definitely, I am actually expecting, and ma'am, you can request the writers, also the editors of that book, to add on your chapters, and you can be one of the editors of that book. So we'll
Thanks
be
a lot,
expecting it in
Gagandeep.
near
Thank you
future.
so much. Thank you so much. Thank you so much. Thanks a lot. Thank you. Can I leave now?
Yes, ma'am. So moving ahead with our current line of sequence of speakers, I think after this power pack session with a lot of knowledge we've grabbed, we are having our renowned speaker again, Dr. Rajiv, with us. So I think we can continue his lecture within 5 minutes of break. Will that work for everyone? He'll be joining us within 5 minutes. So we'll be having his lecture again on clinical cosmetology as well as the treatment procedures. So one of the interesting lectures, and you all can call upon your fellow mates to join, because this is going to be actually a wonderful one. So we'll be starting up within 5 minutes. I hope everybody is here with us. We are having Dr. Rajiv with us connected for the session. So I hope all the participants are back and we can give a head start to the session again.
So shall we start with the lecture?
Yes, sir. So for all, I hope everybody is connected with us and along with the fellow mates also. We're going to start up, and for those who have missed the first lecture by Dr. Rajiv, I would like to introduce the speaker again, that Dr. Rajiv, he has completed BDS from Government Dental College, Hyderabad. He has completed PGDDC from SS University, Australia. He's done PDGMT from Greifswald University, Germany. He is also an AAI instructor, Phoenix, USA. He is a renowned consultant cosmetologist, trichologist, and a facial aesthetist. He's practicing since 6 years and is an expert and has an immense knowledge on cosmetodermat procedures and trichology. He has been working as the cosmetology head for many corporate centers which were leading in South India. So now we'll be moving ahead. Sam, am I audible to you?
Yes, yes. Sorry,
Okay.
actually, give me just a second. Give me just
Okay,
a
sir.
second.
Okay, sir, no problem.
I'm getting these phone calls. I have to follow up the patient. That's what. Sorry.
As I always say, you are in great demand.
Yeah. Now 1 second. I am technically a little bit weak. I'm sorry.
No problem, sir, no problem.
Where is it? Where is it? Yeah. So yes. Now we'll start the session.
Yes, yes, definitely.
Yeah, I am not bothered about introductions or anything. Only thing is you guys have to learn, right? So that is our main motive. So we, in last lecture we had almost 85 or someone like that. So now coming to the clinical cosmetology. So I hope some guys are practicing here, but trust me, whoever were practicing recently, I don't think you guys know much, honestly saying, because I have seen the standards of some people, some doctors. See, treating the patient in a single session and choosing an exact procedure to a particular condition matters. I know I'm hurting some people, but this is the fact. When it comes to me, it is like, you know, I always try to give result in single session, and I have to show the difference that I'm unique. So this is how I work, and this is how I learn either. So I learn from all the possibility ways, and I experiment several things on the patients. But during experiment, like, you know, while doing experiments, to what extent you have to go, and to what extent you should not. If you know this, if you know this little difference, then you can be out of danger always. And coming to the clinical cosmetology, as you're dealing with face, you have to be very careful while dealing the face. So whatever peels you want to do, whatever procedures you want to do, obviously, as it is an face index is an index of everything. So it is like, you know, if you don't show a visible result, obviously you don't have a good practice, right? So now, you know, I don't know, actually they gave me only one hour or 1.5 hour, what, like, you know, depending on the lecture, how people were showing interest, right? So within 1 hour, you know, I tried so much, so in order to teach you, but now I got only this solution, and I was trying to teach you. See, I was initially, we'll see some pictures, and then we'll go into the subject. See, why is clinical cosmetology, why is dentist or any other people entering into the field? The major fact is most of the dermatologists are busy in their practice in town level, especially in the city level. These kind of processes are doing. Actually, doctors are not looting. Always corporates will loot the money. Doctors does it very genuinely. So when I worked for the biggest branded clinics or a cosmetology centers or a slimming centers in South India, I have noticed, you know, they don't even find a result. You know, for chemical peel, they charge almost 1 lakh to 1.5 lakh also by giving 10 to 15 peels. But ultimately, after one session also, they don't get result, because there was a cosmetologist who was not a doctor, who trains the doctors, and these dentists go there and get trained by a non-medical or non-dental or non-certified doctor, and they come out and they say that they know the cosmetology procedures. And is it a true fact that you have to accept that she or he is a cosmetodermit or something? No, I think so. So always learn from the basics. If you learn basics, obviously you can crack the world. If you don't know basics, you just know, like, you know, for pigmentation you have to do this peel, for acne you have to do this peel. If you are in that way, you will never get developed. So this is the fact. Now actually, as dermats are busy into dermat practice, so most of them were entering into the field, and obviously these procedures, most of the procedures are not by dermatologists also. When they come out, even they learn, and if you have almost a long experience, you're far better than a fresher in cosmetic dermatology. But I don't know how, like, you know, it is all about how much you learn and how much subject you have, in what perspective you see, and what to apply, where to apply, and how to apply. And kindly mute. I don't want any disturbance. Not I have these issues of, you know, I forget things. Next, start the slide. Start the slide. Am I audible?
Sir, we are having the acne.
No, the slide is not visible actually for me.
Okay. I'll just share it once again.
So now, acne,
Now?
the first pick is acne, right? What is acne?
You can see now.
Yes. Go ahead. Next page. Change the page. Yes. So now, actually, this is an outline only. So what is acne? Acne is not, I'll give you everything in a short term, this thing. So now when it comes to acne, what happens with acne? What is the basic principle? Why acne outbursts? Why a pimple is outbursted? So in last lecture, we have discussed about about sebaceous glands, right? So there are pores all over your skin. Whether you find a follicle or there a follicle in that pore, or you don't find a follicle, you have a pore over there. If pore is nothing but a follicle that is coming out, so the follicle in that region, you definitely have a sebaceous gland link up with the hair. So once when you have this pollution effect, or when you use this moisturizer, like, not branded, when your skin, when you have some kind of menstrual issues, your sebum regulations changes actually. And any cosmetics that were applied on the skin, like makeup or anything, which clogs the pore. That means the pore is clogged, and even though you wash it, there are minute particles that were left out, and you find an accumulation of the bacteria called acne vulgaris into that. And obviously after this bacteria outburst into a pimple. So whenever it is clogged, right, so obviously the clogging happens, and you can't, there is a bacterial outgrowth. So obviously the bacteria creates some kind of infection, which outbursts as a pimple. So now, actually, I have said you, right, any procedure, when we discussed in trichology, I always divide all the subject into medical management, and I rely more on the medical management along with the procedures. It is not like, I do only procedure. In some cases, I only advise medication in order to make the client trust me, and that medication give immense result. Obviously, they'll come to me back. And this is where I leave money from the first session, and I'll show the result, and I'll grab double the amount for the next session. So these are the things while going into the practice you have to get to know. And what are the treatments that were involved in acne? The first session, the first line of treatment is medical management, that we'll go further. And the second one is chemical peeling. And the third one we can do is IPL along with IPL laser. So medical management, chemical peeling, IPL laser, and some kind of home remedies can also be done, but I don't advise home remedies. But most of the things can be cured on hygienic, like when they maintain proper hygiene. Next, Gagandeep, you have to be active. No, I was watching you. No, is it okay? Is it working? Did you change the slide? No, I am not audible. You are not audible. Am I audible to anyone?
Yes, so you're audible. I changed the slide. It's melasma.
No, I don't find. There's
not
problem
changed,
with that.
but I've changed it.
Yeah. That's all right. Yeah. So melasma. What is melasma? Melasma actually occurs at the age of post-menopause or pregnancy, or any kind of hormonal disturbances that happened in women. This is more predominantly 80%. You can see that in women. So apart from that, melasma can be treated. Melasma can also slide didn't change.
I'll do that again. Actually, I'm changing from my side.
We have less time, Gagandeep. Be active. Yes.
You can see now.
So this is you have melasma is nothing but you have a bilateral pigmentation from grayish brown. Okay. So or whatever kind of marks that you have on the left side, you have on the right side. So what are the regions that were involved in melasma? So the same pigmentation that you are seeing in the image, right? This can be happened exactly above the eyebrows, and exactly above the upper lip, and exactly on the parotid region, and mostly on the nose. So how can you treat melasma? So most of the dermats, why the melasma clients approaches this cosmetology centers is, most of them try to give medications which are steroids, which worsen the condition. So when you start a steroidal therapy, you are creating some kind of injury to the stratum corneum. Any sort of steroidal ointments that were applied on this melasma, the skin gets habituated to these steroids, and when the steroids are discontinued, or when the steroids are used for a long time, the pigmentation gets worsened. And in this case, the chemical peeling is only the option, or Nd:YAG laser is only the option, or Nd:YAG laser is the option, and chemical peeling is the option. And along with that, steroidal treatment and non-steroidal treatment can be taken. So I said you right, as even though it is the situation is worse also, I try to treat with a non-steroidal treatment. The next image, go fast. Did you slide it? It didn't change.
Yes, sir, change dark pigmentation around lips.
No, it didn't change. So now dark pigmentation along the lips you have to take. So dark pigmentation around the lips is like, you know, you as a dentist are more prone to the more prone to the oral profile, like you see it, right? So obviously you find some darker lip patients, and that is a concern for them. So in this kind of patients, there was a new peel that was launched, and you can use the lip peeling ones. You can use the CO2 fractional laser, and you can use steroidal therapy. Like, you know, some kind of steroids can be applied on the lip, and non-steroidal you don't have for the lips. And there are some laser therapies which can be done. Is nothing but carbon laser facial. So anyhow, we go in depth. You have the image is not projecting. The slide is not shared.
I'm actually opening up.
So we don't have time. We'll go with that. Then the under eye dark circles. So these are the things actually. These are the clients. 1 second. Slow. You just see the images. People, you guys can note it in your notes. So under eye dark circles. The next image. So you can see the neck pigmentation over here. So I'm going a little bit fast, but as we lack time, if you give me, like, you know, if you try to understand me, so that you know, we can cover a lot of topics. The next, you guys have seen neck pigmentation. This is acne scars. And next, unwanted hair growth, especially in PCOD women. Next. So open pores. Next. So warts and tags. Next. Stretch marks. Next. Underarm pigmentation. Next. Go ahead. So skin lightening. So it is not a skin whitening, skin lightening. And double chin. Yeah. Tanning. Next. Done. Right. So now go to the first, now go to these slides that we were dealing with. So under eye pigmentation, you have seen the picture, right? Most of the people feel it as a concern. Some have darker pigmentation and have some have a very dark also. So in that treatments, some kind of light can be advised, and chemical peeling can be done. So chemical peeling also, you know, you have to do it very carefully, as under eye darkness or around the eye is a very sensitive region. You have to be very particular about, you know, you have to be very particular about dealing those kind of procedures. But people think that they don't find any kind of result and they go for home remedies. But you say that, but you say that you can do it. Obviously you can charge 4,000 to 5,000 per single session, and it takes almost all 6 to 7 sessions depending upon the severity of the darkness that they have. So next, sorry.
Yes, we have discussed morning, mein.
Yeah, and neck pigmentation. So what neck pigmentation? Actually, skin is more sensitive than neck. Sorry, face is so sensitive than neck. So in neck pigmentation, so you can go for a strong peels or any kind of laser procedures. So laser procedures can be done, chemical peeling can be done, and there is an equipment called microdermabrasion which has a suction with an abrasive agent where you can abrade the skin either by a diamond powder or by a abrasive probes kind of thing. So the next one, the acne scars. Acne scars can be treated by PRP with microneedling and PRP, and acne scars can be treated by machinery like microneedling RF, which is an advanced machine, but the mechanism is the same. And the next one is CO2 fractional laser. So the next one, unwanted hair growth. Unwanted hair growth can be treated by a cosmetologist through lasers. There are 2 lasers that have been operating, like, you know, that have been used in hair removal. That is, one is IPL laser and the other one is diode laser. IPL laser has lesser wavelength, diode has higher wavelength. IPL works on darker pigmentation. IPL works on darker pigmentation, and diode works on every hair condition. So the next one is double chin, I think so, right? But the slides are not changing. That would be a very problematic for the next session. Try to see it. So open pores. most of the people come to you with open pores also. Doctor, I have an open pores, I have an acne, what can be done? So yeah, this is fine, Dr. Pooja. Actually, when we go with this now, this is just, I have to come back to this again after discussing the second PPT. So don't worry, don't get panicked. At the end, you will understand everything, just like the trichology. So this is like, you know, actually the lecture which I take, most probably initially it will be like, you know, I'm going fast or going way, but at the end, you'll definitely understand it. So open pores, in open pores, you can go with microneedling or microneedling RF or laser therapy. So laser facial can be done here with IPL, and microneedling RF can be done, and microneedling can be done. Like microneedling RF is nothing but, you know, a machine operated, and microneedling, sorry, it has an RF with a microneedle attached, and microneedling is nothing but you do it with your hand with a machine. But when it comes to microneedling RF, it has a separate cartridge where electricity is passed into it. So whenever it is passed, it creates some kind of injury on the skin. But in microneedling RF, you don't find much injury. But in microneedling, but in normal microneedling, you find some kind of bleeding. But in microneedling RF, you don't find any kind of bleeding. Next. Is it changing? See, this is how time goes out.
Yes, sir. Change its watts and tags.
No, it's not changed here. So the next one is watts and tags. Most of the clients come also. So when it comes to watt removal, electrocautery is the safest thing. And you have a spot pen, which is like 1500 or 2000 rupees. You can find in the Amazon also. So you can remove watts and tags and moles also. The next one, stretch marks. So when it comes to stretch marks, you see, the result of the stretch mark depends upon the age of the stretch marks. Stretch marks is most of the concern. This is how women who were practicing in cosmetology, like, you know, if really they have an immense knowledge, they can treat every procedure. So obviously stretch marks beauty is a concern for every woman. So stretch marks, if you say that you treat stretch marks also, there are a lot of clients that approach you. So chemical peeling is one procedure. CO2 fractional can be done. Microneedling RF can be done, and derma roller, to an extent it works, but it not works that effectively. Even derma pen can also be used. Next. So underarm pigmentation. See, this is grade 2 kind of underarm pigmentation. If you have a lot of fat accumulated in the skin, obviously you find some kind of, when it is in neck, it is called acanthosis nigricans. So it is the same kind of thing where it is difficult to treat, but can be treated. It is not that difficult. Initially, for initial doctors, it might be free. In this case, you can go with the stronger peels in the chemical peel, and for under eyes, you have to go with lighter pigmentation. For melasma, you have to go with medium depth peel. So in that way. So underarms, it is nothing but skin. So even though you do a medium depth peel, there is no issue. Even though you do a deep peel, even though it doesn't burn that much. So some kind of laser procedures can be done, and some kind of skin lightening treatments can be done. For any of the procedure except hair removal, whatever procedure that I do, I always advise home care. I always advise medications. Next. So skin lightening. Actually, a lot of people ask about skin fair. Can I get my skin fair? Man, how can your brown skin turns into white? It never. But the skin lightening and the skin rejuvenation and the skin texture changes so that the beauty of the skin will be enhanced. For this also, the first and foremost priority for this is the medical management. And apart from that, chemical peeling helps you. And Nd:YAG laser, which is nothing but Q-switch laser, you can find some kind of treatment like, carbon laser facial, which is called Hollywood facial also. And apart from this, face washes and home care products can be given. Face wash, I said you right, salicylic acid. We have discussed about salicylic acid in the last class for seborrheic dermatitis. That salicylic acid and glycolic acid can be mixed and can be used as a face wash. If you use it, there is an exfoliation on the skin as it has an acidic content. So obviously the texture of the skin changes on gradual this thing. And glutathione IV can also be given. According to the FDA requirements, glutathione can be given 600 mg of glutathione. According to the FDA approval, only 600 mg of glutathione can be injected per day. So you can advise the patient to take 500 mg of glutathione tablets, or you can advise the patient to advise the soaps which include glutathione, and along with that you can advise glutathione capsules. You have this sublingual. Recently there was in market with sublingual glutathione absorption, where if you spray it in sublingually, obviously you can find some kind it delivers almost 1,000 mg of glutathione. Next. So double chin. So the upper part is in the upper case, you can do a surgical procedure where you give an incision in the neckline exactly. So when you give an incision and remove the fat and suture it again. So when it comes to second case, a HIFU can be used, which is nothing but fat lipolysis, and Kybella, which is an injection for lipolytic injections, can be given, and some other basic machineries which doesn't work, but only these two will work. Next. Yes, of course. See, Dr. Amla, most probably whenever you do this glutathione, or I said you right, more 99% of the cosmetology procedures are maintenance therapy. So you have to give it for 6 months and then stop for 2 to 3 months, and again they have to use it. Most of the film stars does it. So actually glutathione is an enzyme that is produced in the body. So side effects, there might be a lot of side effects that we can discuss later. So skin tan. So chemical peeling and laser. See, as it is absorbed, as it is generated as it is an enzyme, it is generated in the body. So obviously you don't find any defect, right? Side effects, don't ask side effects, which irritates me really. Always ask about adverse effects. So see, these and all with the medical terminology, when you ask like a layman, so obviously you have to be particular with other people whenever you approach the client. If you use this normal terminology, you get habituated with that language, and you can't project much to the clients. So your consultation matters a lot in cosmetodermat process when you are practicing cosmetic dermatology. And tans, in normal tanning, glycolic acid peel can be used and lasers can be used. And now go to the old PPT, next PPT. So now we are discussing about skin. See, why to know about the layers of the skin? So this is not the subject. I was just giving an introduction. So when you deal with, see, most of the doctors, I said to you like in the morning session when I was taking, so most of the doctors doesn't want to know the basics. They want to get into the procedure directly. If you don't know basics, if you don't know how skin reacts, if you don't know about skin, trust me, people, your friends might be practicing cosmetology or trichology. Ask them what. See, you guys have listened to my lecture in the morning, right? It makes for me to give you a knowledge of the hair cycle within 15 minutes. But till now, who were practicing, 95% of the people doesn't know what hair cycle is, and they just do it blindly. They don't know. They just do a PRP procedure and they just bluff the patients really. So, and when I see these kind of doctors, I get really irritated. See, you are already into the field. Why can't you enhance your practice? Why can't you enhance your skills? Why can't you study a little bit? Why can't it is just a video, you can see it, right? So whenever you have this kind of knowledge, when you don't have a knowledge, you can't answer to a patient, because all the patient have seen, all these patients will see everything and come to you, and they'll interview. It's like, you can't leave the patient, you can't leave the money, nor you can't answer the question. So this is what. So coming to the skin, actually, so there are normally 5 layers of the skin, and there are 5 layers of the epidermis and 3 layers of the skin also. The 3 layers of skin is nothing but epidermis, dermis, and subcutaneous fat and hypodermis. So epidermis is nothing but the outermost layer, and the middle layer is dermis. See, most of the scar revision, you have to, in most of the cases of scar revision, you have to go to the dermis. If not, you have to play the game only on the epidermis. So it is a very technical game that you have to play on the skin. So either if you are finding some kind that it might get in complicated, initially wash. The first amount of water, the first thing that you have to have your clinic is the tap nearby when you are practicing chemical peels. You should ask the patient to clean it. So apart from that, so why is these layers of the skin important? See, when you do any kind of procedure, when you do a procedure with a procedure like chemical peeling, so there are different classification of the peels where, you know, there are superficial peels, medium to deep, medium depth peels, and deep peels. So when it comes to superficial peels, how come it reacts with the skin? Where does it go? When you do with the middle peel, when you do with the medium peel, how does it react? And when you deal with a dermal peel, see, all these peels, if you don't know about the classification of the peeling, and if you don't know about the subject, so if you don't know to which layer it is penetrating, the depth, to which depth it is penetrating, obviously you'll be like, you know, you can't treat it, right? So see, suppose if you are going with a skin whitening, so obviously you have to be on the superficial layer, you should not go deep. So in that case, if you do with this deep peel, so obviously it doesn't make sense. Obviously you're trying to ruin the skin. And what type of skin condition, what peel can be taken? So that is how I'm not, the PPT is not visible, Gagandeep.
Sir,
Oh, sorry.
I've shared
Sorry.
layers of
see it.
skin.
Okay.
You able to see it?
Yeah, I'm having water. Yes.
So you're able to see it? The layers of skin?
Yeah, I'm having water. Yeah.
Okay.
So now you can find epidermis, dermis, and subcutaneous fat. So you can find, you can find the follicle, you know, the vascularity in the subcutaneous fat, and the dermal papilla, the attachment of dermal papilla to the follicle, or the bulb, is in dermis. So most of the cutaneous nerves or sensory nerves will be in the dermis. That is why whenever you have a burn, when the injury when you had with the stick is different from the injury that you have with the sensory nerves. Most of the cutaneous nerves are sensory. So they give you, skin will also send reflexes to the brain whenever you feel whenever you touch a person, or whenever you had an injury or something. So now we have gone through hair follicle and everything. The first layer is stratum corneum. So stratum corneum, whenever you use an ointment or a cream, the stratum corneum gets disrupted. So the next one is stratum spinosum, stratum granulosum. Stratum granulosum is found only in the palms. Right? You have finger palms, right? So stratum granulosum is in palms, and stratum spinosum and stratum basal. So this is not that important when to go inside, but try to learn the layers of the skin. Right? Next. So chemical peels. Chemical peeling or cosmetic treatments that can be applied on the face, heads, and neck. They can be used to improve the appearance or feel of the skin during this procedure. Chemical solutions will be applied to an area being treated, which causes the skin to exfoliate and eventually peel off. So what is the mechanism of chemical peeling? So when an acidic content or chemical peeling is nothing but acids. You are dealing with the acids. So when an acid is applied on the skin, so obviously acid hurts the skin, right? So as it has an acidic nature. So whenever it hurts the skin or it damages the skin, so you are creating an artificial injury to the skin. You are nothing but mimicking the skin to make an artificial injury to which includes some kind of healing, and the dead cells or the outermost layer of the skin is peeled. It is not like you are creating an injury into the dermis. You are creating an injury onto the epidermal layers. So whenever you had this injury, obviously you don't find a scab formation, you don't find an inflammatory response, you don't find a scab formation or anything. And if you are not careful while doing these procedures, obviously you may end up with scab and the patient will sit on your head. If you suppose if a patient approaches you and he or she ask you that he has a wedding, and you have to be very careful while selection of the peel, and always make sure that only if you are confident, take that cases. If not, they'll sit on your head really, and they can sue you also, because these are the visible things where they have a photographs and you'll be literally behind the bars. So always think that even at one point I do think that I don't know something. So in some cases also it happens, but I literally say to the patient that I am going with a strong peel. So it might be a scab formation. So nothing to worry. This is what I motivate the patient in the first instance either. The next one. So coming to the classification of, okay, fine. So when you see these results, obviously we can find out that results. Those are not photoshopped actually. So now coming to the chemical peels, what are the functions of what does a chemical peel do? Actually, it lightens unwanted pigmentation and it evens the skin tone, brightens your skin, smooth out rough skin, lighten acne, blemishes, and prevent future outbreaks, diminishes lines and wrinkles, increase collagen and elastin. So remember this slide, Gagandeep. Whenever I ask you, you can project this again in the end of the session. Along with that, melasma can be treated. Freckles can be treated. Freckles are nothing but melasma is that kind of pigmentation where you find an entire thing. But melasma is nothing that you find some kind of dark birthmarks kind of thing, but not black in color, but brownish in color. So those are freckles that might be, you find a lot of freckles in the whiter skin people. So when you see a whiter skin people, they have this, they have these freckles all over their body also. So freckles, fine lines can be done, under eye darkness can be done. See the image while I'm speaking, under eye darkness can be done. So coming from the forehead. So you in some patients, you have a forehead pigmentation. You have a pigmentation just anterior to the, just anterior to the temporal muscle. You have pigmentation over there. Some have a nose pigmentation. Some have a pigmentation around the cheeks. Some have a pigmentation around the lips. Some have pigmentation. Some have pigmentation around the lips, and some have pigmentation around the neck. So when you see a patient with all these conditions, you have to choose what kind of peel you have to do in order to give a better result. Suppose if you do if you're doing your peel is going good, so obviously the remaining colors the remaining structure of the skin gets little bit lightened and the pigmentation looks little bit darker. And that way you think that the pigmentation is increasing, but it is not actually. So that is why you have to see when I see a patient, even though if you call me after 1 year or 2 years, I'll say what condition the patient might be now, and what condition the patient might have, in what condition she is when she's approaching my clinic. So what are the results that I can assess? All these runs in my brain, and then I'll take a consultation. So according to that, I'll say you get only 40% of it. This happens only after after you do on repeated patients, on repeated cases, on repeated peels. Which peel gives you a result in one session, which peel gives you after 2 sessions, which give peels, what kind of result that you can get after 2 to 3 sessions. Next slide. So now classification of peels. Classification can be done in 2 ways. One is alpha hydroxy peels and the beta hydroxy peels, depending on the nature of solubility. And the other one is according to the, it is not level of injury, according to the depth of the peel. So it is superficial, medium depth, and deep peels. Now coming to the AHA and BHA, you can come to this screen again. If not, we'll go with the second level: superficial peels, medium depth peels, and deep peels. So when it comes to superficial peels, in what conditions they were used? It reduces skin damage and improves skin texture and scars as a result of acne. But actually, does it works on scars? I don't think it works on scars. So superficial peel is used in tanning, is used for under eyes, is used for, tanning is nothing but skin damage, is used to have skin texture. And in some cases, superficial peel can be used in treating melasma, in superficial melasma, rather than in dermal melasma. In dermal melasma, you have to go with other peeling agent. And along with that, acne can be treated. But acne, while treating acne, as it has an inflammation, so we have to go with medium depth peels. So medium depth peels. Medium depth peels are smoothens out fine wrinkles and correct the pigmentations. Actually, pigmentation correction can be done. Fine lines can be removed. Melasma can be done. Melasma can be treated, and neck pigmentation can be treated, and lip pigmentation, around lip pigmentation can be done, and I think that's it. So the next one is deep peels. Deep peels are nothing but pyruvic peel and phenol peel. Pyruvic peel is used in scar revision. So that is the strongest peel that I use. So when you do pyruvic peel, is the only peel that enters into the dermal region. Like, it doesn't enter into complete dermis, but it almost all reaches into the dermis. So be aware when you do those kind of cases, because you have to see in the medical legal aspects also. So now coming to the classification of alpha hydroxy and beta hydroxy peels. So alpha hydroxy peels are glycolic acid peel, lactic acid peel, mandelic peel, citric acid. So now coming to the glycolic peel. Glycolic peel is extracted from, okay, fine. So these are alpha hydroxy peels, and alpha hydroxy peels are oil soluble, and beta hydroxy peels are water soluble. 1 second. So actually, beta hydroxy is oil soluble, and alpha hydroxy is water soluble. So actually, what does this AHAs do? Actually, AHAs exfoliate the skin and the topmost layer of the skin to give an even appearance. And when it comes to BHA exfoliates the skin more deeply to clear the pores and to cleanse the pores, and in order to clear the congestion also. So now actually glycolic acid is derived from, alpha hydroxy peels are derived from sugarcane extract, milk extract, fruit extract, and so now coming to the next point, these alpha hydroxy peels, okay, I will go with individual this thing. All right. So glycolic acid is an alpha hydroxy peel extracted from fruit, sugar, beets, and sugarcane. So I don't want to read this upper part. So I can go with this processes so that we can save the time. So actually, when it comes to glycolic peel is a universal peel. If you don't have money to start your practice, only first thing is you buy a centrifuge, and then some kind of PRP material you can buy. With centrifuge, you can start your practice by buying a centrifuge which costs around 6,000 only. And along with the centrifuge, you can buy some kind of material which would invest where 2,000 to 3,000 you can get all the hair material that you get. So whenever you have this, whenever you want to start a practice, first thing, if you don't want to buy anything, have this glycolic peel. This can be applied in every condition. Glycolic peel has certain, glycolic peel have certain certain concentration. Glycolic is available in certain concentrations, like 33%, 50%, 20%, 25%, depending on the company manufacturers. And it is used in acne. Post-inflammatory hyperpigmentation is nothing but if you are ruining the skin. So obviously you find an injury and the next day you find a black mark or brown mark or white mark, which is nothing but post-inflammatory hyperpigmentation, which is not, so inflammation took place and scab formation might have taken place. So that's how. So the melasma can be done. Melasma can be treated in, but most probably melasma don't use glycolic, but you can use some kind of mixed kind of peels with glycolic and some kind of superficial peels like lactic acid and kojic acid. Kojic will go with the other way. So then seborrhea is nothing but seborrheic dermatitis. I have discussed earlier with seborrheic dermatitis, where it is an advanced treatment, advanced stage of dandruff. So photoaging is nothing but, you know, skin gets aged because of sunlight, so that can be treated. Suntan can be treated. So hydroquinone tolerant skin. Hydroquinone tolerant skin is nothing but, I discussed about a few things about melasma, right? In melasma, steroidal and non-steroidal therapy can be done. Acronesis happens. What is acronesis? Acronesis, it is like, you know, the skin get habituated to the peel, to the chemical peel, to the steroidal therapy. So it becomes more darker. So in this case, like, you know, hydroquinone is the steroid that is used over there in melasma. That hydroquinone can be treated, that hydroquinone intolerance can be treated by glycolic peel. So when patient comes to you and say that, doctor, I was using this cream and I got completely dark, in that cases you can use. Even in most of the face washes, you find that, you know, I have this kind of result when I use this face wash. So most of them have this hydroquinone, which makes you more darker. If you are getting fairer as fast as possible, so if you are getting fairer as fast, it is the same way you'll ruin your skin the same way. So how much fast your skin lightens, that much fast your skin might go darker. So for sensitivity skin also, it is universal peel. Now lactic peel can be used in under eye dark circles, can be used in melasma, can be used in exfoliation of dead cells, and, you know, facial wrinkles utna, like, it doesn't work that much. Dark circles can be improved, and uneven skin tone. See, this is, lactic acid is nothing but a party peel. So when you are advising this party peel, when a patient approaches you that he or she has a marriage in 1 week, or, like, you know, 4 to 5 1 week, then you can go with lactic peel. But I am sensitive to lactic peel. It is a very superficial peel which gives an immense glow. So lactic acid 15 to 20% can be used, and in some cases then some companies they come with lactic 80% also. But don't trust those companies. They don't have that compositions. So that is what lactic is derived from, like, you know, milk. So hyperpigmentation and age spots can be done. Next. So Mandelic peel also can be done in dark circles and skin lightening procedures, skin affected by folliculitis, and uneven pigmentation, blemishes, and aging of skin utna kaam nahi karte. Yeah. So this Mandelic peel is derived from almonds. Next. So ferulic acid is nothing but, it has an antioxidant properties. When you have these antioxidant properties, you know, there are some free radicals that is released into the skin, which create some kind of damage to the skin. So it has an antioxidant properties. You know, it inhibits and neutralizes their action and enhances the effect of vitamin C and vitamin E. So whenever you have, when you do this ferulic peel, just be cautious. Ferulic peel is a very good peel. You get a lot of glow when you apply it. See, actually the downtime of the ferulic peel is, it has to be applied for only 10 minutes. But I used to ask the patient to apply it for the whole night. So these are some kind of experiments that I do, and I'll give my telephone number. Whenever they have some kind of complication, they can contact me. But I have a very good result within 1 to 2 sessions. The next one. So it can be treated melasma, photoaging, skin darkness, uneven pigmentation. You find a very, very good skin texture with ferulic peel. I love really ferulic peel. So pyruvic acid. Pyruvic acid is the most strongest peel. So it works in acne scars, not on the inflammatory acne. If you are using some kind of medium depth peel, always try to use it. If it has to be used for 10 minutes. If it has to be applied and it should not be washed for 10 minutes, then try to make it only for 7. Initially, when you start, try to make it only for 6 minutes. So in that way, increase your thing. Try to check whether you are getting a complication or not. So that and all during hands-on we'll be teaching. And then warts can be removed as it is strongest peel. Photoaging can be done, photo damage, medium to deep wrinkles, and moderate acne and inflammatory acne. Right. The next. Now I just want to take a break. Like, I'll just take one half minute or something. So any queries? Meanwhile, let's take a break and we'll have some queries. Is it okay, Gagandeep?
Yes,
Is it okay?
sir. Yes, sir. I think we have some questions there in the chat box.
You can
We
read
can
it.
give them a look.
You can read it.
Dr. Amala is, after stopping glutathione usage, does it make us more darker?
It is not like that. Glutathione is an enzyme. Why does it make it? But when you stop, when you had a strong peel for one session, and obviously you are not maintaining it without sunscreen or anything, obviously you become dark. It is not like reversible, but it is like, you have to maintain according to the skin. Like, like you got a result in 1 or 2 sessions. So maintain that result by giving some kind of moisturizer, some kind of glycolic acid and salicylic acid peels and everything. Next one.
The next question is from Dr. Swati. So how does
No need
presence
to ask
of
name. You can ask.
Okay.
See, there is no identity. We have to learn subject. Identity matters a lot. Next.
How does presence of an underlying disease, if any, affect the results of the treatment, and how do you go about the case selection?
So how does presence of any underlying disease? Obviously, when you are anemic, do you look healthy? See, the skin.
Pale face.
Obviously, whenever you have an underlying disease, you don't look good. So it is all where your skin glows. Your skin texture depends on how much water you take and how much what kind of food you take and what kind of care you take about the skin. So if you are if you are a marketing agent, you can't take care of your skin. If you are in any other things that we can explain, if you are working in an industry or a factory which produces a lot of dust or something, you don't find that much effective. So if you are working with the dental labs, people who are working, they don't have this. So this is how. I hope you got on. You got. If you want, you can text another time. Next.
Yes, the next question is, how long the effect of each peel lasts on skin? Will the texture of the skin return back?
See, if it is a medical condition like pigmentation or anything, whatever you treated will not be reversed back. So in these cases, what you have to do is, in these cases, you have to maintain them by, this is what I'm saying. See, the concept is small. If you are dealing hyperpigmentation or skin lightening or any kind of beauty related treatments or a pigmentation related treatments, maintenance is most important by advising this salicylic acid and glycolic acid face washes. And you can take my contact details also. I'll give you a very good brand which gives you a very good results also. And I trust in that because I choose the unique compositions which no other people have. See, in melasma, most of the people doesn't know what prostacyanins is, but I advise the patient. But some kind of medications are there either. See, tranexamic acid, a lot of patient doesn't know, a lot of even dermis doesn't put it. But I have experimented on all these things, so definitely I find result within 1 or 2 months. So I don't rely, this is what, right? Pooja, I don't rely on treatments. I rely on the home care that I provide. So treatment is just, you are damaging the skin and you are getting the skin back into the duty of the home care or the duty of the products that I give maintains the skin structure. The next one, is there any need of treatment again after a few months of, obviously, Obviously you need some kind of treatment. Glutathione and all, like, see, this is, the word looks so familiar as film stars take it. So obviously they come to your clinic thinking that they're reading the reviews of glutathione and come out and say that, I took glutathione, I get fairer. But the problem with this is you get fairer. I don't say anything. But whatever the metabolisms or the stress life or something goes wrong, so something changes in your body, obviously everything changes, right? Oral glutathione is also enough, but you have to go choose a very good brand. This is what, right? See, whatever topics that I was dealing, people are more tended to glutathione treatment. But trust me, when compared to glutathione, there are other treatments which give you an immense result and money also. Why to take complications? Isn't it? See, obviously after 2 months, he was charging 8,000 or something. And after that he comes and sit on your head. You don't know what kind of glutathione, which company gives you a good thing. Actually, I use some kind of imported products. I was trying to import them. Next one. Sir, you mentioned laser treatment for hair removal, but in our, so does continuous laser affect skin and cause damage? That is not there. See, damage through laser is the defect of the technician. It is not the defect of the skin, or it is not the defect of the machine. It is the defect of the technician or the doctor that is operated. So laser hair removal. See, laser hair removal is, rather than permanent laser hair removal, we have to say it as a laser hair reduction. So I'll go through the lasers and I'll explain you, Dr. Rav. What? Okay, fine. Yeah, Nitya. Next. Okay, now go to the topic. Go to, sorry. I have to change it, right? Yeah, is the slide visible? Am I audible? Am I audible? Am I audible? So I don't know where Gagandeep went. Okay, fine. Is there any queries where you can post? We'll go with that.
Yes, sir. So one question is, are the chemical peels similar to chemical exfoliation?
See, chemical peels, chemicals, as these are acidic in nature, we call it as a chemicals. So exfoliation, can you repeat the question once?
Chemical peels are similar to chemical exfoliations.
Yeah, obviously. See, actually there are a lot of chemicals which exfoliate the skin. Hello?
Yes, sir.
Am I audible, right?
Yes, sir. Yes, sir.
It's better you put it in a chat so that, okay, all right. So, yeah. So, chemical exfoliations, any kind of chemical might exfoliate the skin. Any kind of chemical might exfoliate the skin because it is creating an injury. See, the exfoliation terminology comes when you are using it for the benefit of the skin. So whenever you are dealing with the skin, right? So the exfoliation has to be, the exfoliation is the prima facie for us, right? So whatever components or ingredients that the peel has would show the effect of the skin. So suppose you take a kojic acid, it is a skin whitening. So it reacts with the skin, and then it comes out with a very good effect, with a positive effect. It is not like, you take a hydrochloric acid and apply on the skin. So even though if you dilute some kind of dilute HCl into 10 to 15 times and with the water and you apply it on the skin, mostly it might exfoliate because there is a chemical in it, right? So the way of perspective should be different. All right. So now, is it retinol peel?
Yes, sir. Yes, sir.
Any queries we got?
No, sir, not yet.
Yeah, fine.
We'll take up after the end of the session.
No, I want to have a break. That is why I took it. Got me?
Yes, sir.
Yeah.
Yes, sir.
So now, retinol peel. Retinol peel is a skin peel that, I think it is done. No. Retinol peel is nothing but retinoic acid. Retinoic acid is nothing but yellow peel. most 99% of your business runs with yellow peel. Most of the doctors know, most of the patients know this yellow peel, because yellow peel gives you an amazing result. And after that yellow peel, if you use this vitamin C serum or these face washes that I advise, would give you would maintain that result. So yellow peel is a medium death peel actually, so which is used for, you know, fine lines, fine wrinkles, and any kind of pigmentation issue. Any kind of pigmentation, you have to have this yellow peel in the treatment part. So see, you can see superficial scarring utna nahi hote. Aging manifestations, stretch marks, I don't think so. Melasma, sunspots, and uneven skin tone. Yeah. Next. So azelaic acid is used especially in acne. So azelaic acid creams are also available in the market. So actually it has an antibacterial properties, and you know, it regulates the serum, and it inhibits the bacterial production, and it inhibits the outburst of the acne, and it can be used in regulating pigmentation and such. So I don't think rosacea might work. IPL rosacea is nothing but, you guys have seen this you know, a pinkish blemishes on the face, especially North Indians. So this rosacea, most of the people doesn't like it. In India you might like it, but in abroad they don't like it. So this rosacea can be treated by can be treated by IPL laser. We'll go into further. The photo aging and oily skin, right? Oily skin is nothing but whatever things that you use for whatever chemical peel that you use for acne is nothing but oil regulating things. Next. So arginine is used for lips actually, to some extent. Arginine can be used on lips and under eyes also, but you have to be very careful with that. So actually it is not used in a prime of you know, it is not used in a mainline drug. It is used in an to adjuvant. It is used as an adjuvant to glycolic acid. You know, when you have a peel, suppose you have a mixture of, like, you know, lactic acid, glycolic acid, ascorbic acid, which is vitamin C, and arginine. So arginine is used to lighten the skin actually. So, and some kind of collagen synthesis also takes place, and I don't think acne it works, but it works in hypersensitive skin. You know, according to the depending on the peeling agents that it is mixed, we can say about the indications. But this I can't say like this about the indications, because there is no specific peel of arginine. Next. Salicylic acid, you find you get you see, this is alpha hydroxy or beta hydroxy. I was confused. So beta hydroxy. So this beta hydroxy peel actually it goes into deeper layers and works on acne and inflammatory acne. This salicylic acid is available from 15%, 30%, 60%, and 60%. So 15% can be used in open pores and oily skin to dry the skin, and salicylic acid 30% can be used in from mild to moderate, and salicylic 60% can be done in severe cases. So this salicylic acid can be this salicylic acid and glycolic acid is available in face washes also, and salicylic acid the famous brand for salicylic acid foam wash is for acne is Salicylic foam wash. You guys can write it. It's from Cipla. So Salicylic foam wash 1% or Salicylic DS 2%. So Salicylic foam wash, whenever you have an acne patient, trust me, give this Salicylic foam wash. You find a good result along with Acne Star soap. Next. And this salicylic acid is also used in seborrheic dermatitis. Remember that. It can be used in seborrheic dermatitis. It can be used in fungal infections. Salicylic acid 1% can be used in fungal infections also. So like, you know, like Tinea copitis, it is nothing but ringworm. Next. So TCA peel. So TCA peel is a trichloroacetic acid. This is one of the dangerous peel, and the same way it is one of the good peel also. So it improves the skin appearance. TCA works by removing dead skin cells and stimulating new cell growth. Actually, TCA mostly you have 10% TCA, but in some mixed peels, you can mix this TCA 10% is mixed. So when you have this TCA peel 10%, it is fine. But if it is 25%, then you can't, you have to be attentive while doing this procedure. We can use it in melasma, but make sure that whether it is a dermal melasma or it is superficial melasma, and you can use it in neck pigmentation, you can use in body pigmentation, you can use in body lightening, body lightening, you can use it in underarm, you can use it in grayons. Like, there are some patients who ask for the grayon darkness also. So any sort of darkness, any sort of pigmentation can be treated with TCA, but make sure you were attentive while doing this TCA. So it softens our acne scarring. So it can be used in acne also, but you guys don't use it. So, and reduces pigmentation, minimizes age spots, freckles, and freckles. TCA peel can be used. TCA 25 can be used. Like, freckles are small spots. What you can do is you can take a brush and you can apply only on to that region, only on the small drop. You should not have a drop completely. Okay, I'll say you that. Yeah, I'll advise you later how to apply the peel. Next one. So black peel. Black peel is a wonder for acne. So black peel gives an immense result for acne. So actually it has an antibacterial properties also. Black acetic acid, black vinegar, salicylic acid is the main this thing. Actually, this is an organic peel. Akar brand is good for Akar, good actually. And it is used for mainly acne and oily skin. Remaining, I don't see. It can be used in whiteheads, blackheads, pimples, pustules, nodules, and cysts. It gives a very good result. Next. Oh, how many pages are left? Actually, COVID
I
patients,
think we have about 17 slides.
COVID warriors' first instruction is not to talk much.
Actually,
How many pages are left?
so 18.
18 pages are left. What is the time? What is the time that till now I was?
So 3.
Oh, it is one. I was speaking since 1 hour 15 minutes. Yeah.
1 hour.
So
10 minutes.
you guys can take a screenshot. I'll give you an outline. I have given already an acne. So go to the image. Oh, no, back. So sorry, forward. No. We have an acne image. So this is what it happens. So you have a bacterial accumulation there. So there is a sebaceous gland secreting. See, especially when it comes to women, when you have a menstruation, you find a single acne or inflammatory acne exactly 1 week before the menstruation. So what other people teach when they go to the institutes or they just show that this is an acne peel. See, when you are not able to treat acne in a dermatological way and in a cosmetodermatological way, obviously, nothing, right? So the way you treat an acne is different. See, patient, if they approached you, they might have gone to 5 to 6 clinics till now. People who has a main concern of acne, they go to dermatologist. When a dermat is not doing procedures, they obviously come to these cosmetology centers. I have very good result in acne where we can clear acne within 15 days. So now this sebum secretion is released during luteinizing hormone. This luteinizing hormone is released in the mid of the menstrual cycle. So most of the hormonal changes at these three days whenever the ovum is released. So obviously there are changes in the body. So obviously you find some kind of sebum secretion a lot, and which in turn there are a lot of clogs that were formed, and obviously you have an outburst of acne. See, treatment everybody can do it. Prevention of acne is more important here. You have to concentrate on prevention. See, while doing chemical peeling and while giving some sort of medications, it is nothing but, see, giving medications is nothing but treatment. Dermatologists treat, and cosmetology and the clinical cosmetology prevents the acne outburst. So which one is more valuable? So almost all prevention is more valuable, right? Because treatment, it can be treated by giving any antibiotic or applying a topical antibiotic like clindamycin or niacinamide. So clindamycin with niacinamide, and along with that, you can advise some kind of isotretinoins, which are steroids. So in this way, but so this can control the acne. But what is the main motive of the patient? It should not occur. So this is where you have to stand. The next slide. Go to the next slide once. So now coming to the treatment part of acne. The first thing is salicylic foam wash. You guys can write it, because you might have your sisters or you might have your brothers or who has this acne. So now coming to the acne, the first is Acne Star. Acne Star soap has some kind of benzoyl peroxide. Benzoyl peroxide is used to dry the skin. So along with the benzoyl peroxide, so that is Acne Star soap. Along with Acne Star soap, salicylic foam wash. Salicylic foam wash 1% or salicylic DS 2%, which in turn has salicylic acid 1% or 2%, which is used in active acne or non-active acne or oily skin or any kind of acne prone skin. So along with that face wash, along with that face wash, we can advise some kind of antibiotics like clindamycin with niacinamide. Niacinamide has a function. Niacinamide is used along with yellow peel also. Niacinamide lightens the skin, lightens the acne spots. So clindamycin is an antibiotic. So clindamycin in combination with niacinamide work effectively with acne. So there are some kind of there are some kind of topical tretinoins. Topical tretinoins can be given topically, or it can be given by orally. When you go with orally, when you take it orally, you have to always advise the minimal dosage, because you are treating the patient by some procedures. So try to check it out whether you are getting a result or not. If you are advising this isotretinoins and everything into the medication, so obviously you are doing nothing, you are bluffing the patient. So just see whether your procedure is working or not. So advise according to that, you have to change your medication part. So isotretinoin 20 mg can be given once in a day for 5 days. Actually, most of the doctors advise isotretinoin 40, but I don't advise isotretinoin. Isotretinoin cannot be given for lactating mother, cannot be given in pregnancy time, and cannot be given in PCOD patients, and it creates some kind of hormonal disturbances. And the next one, oral isotretinoin. Apart from that, actually Vitakind Zit can be taken. Vitakind Zit, most of the doctors doesn't identify the underlying cause of acne. Mineral deficiency is also an is also a cause for acne. So in that case, acne can be treated by this Vitakind Zit tablet, multivitamin tablet, Vitakind Zit. You guys can write it, Vitakind Zit. So triamcinolone, I don't find it. Next, you can go to the next. So lasers. Can we take 2 to 3 minutes of break?
Yes, sir. No problem.
Meanwhile, you guys can write something. How much time I left? I think, how many slides more?
So they're less. 14.
Right. So laser is nothing but light amplification by the stimulated emission of radiation. So actually, when it comes to dermal lasers, what are the dermal lasers that were used? IPL laser, diode laser, and NDIAG Q switch laser, PicoSure laser, and CO2 fractional laser. Most of the lasers are covered. Now, IPL laser works on the mechanism of photothermolysis, which means, no, this is a different subject. Actually, I need a break for 2 to 3 minutes. If you can go ahead, can you go ahead? Change the slides. Next. Get into other topic. Next. Scar revision. So I'll just explain this. I'll take 2 to 3 minutes of break. So when it comes to vampire facial is nothing but, vampire is nothing but a devil, right? It sucks blood. So as blood is involved as plasma is involved in this procedure, it is called vampire facial. Vampire facial is nothing but take a derma roller. If you take a derma roller or a derma pen, so it is especially used in acne scars or for non-surgical facelift, or in most of the cases to rejuvenate the skin also. So when you have an acne scars, what is a scar? What is actually a scar? Scar is nothing but there is a fibrosis beneath the skin. So what happens with the scar when you have an acne, right? So when someone is disturbing that acne, so it turns into wound. So the wound healing takes place and the fibrosis takes place. Now we can go see. Suppose we have these COVID patients, right? Now Remdesivir is the FDA approved drug that was given in COVID. So how are patients getting recovered? In lungs, the particular fibrosis is happening. In severe cases of lungs, if the CORAD score is 5, so they have this ground glass appearance of patchy appearance in the lungs. So these ground glass patchy appearance or the damaged lung, how does it heal? It has to be healed, right? So it is healed by this Remdesivir antiviral drug. So obviously fibrosis takes place. So even there is fibrosis in the lungs, right? So in minimal cases, you don't give this Remdesivir. Why? The fibrosis should not be happened in the lungs. So that is why people were concerned whether there is a complete cure for COVID or not. That is what. So when you take this, when you create an so now coming to the vampire facial, you are creating an artificial, you have a pits of acne scars and everything, right? You have seen an image. So you are taking a derma roller and you are applying on the skin. So when you have this derma roller, it is 1 mm or 1.5 mm. When you are hurting the skin, so it creates some kind of bleeding, which when you are mimicking the skin, so whenever the bleeding is happened, so obviously the skin thinks that there is some injury that was happened to me, so that I can heal it. So I should heal it. In that way, the collagen induction takes place, one, and the second one is whatever scars that you have revised with this injury, it heals again. It starts healing again, and obviously you find an even texture. This is the principle behind the acne scars. So for that, you have to do the first one you have to do is microneedling. If you don't have the microneedling, is done by derma roller, which costs you 200 rupees. And apart from derma roller, you have to go with derma pen. Derma pen is nothing but it is a machine with the cartridge. So this cartridge can be this cartridge should be changed for every time or every patient. So this cartridge, it works on a mechanism of to and fro. So it pushes the needles out, it takes the needles in. So in this way, when you are trying to have this on the whole skin, so you are creating some kind of injury to the skin. So obviously this is the mechanism behind it. So now coming to the non-ablative lasers, or nothing but microneedling RF. In microneedling RF, obviously you have this radio frequency, radio frequency is where it helps not to create much injury to the skin. So this radio frequency microneedling, how it works, it has the same cartridge, it impinges into the skin, and obviously when it is released, you find an injury over there. So out of this microneedling, so what are the treatments that we can do on the same mechanism? So stretch marks, we follow the same mechanism. Acne scars, we follow the same mechanism. And scar revision, any kind of scar revision on eyebrows or anything can be done by the same mechanism. So any kind of scar revision or stretch marks can be done on the same mechanism. So you guys can go through the PPT. I'll come back in 2 minutes or 3 minutes. So how many? Okay, we'll go with lasers immediately. Can you go to the next PPT? Sorry. CO2 fractional laser, it is not necessary. Actually, if you have a high-end practice, then go to the CO2 laser. Next, micro needling. You can go through this once. I have already explained this.
Dear participants, thanks for your support and watching continuously. Even I am not getting whether lunch break happened or not. So thanks for that. And those who are all in forensic odontology fellowship, note down all the treatment procedures. Without knowing that, you cannot defend these practitioners in the court of law. So we have to know all the procedures, and we have to protect both the dentist and patient, and justice should prevail. So we have to take note of the emerging disciplines and how it is being practiced, and how patients are getting. Initially, patients used to come with a hell lot of respect, and they will say, please do this, that. Later, they will go to court and they will change their personality. So we have to be careful, and according to the ethics, we have to support the justice. So take note of all the treatments. In this way only we are connecting our field, the forensic field. I won't say superior, but responsible to all the works being done in the clinics. Thank you.
Thank you, sir, for giving such a key point actually, and will help, I hope will help every dentist to be a stand against all those patients who are just like talk about complaining after any sort of failure in the treatment or something like that. So
Make
this
the
will be-
recordings such a way. आप देखे होंगे लोन देने पहले बैंक वाला कितना डॉक्यूमेंट में साइन करता है. Like that, you keep bunch of documents. They have to sign before starting the treatment. So once they are keeping adversely, meeting the lawyer and sending the notices, or they are coming to the fight and all, then you will be in a position to sue them. Let them, if they are suing you in lakhs, in turn you sue them in crores. So that is the only solution. See, we have our nuclear weapon. Pakistan also having nuclear weapon. Why we do have? We do have because if you use, we will use it. That is all precaution only. We are not going to blackmail them, but at the same time you have to counter blackmail. If you are, otherwise the judge will not listen to you. Judge will put various sections. So it is big. Our CCAS council going to release their manual. OMIKI council also going to release their manual. There we will be clearly giving the forms, consent forms, various other documents, mutual contract documents. So when you go with the procedure, you will be in the safest place. Because I don't never say don't do that, any procedures. You have to do. Certain times you can make the patient as a experiment also. You go and take the RTA report, even our All India Institute of Medical Sciences in Delhi, they do have clinical deaths. During the trials, people are dying. If you get the report, it will be shocking to you. But why they are protected? Because they are doing the documents and they have the every proof with them. That that doesn't mean you cannot do clinical trial. The whole world is interested in India to do the clinical trials. The thing is, the patient should know that they are being specimen. And sometimes patient used to come and say, "Koi baat nahi, aap kar do, dekhta hai." Then you make it on record. So that is the only way. So you have to come to persons.
Yes, Dr. Rajiv.
So,
We can.
so actually, before entering into the law, I just want to make some keynote points. See, when only the patient, if you are not confident in dealing with the complication, never do a procedure. So most of 80% of the patient accept the complications in India. 80% of the patients, and that too, that 20% of the patients, if you are not caring them. In India, the first and foremost thing is you have to pamper the patient if something goes wrong. But and one more thing, you have to project yourself that you are very informative. So when you have, I find, like, why don't I get a complication? Definitely everyone gets a complication. So every doctor at one point misses something. But whatever in depth, if I go, I'll explain the patient that this is a medical condition where you already have gone to 4 or 5 dermatologists and you have approached me. Now most of the doctors might have done a superficial peel, and now I am going to the deep peel which causes injury to your skin. So obviously he'll accept, because he trusted you and he trusted you. The moment that they trusted you is nothing but you or something unique. So always respect the patient. Most of the cases where they approach courts is completely because of the arrogant nature of the doctor. That is what. If you are very polite, if you say that this is what happened and this is what happens, you send an article to them and they'll get convinced. And doctor, what is the solution that I have to get? Then start treating. This is what you have to notice. And consent forms, we have a documentation part. Actually, the consent form has to be taken by everyone. So you might have gone through this microneedling, right? Microneedling can be used in scalp, which is not, and then mesotherapy, and then face rejuvenation. And once you do this microneedling, after that you apply some kind of serums or anything onto the skin to enhance the results of the skin. Right. Next. No, come to the first laser. So coming to the actually laser works on absorption, means the light is absorbed and emitted, and spontaneous emission. Laser exactly works on the, suppose our skin. Laser is nothing but light. So coming to the electromagnetic spectrum, before getting into the laser, 400 nanometers to 700 nanometers wavelength of light which is passed from the sun can be visible to our eyes. 400 nanometers to 700 nanometers. So when it is like, when you have 380 nanometers, it is not visible to your eye. And you might have seen in science exhibition when you are in younger kids who has this prism. When you have this prism, whenever the light is passed into a prism, it goes into it divides into 6. You can see the different wavelengths on different colors of the colors, where you find 7 colors, which is nothing but VIBGYOR. VIBGYOR is violet, indigo, green, violet, indigo, blue, green, yellow, orange, red. So the first one is visible wave, violet. Violet has a wavelength of 400 to 700 nanometers, 400 to 420 or 430 nanometers. So this is how. Actually, now coming to the how laser works. Actually, a particular in IPL, we have 3 wavelengths, 3 to 4. It works on the multi light emission, which means the different wavelengths. It ranges from wavelength to wavelength. Suppose if you have this IPL laser have filters actually. The filters that are used for acne is 495 nanometers to 535 nanometers. So the light have different wavelengths which is released from this laser light. As they have multiple emissions, whenever it is applied on the heat, whenever this light is up. So whenever this light is applied on the skin, obviously you find some kind of the skin absorbs the light, and whatever condition that it want to treat. Suppose if 495 to 530 nanometers does some kind of acne repair, so the treatment happens, because that kind of light is absorbed by the chromophores that were in our body. Especially the laser works on the chromophores like hemoglobin and melanin, and the other one is water. So what are these chromophores? Chromophores are nothing but what the particles that were where the laser is absorbed by them. So oxygen, in laser, in IPL laser. Can you go to the next slide? Next slide. So now coming to the IPL laser. So whenever you have this, I was talking about IPL laser. Whenever the light is emitted with a 495 to 530 nanometers, suppose these nanometers has to work on hemoglobin. So obviously it works on the hemoglobin in the body, absorbs the light and get diffused. This is how the mechanism is, it get treated. So whenever the light is nothing but energy is nothing but thermal energy. So whenever you have this heat is absorbed by this laser, by the skin, by the blood, by the hemoglobin. So whenever this is absorbed, whatever this laser functions, so obviously it get dissolved, it get healed. This is one. When it comes to IPL laser is used in hair removal, pigmented lesions, skin rejuvenation, scars. It is not used in scars, and benign vascular lesions. Coming to the vascular lesions. Vascular lesions is nothing but you might have noticed some kind of patients having this blemishes, right? I have said, right? We can find this in actress Sai Pallavi, who is a South Indian actress who have these blemishes on their skin. But it looks so attractive for her, so she remained it. But most of the patients doesn't like it. So there are some vascular lesions like nevus, where you find a vascularity on the skin. A red color of vascularity is found on the entire and some part of the skin. So it is nothing but the hemoglobin is present in that. So nothing but blood contains hemoglobin. So whenever you pass this light into that vascular region, these vascular lesions get healed, and in turn it heals and gives a normal skin appearance, right? So the next one is hair removal. See, we have already spoken about hair. It has bulb and everything, bulb, and you have a melanin in it. So this IPL laser, whenever it is applied on 690 nanometers to 770 nanometers, the wavelength, the light is passed, and in that stage, the melanin in the melanocytes and the melanin pigment inside the laser, inside the hair follicle, absorbs the laser light, and it burns, right? Whenever the energy is absorbed, automatically it burns, right? So this is why it is not called a permanent laser hair removal, because some kind of you don't know how much intensity is absorbed by melanin pigment in the hair follicle. So obviously it doesn't hurt. So it doesn't burn completely. So you have a still bulb. So the anagen phase growth starts again. So there is reoccurrence of hair. That is why it is called laser hair reduction. So it might, whenever it burns, it has to burn from the dermal papilla region. So the complete follicle has to be burned, and this is done by electrolysis. Electrolysis is a process where you have a small needle where you pass through the small probe, where you pass through the follicle, and you go to a bulb, and you produce the heat at the bulb. So obviously the follicle comes out with the probe. So when it comes to IPL laser, it is not like that. The light is emitted, and the light is received, absorbed by the skin. So only to certain amount it gives a result, right? So the next slide, I think then skin rejuvenation is nothing but photofacial. Photofacial can be done at the nanometers of 530 to 595 nanometers, where when you exfoliate the skin and you create some kind of injury to the skin, right? So diode laser works with a mechanism of 880 nanometers to 1300 nanometers. That is why diode is expensive, and diode is exclusively used for hair removal. So you have to shave the hair first, and you have to apply this light, like whenever you have to apply the ultrasonic sound gel, and you have to produce light on the whatever desired amount you want to. So with the diode laser you can get result within 1 to 3 months. The process of follicles that were coming out will reduce in diode laser. So apart from that diode laser, the complications are like, whenever you have used this laser, if you are not used in a certain way, obviously there will be a superficial burns, and there will be a pigmentary changes, and in some cases scars might occur. So that is what next. So hypertrichosis or hirsutism is nothing but there is lot of hair growth, abnormal hair growth over the body. Hypertrichosis is nothing but there is excessive production of hair. Next. Go to the no, CO2 we can't discuss. CO2 fractional laser works on a mechanism where it has a fractions. They have a probe where it was divided into fractions. Can you go to the third slide from here? No. Yes, next. We don't have image, right? So whenever you have this CO2 fractional laser, it can be applied on the lips, it can be applied on the scars, it can be applied on the scars where acidic attack takes place. So it is completely related to dermatology. Next. It is all done. Now coming to the Nd:YAG laser. Nd:YAG laser is used in tattoo removal, and it is used in carbon laser facial. So Nd:YAG laser tattoo removal, for tattoo removal, it has two probes. It has two wavelengths, like 1034 or 1064 nanometers, which is effective in removing black pigment and brown pigment. And when it comes to 532 nanometers, it is useful to remove the green pigment and blue pigment or any other pigments. So if the wavelength is high, so obviously the pigmentation, like it works on a mechanism. So when it comes to laser, right, so it works on the photoacoustic effect actually. Can you just slide it? So Nd:YAG laser, there are lot of pulses that were released in milliseconds. So whenever the light is emitted, the next one. Yeah, whenever a heat is absorbed, whenever heat is released, means light is released, the pigment in the dermis layer, you see, whenever you have a tattoo, the tattoo ink goes into a dermis layer. So whenever you have a light with 1034, 1064 nanometers, so obviously it targets the black. Whenever that wavelength of length is matched by this black or brown pigment, it absorbs the light, and it actually, what happens is it explodes into different particles. It exports into small particles. So some are dissolved into the blood, comes out where it is all light, right? The light produces heat. So these particles are absorbed by the light, So it is gone half. So some pigments explode and remove and explode. Some pigments explode and after exploding, it becomes into tiny particles where either it is absorbed by the light or it can be absorbed by the next session whenever you do a next session. So some are normally gradually removed by the metabolic activities. So that is what Q6 laser is a technique by which a laser machine delivers very short pulses at 8 nanoseconds at very high peak power, granting the most effective acoustic effect with no thermal interactions with the tissue. I want to explain this point. So it works on the thermolysis effect, photothermal effect. So IPL works on the photothermolysis effect. So what is photothermolysis effect? The tissue is targeted. Suppose the light is targeting a tissue. So only that tissue is damaged. So the light that is produced does not damages the tissue apart from that. Only the selected part of the tissue gets damaged by the light. So you are treating only selected part of the skin. So that selected part only gets hurt. That is what. And here it works with it doesn't work with the dermal interaction. It works with a light and sound effect. So it creates some kind of sound where both of them helps in removal of tattoo or any kind of birthmarks. So this Nd:YAG laser is indicated in birthmark removal. It is indicated in Keflic spots, and if it is indicated in blue kind of lesions and tattoo removal and carbon laser facial. So you guys can see here also the natural the chromophores that were applied, some people might think that, when you have this, what about the natural chromophores, which are nothing but pigments that are absorbed by the light? But actually in this laser, most of the ink that is most of the tattoos that were there, they have this natural chromophores in it. So these are these are absorbed by the light and they get lighter. So it is a process of lighting. It is not like, in a single session you get a result. Next one. Done. Now microdermabrasion. I already done. So you can see the microdermabrasion brightens a dull complexion, even out skin tones, because you are abrading the skin. Obviously the dead skin is gone out. So you can mix the microdermabrasion treatments with the chemical peeling also. After doing microdermabrasion, I have done peels also. It is quite dangerous, but don't peel. It is not dangerous actually. You find a lot of complications so just wait. Just after getting experience, you can do it. Next. Done, right?
Yes,
So
sir.
now you can ask queries. Meanwhile,
I think we don't have the queries.
okay.
Is anyone having queries or something? Kindly put up in the chat box. And meanwhile, I would really like to thank Dr. Rajiv for having such amazing sessions they've taken, that they have been quite humongous, I would mention. And I only feel that sitting there and listening to you has been like a whole journey that we have completed into cosmetology and aesthetics. So that's really good. And thank you so much, sir, for enlightening with such great knowledge. And it'll be quite profitable for everyone who have actually listened to you.
Thank you.
Thank you, Dr. Rajiv. People
Yes, sir,
like
thank
you should connect this dental, medical, and cosmetic world together. And we are proud to have you on board for Council of Cosmetology and Aesthetic Science, and also Dentrance Careers. So we keep calling you, and you are very much well inside. So thanks. Thank you very much.
Thank you.
Sir, take care, sir, because you have
Right.
shown us, great effort after being cured with corona. We are very much proud of you, and we would really appreciate your presence here, despite of this situation, we are like, it's quite appreciable, sir. It's quite appreciable. Thank you, sir.
Thank you.
Thank you, sir. So in a line of row, we are having another speakers also lined with up, and I might request every participants whosoever wish to have lunch or something, they can have them along with the lectures only. We are quite flexible with our platform. So if they want to have any lunch or something, they can have it together with the session. They can have the lunch enjoyed. And with that, continuing with the lecture sessions, we are having now Dr. Vijay Maitre with us. I welcome you, sir.
Hello, everyone. Am I audible to everyone?
Yes, sir, you're audible.
Yeah.
So moving ahead about the speaker, I would really acknowledge you all about the speaker of today. So Dr. Vijay Maitre has graduated from prestigious Nair Hospital, Dental College, Mumbai, and has masters in periodontics and oral implantology. He pursued fellowship in aesthetic sciences from Institute of Laser and Aesthetic Medicine, Germany. He is a fellow of AIOI, Peru, South America. He has more than 20 national and international publications on his credit. He conducts workshops on laser dentistry across India. He is a renowned speaker invited by many laser companies across India. Currently working as an assistant professor at ACPM Dental College, Dhule, and consultant laser therapist in Aurangabad. He is awarded at International Health Professional Awards under Category Excellence in Laser Dentistry 2019. He runs his laser specialty private practice in Aurangabad. So moving ahead with this, I forward the stage to Dr. Vijay Maitre for the session.
Yeah. Should I start with screen sharing?
Yes, sir. Yes, sir.
Give me 2 minutes. Yeah.
Yes, sir. I request every participant to kindly enjoy the session. If they want to have something eateries with them, they definitely can have.
Hello.
Yes, sir. You audible?
Am I audible?
Yes, sir. Yes, sir.
Just give me 2 minutes. I'll adjust the screen.
Okay, sir. No problem.
So let's start. Okay. Hello, everyone. This is Dr. Vijay Maitre. I'm conducting a session on laser, new order of the era. Now, the science of today is the technology of tomorrow. It is not that we use technology, we live technology. And we have many recent advances in dentistry which made our work easier. Initially, we supposed to do the root canal procedure with the hand file, then comes the rotary. Then initially we were using IOPA films for the radiography. Then comes the RVG. Apex locator has made our work easier. Intraoral camera made us visualize the oral cavity properly. Then comes the endodontics microscope. which give us a proper idea about the root canal anatomy and all. Then we have few advances in surgery also, that is electrocautery. We can have a proper bloodless field, and we can use this for hemostasis and all. And after that, here comes the laser. Then what is the laser? What is a laser? Basically, what comes in your mind when you think of laser? This laser show, or we have seen this stuff in some Hollywood movies, laser rays protecting some gold and all. And even we have seen such kind of thing in Hollywood movies, right? But laser is light amplification by stimulated emission of radiation. The advantages of using laser is reduced need of anesthesia, greater comfort during and after surgery, hemostasis and reduced risk of bloodborne pathogens, high patient acceptance of the treatment, reduced stress and fatigue for the practitioner as well as staff. It is a leading edge technology for the pursuit of higher level of patient care. It produces less collateral damage as compared to electrocautery, and overall it will improve your clinic image also. Now, if we compare laser versus scalpel versus electrocautery, we have few differentiating points and few advantages of lasers. We need anesthesia in case of scalpel and electrosurgery, where in laser no or minimal anesthesia is required. Bleeding will be present in scalpel. There will not be any bleeding with electrocautery and lasers. Suturing will required in case of scalpel surgery. Electrosurgery and laser will not require any kind of sutures. The healing time is less as compared to electrocautery with the scalpel and lasers. The patient comfort level, it is very comfortable with lasers. Now the tip flexibility, we know that the blade don't have any flexibility in the tip, but the lasers have a flexibility of the tip. The sterilizing effect, the laser and electrocautery have self-sterilizing effect. So you need not to sterilize it. And if at all you want to clean it, you can use the chemical sterilization. That is, you can wipe the tips with the spirit and all. Okay. Then hemostasis, there will be an excellent hemostasis with the help of laser, and there will be minimal scar formation with the laser as compared to electrocautery and scalpel. When used efficaciously and ethically, laser are exceptional treatment modality of the treatment of many clinical conditions that dentists treat on daily basis. And patients today they are well aware of laser and their advantages and disadvantages. You know, nowadays patients are Google and YouTuber patients. They will search everything on YouTube and Google, and then they will approach to you. So you should give a proper option of laser in your practice for the treatments. Now let's classify the lasers. The lasers are classified into surgical lasers and non-surgical lasers. In surgical lasers, we have hard tissue lasers and soft tissue lasers. The examples of hard tissue laser, ER laser, ERYSGG lasers, and CO2 laser. In soft tissue lasers, we have diode laser, NDR laser, and CO2 laser. In non-surgical laser, we have diagnostic laser, which include Diagnodent pen for the caries detection, and laser Doppler flowmetry. Then the low-level laser therapy, which is also known as a therapeutic laser, and miscellaneous, the laser curing light, which we are using in the past for the curing of composite. Now, what is the difference between hard tissue laser and soft tissue laser? Basically, a hard tissue laser have two different wavelengths, 2790 nanometer and 2940 nanometer. They are erbium family lasers. And in soft tissue lasers, we have 810 nanometer, 940 nanometer, and 980 nanometer. Now, hard tissue laser works on both soft tissue as well as hard tissue, but soft tissue laser will work only on soft tissue. The cutting efficiency of hard tissue laser is more as compared to soft tissue lasers. the cutting operation mode, that is non-contacted mode with the hard tissue lasers, and with soft tissue lasers, it has to be used in contact mode only. The low-level laser therapy cannot be performed with the hard tissue lasers, while low-level laser therapy can be done with the soft tissue lasers. Healing of tissue, healing is faster than soft tissue lasers in a hard tissue laser. Healing is slower in soft tissue laser as compared to hard tissue laser. Then the cost of the machine, hard tissue laser are very expensive laser. It costs more than 20 lakh rupees for a hard tissue laser. And soft tissue laser, it is less expensive. It costing from 1.5 lakh rupees onwards. Am I audible, Gagandeep? Hello?
Yes, sir. Yes, you're audible.
Yeah. Okay, fine. Now let's come to the advantages and limitation of the lasers. We have already seen the advantages of laser, the reduced need of anesthesia, greater comfort and XYZ. We'll come to the limitation of lasers. All laser required specialized training and attention to safety precaution. And one more important limitation, it is slower than the traditional method. Like if you are using scalpel, it will take hardly one second for a single incision, but ultimately for laser, it will take more time. And the depth of the cutting will depend upon the power you are using. If you are using less power, the depth of the cutting will be 1 millimeter only. For example, if you want to take a 5 mm deep incision, then again you have to repeat the same incision 5 times, 1 mm, 1 mm, 1 mm, 1 mm, and again 1 mm. One more important limitation is no single laser can perform all desired dental application. For example, for soft tissue laser, you need to have soft tissue lasers. For hard tissue procedures, you need to have hard tissue procedures, hard tissue laser. Then for low level laser therapy, you need either soft tissue or low level laser therapy laser. See, soft tissue laser can be used for soft tissue and hard tissue both. Soft tissue laser can be used for soft tissue and low level laser therapy. Low level laser therapy can be used only for low level laser therapy. So that ultimately investment is more if you are planning to do all procedures with the laser. Now coming to the laser safety. If you are using lasers, you should have particular eye protector with you when you are working on the patient. Then this eye protector has to be used for operator, your assistant, and your patient. Now, depending upon the wavelength, you have to choose your goggles. These are typical laser safety goggle costing around 10,000 rupees each. Now, they have a specific wavelength protection. For example, if you are using hard tissue laser and you have a soft tissue laser goggle, then it can be used for hard tissue. If you are using hard tissue laser, then you have to use the goggle for the same. If you are using soft tissue laser, then you have specific wavelength protective goggle that you have to use. You cannot use hard tissue goggle for the soft tissue laser. Okay. If you don't have that protective goggle for the patient, you can keep a moist gauze and you can keep a eye protector over it. Ask the patient to close his eyes, and whenever you're operating, make sure your assistant has to wear the goggles. Now, what is the laser safety distance? If you're operating in laser, operating with lasers, at least the person who is present in radius of 2.5 meter has to wear laser safety goggles, or they will have a retina hazards. Okay. Now, high volume suctions. Whenever you are using lasers, you have to use high volume suction for the fumes to be evacuated, one thing, and the scattered radiation has to be evacuated with the high volume suctions. Non-reflective surface instruments. Now you have to use non-reflective surface instrument to prevent the reflection and trauma to the adjacent tissues. These are specific plastic mirror probe and tweezer. This we have to use during the laser procedures. Specific foot controls. Now every laser machine have laser safety foot controls. Even if accidentally you press the foot control, it should not emit the lasers. One more important point, you have to stick this sticker outside your operatory so that whenever you are working with laser, the person should not enter directly, or else he will have trauma to his retina, right? So you have to take care. Now coming to the low level laser therapy. Low level laser therapy is a smaller, less expensive, and it operates in milliwatts. The range is 1 to 500 milliwatts, where the soft tissue laser works in 1 to 10 watt. Biostimulation mode. What is accomplished while performing a biostimulation? That is low level laser therapy. It increases the collagen formation, it increases the circulation, it increases the fibroblastic activity, that is tissue regeneration, and it increases osteoblastic activity, that is bone regeneration. Now, what are the indications of low level laser therapy? Healing of ulcer, effective modulating a local and systemic response of the body, aphthous ulcer, acceleration of wound healing, then pain therapy. These are few indications of low level laser therapy. Laser wavelength used in dentistry. Particularly, we are talking about diode laser. Wavelength ranges from 800 to 980 nanometer. Now, different laser company have a different wavelength. Most probably, they are patented with the company, the particular number. For example, 940 is patented by Biolis. 980 is used by many companies, but it is not patented as such. Recently, Dentsply has launched 410 nanometer laser, that is a blue frequency laser. Now, the diode laser delivery system, it is delivered fiber optically. The mode is continuous wave mode, gated pulse mode, and contact. It has to be used with the contact with the tissue. Now, it is a very this is very important point, that it is poorly absorbed by the tooth structure, so that soft tissue surgeries can be performed safely in proximity of enamel, dentin, and cementum, as well as bone. It is an excellent soft tissue surgical laser indicated for cutting and coagulating the gingiva and mucosa, and soft tissue curettage, and for the circular debridement in periodontal surgery. Now, laser uses in dentistry. In periodontics, it is used for pocket therapy, non-osseous gingival surgeries, phenectomies, gingectomies, gingivoplasties, biopsies, periodontal regeneration surgeries, then depigmentation, removal of granulomatous tissue, osseous recontouring, for osseous recontouring, you have to use hard tissue laser. Now, in implantology, it can be used for second stage surgery and peri-implantitis. Now, hard tissue lasers can be used for osteotomy, but I personally don't recommend it. Now, in fixed prosthodontics, it can be used for crown lengthening procedure, osseous crown lengthening, toughening, formation of ovate pontic, altered passive eruption management, modification of soft tissue around laminates. In removable prosthodontics, it is used for epilis, denture stomatitis, residual ridge modification, tuberosity reduction, torus reduction, soft tissue modification. Then in pediatrics and orthodontics, it can be used for exposure of teeth, soft tissue management of orthodontic patients. Oral surgery, it can be used for biopsy, operculectomy, apicectomy, oral soft tissue pathologies. Now, in apicectomies, you need a combination of soft tissue as well as hard tissue lasers. In operative dentistry, it can be used for detection of caries, removal of decay painlessly and untraumatically without affecting the surrounding healthy tissues. For removal of defective composite, GIC, conformal restoration quickly and easily without using the anesthesia. It can be used for bleaching of teeth. Now, in endodontics, debridement of canal, removal of smear layer, disinfection of canal, and instrumentation of canal. Now tell me, is it possible to do instrumentation with the lasers? No, you cannot use laser for the instrumentation. Instrumentation or BMP, biomechanical preparation, has to be done with the conventional instruments, that is files. The disinfection of canal can be done with the soft tissue lasers. Now, many practitioners have many excuses for not using lasers. Let's see them one by one. First, more important excuse is it is too expensive. Then learning curve is too steep due to safety precautions, then not better than traditional treatment, and ultimately it is a mind game. Those who want to use, they will use, and those who don't want to use, they will refuse with any reasons. Chase your passions and money will come. Chase money and you may never find your passion. So laser is not for earning the money, it is for your comfort. Okay, keep this thing in your mind. Now let's see few the diode laser which are available in Indian market and which one to buy. Like Dentsply is the highest standard laser, we can say, not standard, but it's a good laser. I have used already. The wavelength 970 nanometer infrared wavelength, 660 red, and 445 blue wavelength. It is imported by Dentsply, Sirona. It is a well-known brand, best in class. Cost, it is very expensive, costing around 6 lakh rupees for the highest model, and the lower one costing around 3 lakh rupees. Service provided by Dentsply. One more important thing here, I'm not marketing for any laser company or anything, but if you want to buy the lasers, I'm just comparing few laser systems so that it will be easy for you to buy the laser. Then this is Zero Laser Extend. This is a lower or mini version of the Dentsply. BioLase Unicorn Denmark, wavelength 940 nanometer, imported by Unicorn Denmark. It is a well-known brand. Bleaching attachment is present, very important point. Then low-level laser therapy can be done. It can be done used for TMJ therapy and all. It has a wireless foot control. The service is by BioLase, and product costing is for iLase. First model, iLase, it is around 1.8 lakh rupees, and EPX is around 3.5 lakh rupees. Then we have some Indian companies, DPI laser, wavelength 980 nanometer, power 100 milliwatt to 8 watt. Basically, it is imported model, imported from China. I should not take the name, but it is imported from China. Then bleaching, it can be used for bleaching. Low-level laser therapy attachment is there. They have a specific disposable tip, so you can change it after every patient. And this is the economical range of the laser. The cost is less. It is costing around 2 lakh rupees. IMDSL, most commonly used in endo procedures, marketed by IMDSL India, wavelength 980 nanometer. This is a Indian laser, IndiLase or MiniLase, wavelength 980 nanometer, power 8 watt. Indian company, you can get a good service with this, costing around 2 lakh rupees. Although lasers have been used in dentistry for many years, clinicians have barely been able to tap the enormous potential of this form of energy. The decision to use laser should be based on proven benefit rather than claim advantages by the companies. So you have to decide whether you want to use the laser in your practice, or like the company person is insisting you, that's why you are buying. Okay. Now let's coming to the procedures, the gingectomy and crown lengthening procedures. Basically, the difference between gingectomy and gingoplasty. The gingectomy is the excisional removal of gingival tissue for pocket reduction and elimination. Gingivoplasty is the selective reshaping of the gingiva to attain more physiologic contour. Let's come to the case discussion. This is a typical case of orthodontically induced gingival enlargement, horrible ortho with horrible oral hygiene. So in this case, we have performed gingectomy with the help of lasers. This is a follow-up photograph, and we have achieved a good gingival contour. Again, a case of orthodontically induced gingival enlargement. This is a pre-operative photograph, and here we have given a proper incision, and we have maintained a proper gingival zenith. For canine and central incisor, it is in one line. For lateral incisor, it is 2 mm below. Same on this side, and this is what we got post-operatively. Now, what is a gingivoplasty procedure? It is a selective reshaping of the gingiva. In this case, the mesodistal distance is more as compared to incisor-cervical. So we have done slight amount of gingivoplasty as well as slight amount of composite modification. Let's coming to the operculectomy. Now, acute peritonitis is a severe condition of inflammation, and there is a lot of confusion between the dentist whether to extract the tooth or whether to go for operculectomy. Now, in such cases, when to go for operculectomy, the tooth has to be erupted in arch. It should not be buccally or lingually placed. The bone loss should be there distal to the third molar. Then you can go for a operculectomy procedure. And one more important thing, the tooth should be at occlusion level of the 7. It should not be supra-erupted or infra-erupted. Now, this is a typical case of operculectomy. In pre-operative photograph, you can see the whole crown of 8 is covered by the gingiva, and post-operatively, we have relieved the occlusal surface of 8. Okay. Now, coming to the frenum-associated problem. As we all know, what is phrenectomy and frenotomy? Frenotomy is the relocating the frenal attachment, creating zone of attached gingiva between the gingival margin and frenum. Frenectomy is the excising the frenum, including its attachment to the bone. Let's coming to the frenotomy case. This is a conventional method. We have to hold it with the help of hemostat, and we have to give the incision for upper and lower side, and this is what we got post-operatively and post-operatively after healing. Now, with the conventional 2 hemostat method, again we have to hold the frenum, and we have to give the incision from upper side and lower side of the hemostat. This is an immediate post-operative view, which we have to undermine and suture it. This is a immediate post-suture removal visit, and you can see the scar formation after 3 weeks. Now, these are the different techniques to perform the frenectomy. Miller's technique, that is lateral pedicle flap. PY-plasty, that is performed for the maxillary frenum, and Z-plasty in this Z shape. Now, while performing these procedures, it is very difficult to manage the lip, and also it is very difficult to give suture without the help of assistant, so that your assistant will retract the lip and you will suture the lesion. But with the help of laser, you don't need to suture it. Just remove the tissue, and the tissue will be healed in few days. This is another case of laser frenectomy. This is a typical case of penis descent. This is the post-operative photograph, immediate post-operative photograph, and we can see the beautiful healing after 2 weeks. Now, in cases of lingual frenectomy, it is very difficult to manage the tongue, and there are many vital structures present on the floor of mouth, including the Barton's duct. In such cases with lasers, it is very helpful for us to perform the frenectomy without giving any suture or anything. Now, vestibuloplasty. Shallow vestibule will have a problem and difficulty in brushing, that will lead to plaque accumulation and mucosal injury because of brush. Now, in conventional vestibuloplasty, we have to give a vestibular incision followed by undermining the lesion and suturing the lesion. In this case, also you need assistant for suturing. With the help of laser, you don't need any kind of help from the assistant. The operator can alone perform the laser vestibuloplasty procedure. You don't need to give a sutures in this case. Coming to the gingival depigmentation, melanin hyperpigmentation usually does not present a medical problem, but patient may complain their black gums are unaesthetics. This problem is aggravated in patients with gummy smile and excessive gingival display. Now, these are the various methods to perform the depigmentation that include scalpel surgical technique, and the subcategories are slicing or partial thickness flap technique, bone denudation, burr abrasion, scraping, gingectomy. Then we have lasers, electrocautery, and free gingival graft. Now, this is the typical case of melanin hyperpigmentation. In this case, I have performed partial thickness flap on one side and laser on other side. Now, this is the immediate post-operative photograph of the partial thickness flap technique, and this is a after laser, and this is what we got. Excellent output. Here with the partial thickness flap, you can see slight amount of repigmentation. With laser, there is no amount of repigmentation. Now, while explaining the patient, you have to make sure that you inform the patient that the depigmentation is not a permanent treatment. The repigmentation occurs within 2 to 5 years. So it is very important that you should inform the patient. Now, skin tag removal. Skin tag removal can be done with the help of laser. Here I have used the Zolar laser, Zolar diode laser, and the skin tags can be removed easily. Now, second stage surgery. Second stage surgery can be performed easily with the help of laser, especially in case of full mouth implant where you have multiple implants. And in such cases, if you are performing second stage surgery, then you have to open whole arch. And you all know that if you are performing a full mouth implant, then ultimately exposing the bone will lead to loss of alveolar bone, at least 0.5 to 1 mm. So in such cases, laser is a excellent tool to do with. Now, coming to the conclusion, I have a video for a conclusion. I hope it will.
I think due to the network issue, we are disconnected with sir, and I think we'll wait for a minute or so that he can join back. I would appreciate the patience.
Hello.
Yes, sir.
Actually, I have some network issues. We are left with a few slides. Should I continue?
Yes, sir. Yes, sir.
Just a minute.
It's showing still its screen sharing.
Just a minute. Yeah.
Yes, sir. No.
I'm showing a video. This is just for a upgradation.
So meanwhile, I would really like to ask every participant, those who all use lasers in their clinical practice, kindly mention their names or kindly mention, yes, I can see that whether they use lasers or not. And I hope that after this lecture, all the people who are not using the lasers would definitely opt for one. And so we have a query that can you guide us about if someone is not using lasers in their clinical practice and if they are choosing to have one, so which one should they opt for in first, like which should be inexpensive also and will be kept up into their clinical practice and can use for a lot of procedures, so which laser can be used?
Screen sharing is paused, I guess, Gagandi.
So you can cancel and reshare.
Just a minute. Yeah.
So I can see only 3 participants those like use lasers. Why don't others? I feel laser is the emerging demand right now.
Is it visible now?
Yes, sir, it's visible.
Yeah. This is a small video. Why you need upgradation if you want to be in the competition. Okay. This is usually I end up my presentation with this only. I'm sorry, just a minute.
I think it's a very small clip.
So basically, this beggar is using the machine. So we need to upgrade ourselves if we want to be in the competition. See, if 10 beggars are there and if only one person is using the machine, card swap machine, then he will lead the competition, right?
Exactly.
So it is very important for us to upgrade ourselves in the dentistry, right? This is a conclusion. I do conduct courses on laser dentistry all over India. Soon we will be starting the fellowship with laser dentistry with Dentrance. If you have any doubts, any issues, you can contact me. This is my clinic address and this is where I work. If you have any questions, you can ask the questions. We'll start the question one by one. Okay, Gagandeep?
Yes, sir. The first question is, can lasers replace scalpel?
Partially, we can say partially. Say it's not like fully we can replace the scalpel with the lasers, but definitely in 90% of cases we can replace the scalpel.
Okay, and so okay, it's screen sharing is stopped. So in cases we know that hard tissue lasers are used to they're used for cutting of the tooth also.
Yeah.
So
right.
and also we know the fact that laser cutting does not provide us with smooth finish of the tooth cutting. So what do we opt for that after the laser usage?
Okay, fine. See, that depend upon which type of laser you're using. See, if you're using erbium laser, that can be used for soft tissue cutting. Now, depending upon the procedure, you have to select the particular mode so that it will control the depth of the cutting. For example, if you are using it for crown preparation, you'll need a different setting. If you're using for tooth preparation for the laminates, then ultimately you need to have a different setting. And again, the use of the hard tissue laser will be very specific to the tooth preparation only. But for tooth preparation, I don't think anyone will spend 25 lakh rupees for the tooth preparation with the lasers, right? Personally, if you ask me personally, I don't use hard tissue laser as such for each and every case, but most of the cases are managed with the aeroter only. But for soft tissue procedures and procedure like bleaching, TMJ pain, biostimulation and muscle pain and all, in that cases, you can use the soft tissue lasers. Okay.
And sir, as I asked you the first question, like a person who is opting for lasers for the first time, so which laser should he opt for in the clinic, and which can perform about like a lot of procedures?
Okay.
So which laser should you opt
See,
for?
for example, if you're a beginner and if you want to buy a laser for the first time, go for a soft tissue laser first. Do perform soft tissue surgeries and everything with the soft tissue lasers. And if you feel that your clinic turnover is that high, then you can afford 25 lakh rupees to spend in a single machine, then only you can go for hard tissue lasers. Or else there are many options for soft tissue lasers from 1.5 lakh rupees to up to 6 lakh rupees. There are many Indian companies, there are many foreign companies, and there are many Chinese companies also who sell lasers at cheaper rate. But ultimately it depends, your purchase will be depend upon the service they are providing, post sale service, the different modes which are available in the laser machine. That is very important. So if you're planning to buy laser, go for soft tissue laser. Then after some time, if you're sure, you can go for hard tissue lasers also.
Okay. And so, since we know that lasers are only like a straight beam, so they are, into a very big disadvantage of not cleaning the apical deltas of the tooth. So in
Exactly.
that cases, I feel lasers are a failure, right? For the
No.
apical deltas.
So no. See, basically, right now there are some lasers who fire laterally also. They are in researches. I guess Dr. Chandrasekhar Yavagal from Hubli has developed a laser who can fire laterally. So that laser can be used for the root canal disinfection very perfectly. And the iodide out, the apical deltas and all. For that, you need instrumentation to remove the pulp. The disinfection of the canal that can be performed with the help of lasers. Okay.
Okay, but it won't go into the apical deltas, right?
Yeah, right. Of course, it will not go into apical delta, but ultimately you have to put the laser tip into apical 1/3 and you have to activate. They have a depth to penetrate in that particular region. Okay. Someone has asked, can laser replace 100% scalpel 100%? No, it cannot replace 100%, but I am sure that it can replace almost 90%. I'm a periodontist. I have replaced around 70% of procedure with the help of lasers. Okay.
And one more thing, sir, like recently what I have been going through the articles and everything, there is a release of, I think, cold lasers. There's something like cold lasers.
Cold laser are also called as low level laser therapy. Basically, they can also called as a therapeutic laser. Therapeutic laser, they can be used for muscle pain, TMJ pain, and all. Okay, and that can be used for bleaching as well.
Okay.
Yeah.
So
Any
we
more
end up
questions?
with the questionnaire. Yes, sir. We end up with the questionnaire, and thank you so much, sir.
Yeah, sure.
Amazing oration it was, and the presentation was really amazing. Thank you, sir.
Thank you, Gagandi.
Thank you so much, sir. So with the sequence, moving ahead, we are having the next speaker. Dr. Akshita Sethi. Can I have Dr. Akshita? Team, kindly help me to unmute Dr. Akshita. I think she is not here with us for the presentation as of now. So kindly spare us with 1 or 2 minutes. We'll back with the schedule, and we'll see whether we are having the next lecture or we are having the paper poster and the paper presentations. Kindly spare with us. Okay, so we are back again. I think we are not having the last speaker for today. So we'll be starting up with the poster presentation shortly. So all the poster presenters, kindly, the speaker will be there with us by 5. So in between, we can have a few posters conducted, and few posters will be conducted after the lecture. So kindly, all the presenters, kindly prepare yourself and gear up, and we'll be starting up with the poster presentation shortly. So today's participants for the poster are Dr. Sheikh, Dr. Sunaina, Dr. Mohammad Shadav, Dr. Stuti Mohan, Dr. Sumit Agarwal, Dr. Shalu Jain, Dr. Ketan Rajput, Dr. Soham Chatterjee. So we all have these participants for today's poster presentations. So we might take few right now. So do I have Dr. Sheikh with us as the first presenter? The technical team, kindly help me to unmute all the presenters so that I can have their presentations with me.
Sir, pranam.
please watch some online videos on this and read about it in the book. So basically, whenever there are different notes. Normal note is a resonant.
Okay, so everybody, can everybody see the poster? Do we have Dr. Sheikh with us? Yes, Dr. Sheikh, can you see the poster? Dr. Sheikh,
Yeah,
am I audible?
yeah, yes. Can you audible?
I think your voice is a bit low.
Okay. Now? Now it is clear?
Yes, yes. You're able to see the poster?
No, I cannot able to see.
You're
I can
not
see
able to
only the,
see.
yeah, I can see only the,
I'll just do that once. Wait a second. Okay. Now you can see the poster.
yeah, I can see.
Okay. So I'll be giving you 5 minutes to present the poster.
Okay.
Okay. So your time starts now.
Okay, we can start now.
Yes.
Okay, good evening to all. Happy Teachers Day. So the topic today is postmortem pink tooth phenomenon. So actually in forensic odontology is an emerging field. So much discussion has been done in the morning sessions by the keynote speakers, Dr. Venkatesh. Yes, so this field involves two aspects. One, identifying the individual. That means identifying the human identification can be done in the criminal cases or for mass disasters or paternal disputes. So identifying the cause and collectively collecting the evidence for the event is also an important aspects of the forensic odontology. So here one human identification. The second one, we have to find out what is the causes of the death. So how it occurs. So forensic odontology, the scientific study of the death. So that is the two aspects. So in human identification, lot of recent advancements has been come. So the knowledge in the bite marks, ruboscopy, palatoscopy, age estimations, so gender identification, molecular techniques. So much advance has been come out. And so it is very easy to identify the individual based in the medical or legal aspects. But still some questions are unanswerable, like pink tooth phenomenon. So this is most commonly seen in the post-mortem. So as a dentist, usually if you think, if you remove the term pink tooth, so what strikes in our mind? That is what we learned in the oral pathology textbook. That is the pink tooth of memory. Yes, the internal resorption of the teeth or the pink tooth of memory. What is that? That pinkish appearance of the teeth that can be occurs because of the pulpal infections on some unknown reasons. So what will happen? You can see the pinkish color of the crown. So that is a different entity. So in postmortem also you can get a pinkish tooth. Okay, so pink tooth can be seen in both in the living and also in the postmortem. So the first appearance, if you go for history, okay, or in literature, the first appearance of the tooth is seen noted in 1829 by Bell. So he first discovered the pink tooth phenomenon, that is the appearance of the pink tooth in the forensic investigations. So it gets popular or becomes familiarized during the Christian murder case in 1953. So that time it gets more popular. So after that, so much studies has been done in 1953, 1980. So much researches has been done to find out the cause of this pink tooth. So what is the cause? For everything, there should be a cause, how it happens. So what is the procedure behind, or what is the mechanism that is behind this phenomenon that we have to study. So the most common causes is asphyxia, that is the decreased oxygen supply to the body. It can be due to any reasons, can be due to strangulations, or it can be due to drowning or intoxications like carbon monoxide poisoning, or suffocations. So one more criteria has been added, that is the cadaveric decomposition. If you notice all these cases, most of the time what will happen, the cause of death can be a violent or in an unnatural way. So that is one of the important criteria. And second point to be noted is the appearance of the pink tooth. Okay, after the death and the appearance of the pink, there is a time delay that has to be noted. And third point, most commonly, all these cases reported
ऐसे
in the
वही कर दें
literature
यार,
that shows
उसमें बैटरी
either
खत्म हो रही है
the
इसलिए इसको लगाना
suffocation,
पड़ा।
or mostly there will be the body is recovered after a very long period, most commonly 1 to 2 weeks period of time, or sometimes even 1 month. So the other environment, that is the moist environment, can also influence the formation of this pink tooth. So when it will happen? Usually it is most commonly seen in the young age group, most commonly in the anterior teeth, and involves the multiple tooth, and it will be more progress in the cemento enamel junction and the root. What is the reason for this? So but first we have to go for the pathogenesis. What is happening? Why this pink tooth occurs? So most of the conditions, what we noted is the patient is recovered, the body is recovered from the this thing decomposed state. So most of the time what will happen is the head will be in up down positions like drowning. Okay, so the advanced decomposition, and this difference can cause increase in the cranial pressures or in the intrapulpal pressures, that will cause the leakage of the RBC from the blood vessels. So there will be a hemolysis, there will be a breakdown of the, yeah, there will be a breakdown of the products, hemoglobin products, that will diffuse into this dentinal tubules, that will give the appearance of the pink tooth. So the seepage of these products entered into the dentinal tubules will cause this pinkish appearance. So why it is common in the young age? Because young age will have larger dentinal tubules and more number of dentinal tubules. Older individual, because of the secondary dentin depositions, the penetration will be less. And in cemento enamel junctions, because of the less enamel structure, you can see the more prominent pinkish color. So one study has been done, that is the ground section has been done for the pinkish tooth. In that, what they have noted is in ground sections that be a red brown discoloration of the dentin can be seen, but enamel is not affected. But in the decalcified sections, everything is normal. So totally in conclusion, what we have to decide is pink tooth is considered as a cadaveric alterations that can be expressed after a violent death. But in 2080, a recent study states that after examining 8 autopsy dental specimens, what they are telling, it can be because of the environmental alterations, because of the moist environment, that can be an influential factor in considering or the appearance of the pink tooth. So always remember, so much controversies are there. So more forensic experts should be needed to do some studies, or scientific studies must be encouraged in this field to find out what is the actual cause, whether it is because of the violent death, or this it can be occurs because of the influence of the environmental factors. So that will solve the mystery of this pink tooth phenomenon. Thank you.
Thank you so much, Dr. Sheikh. Thank you so much. It was quite an informative one, actually, and it's a fact. But we have a question that why pink tooth? You're talking about pink tooth after like death, the post-mortem
Yeah,
case.
yeah.
Do you really think that pink tooth is viable by that time?
No, it will not be viable because of the pressure. What will happen is the RBCs can be go for hemolysis or extravasated. So because of autolysis also it can be done. So that hemoglobin products can seepage into the dentinal tubules. So still lot of studies has to be conducted because now there is not much key articles in the literature. So they have done very limited studies. So still we have to go for a lot of studies in this field.
Okay, amazing. So it'll remain like pink only after having even the hemolysis of RBCs?
No, it will be there for almost after that for some period of time, the pinkish color will fade off.
Can we tell about what is the period?
Usually depends on, but no literature is there. Which they told it fades almost 1 month in the period of time.
I really expect that you'll be finding out the period for this.
Yeah.
Okay. Thank you. Thank you so much. Thank you so much. Dr. Akshita?
Yeah.
Okay. So you are with us?
Yes.
Okay. So all the participants, we had one poster done. So we have the speaker with us. We'll be moving ahead first with the session. And after that, we'll be conducting the post presentations, the rest poster presentations. So I highly appreciate the patience. And with now, we'll be moving up with the next session by Dr. Akshita Sethi. Ma'am, I forward the stage towards you. First of all, I would welcome you on the platform and for the session. And I forward the stage to you for the presentation.
Thank you, Dr. Gagandi. Thank you for all your efforts and last few weeks for making this conference go smooth and helping us get our schedules on time. A good evening to all the delegates and all the fellow students and mentors. Happy Teachers' Day to all the mentors and especially Dr. Venkatesh Kuppaswamy for giving me this opportunity to take over the schedule today. As he had promised us a year back when we met in all the conferences in Mumbai, Delhi or Bangalore, today he has implemented of India, giving us all the opportunity to be here and help mentor and gather more dentists and help their careers to go better. As in the early sessions, we heard about hair treatments, types of hair losses, and clinical cosmetology. So the medical management and clinical treatments on hair treatments were spoken by Dr. Rajiv. I'll be taking over to you on the surgical part, that is about hair transplantation. How do we go about it? What are the procedures available in the market? What are the invasive or more promoting factors on the hair transplantation done all this while, and which is more safe for a dentist to start off, and how we have to train ourselves. Coming to hair loss, as we all know, hair loss can be of 3 types, mainly because of the hormonal imbalance, or it is cause of the nutritional deficiency, or it's cause of any kind of a stress, which can be epigenetic. You could see your parents or your forefathers at the age of 25 or 30, they could go through a hair loss because of epigenetic factors. It could be a severe nutrition deficiency, it could be stress, it could be some kind of a wrong usage of hair products, or an expired shampoo or conditioners or some chemical treatments which could trigger the hair loss. So basically, when hair loss happens, initially people don't notice it unless they see a kind of thinning when they take a selfie or there's a picture present. That is when it is more evident. Initially, at least the older guys used to skip the normal hair losses. Nowadays, people are more conscious. when they see 50 to 100 hair fall, at least they try consulting a doctor and trying to get some serums or medicines or intake or some kind of home remedies. Basically, when it comes to hair transplantation, we prescribe this treatment only in condition where there cannot be any medical management taken to prevent hair transplant, and also any kind of a intake of medicines or PRPs or PRFM will not help you get back your new follicles and hair growing from there. So in hair transplantation, there are two types. One is FUE and other is FUT. FUE, it is follicular extraction unit, and the other one is follicular unit transplant. Both are surgical methods. The difference is only on how invasive the procedure is. FUT is an old method. It was a golden standard method. I think up to 2011 or 12, most of them were using FUT. So here what used to happen, they would anesthetize the donor area. The donor area is always your parietal and the occipital area, because these particular follicles do not attract the androgen receptors, thereby not converting the testosterone to dihydrogenase follicle or perifollicular fibrosis. So when we extract follicles from the parietal or the occipital or even from the chest or beard area and implant it on the bald area, the hair growth remains more permanent. Of course, it goes through the anagen phase, the catagen phase, shedding phase, but it doesn't go through the androgenetic alopecia hair loss. The baldness is recovered there. So what they do is they anesthetize. So under anesthesia, we have the tumescent mix. So the tumescent mix is nothing but your sensocaine, the lignocaine, and saline, which is widely used globally, and 1 ampule of adrenaline ampule to prevent the superficial bleeding. So how much you have to use each of it, it usually the anesthetist decides and your doctor decides. But most of the time what happens in the market, what I see is technicians are doing the surgeries. So they have one fixed formula which they would have picked from a dermat or a surgeon. That is what they are circulating. But technically, we can give 56 milligrams per kg per body weight of anesthesia. So if you're about 70 kgs, we should avoid going above 490 milligrams of anesthesia. The combination, what we do in our practice or what I do in my practice, I don't exceed beyond 7 milligrams per kg per body weight. That is the anesthesia combination I use for extraction and for implanting. In case of an FUT, back then we were giving blocks, occipital block, and then we use incision with the scalpel, say about 20 centimeter, starting below your ears, and we strip off. We do complete excision of the strip, and trichophytic suturing is done. Under suturing, we give a fine needle suturing closely. I think Dr. Gagandeep, the slides are moving very fast. Could you just slip on to start the slide where I can show you them the FUT procedure, how it looks like? Not this. Can you just go back?
Ma'am, guide me towards the slides, I'll move.
I think maybe forward it. The ending, we could go through the ending. No? Yeah, this one. Yes. So this is basically your FUT procedure. So here what happens, we draw a line about 20 centimeter. We shave that area completely, only the areas where we have to do the excision. Then we clip the hair upward and downward. We anesthetize, we give a nerve block, and then we do infiltration on that area. We try to bulge minimum up to 5 mm. Then we use a scalpel and we make a C-shaped incision. And with the help of a scalpel, we excise that area, including the subcutaneous tissue up to the dermal papillae. And then Subcutaneously, we suture it with a continuous suture. Again, a superficial suture is done, which is known as a trichophytic suture. The suture is removed, say, though it is an absorbable suture, still they don't absorb really well on the scalp. So we ask the patient to come back on 10th or 12th day. So some amount of suturing we need to cut off for them to feel more comfortable. Then the strip is taken and they are slivered. Literally with the scalpel, they are chopped. They're made into minute slices and then the follicles are segregated. So basically in this particular strip for any human, we do not get more than 3,000 grafts. We can get anywhere between 2,000 to 3,000 grafts. That's one disadvantage of this procedure, and plus the scarring. A definite mild scar is seen. Again, it depends on the